Council meeting for Thursday, November 12th, and I'm calling our meeting to order. Let me start with our Indigenous land acknowledgement. We would like to begin by acknowledging that the land on which we gather and which the region of Peel operates is part of the treaty lands and territories of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land. In particular, we acknowledge the territory of the Anishinaabeg, Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, the land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have this opportunity to work on this land, and by doing so, give our respect to its first inhabitants. And with that, I will go back to our clerk as well. You're going to give us the protocols for today's session going forward.
Thank you, Mr. Chair, and good morning. I'm going to provide a very shortened review of the protocols for electronic participation in this council meeting. Voting for this meeting will be conducted verbally. For procedural votes that do not require a recorded vote, the chair or I will call for any objections. If you have an objection, indicate your name and objection. If no objections are stated, the motion will be deemed to be adopted. For recorded votes, I will call upon each member in alphabetical order based on last name. I will confirm the vote for each member. If you do not respond when called upon to vote, I will call your name a second time. If you do not respond to the second call, you will be recorded as abstaining from the vote, and your vote will count in the negative as a nay vote. If you're participating electronically and are leaving the meeting, please send an email to council@peelregion.ca to indicate that you're leaving the meeting. If you leave the meeting for any votes thereafter, you will be marked absent. We will now commence the meeting with roll call. Mayor Brown? Mayor Brown? Councillor Carlson?
Here.
Thank you. Mayor Crombie?
I'm here, and I believe Mayor Brown is just wrapping up his press conference.
Okay, thank you. Councillor Demerla?
She's having some technical issues, and she's going to sign on when she can, but she is here.
Thank you. Councillor Dasco?
Hi there, I'm here.
Thank you. Councillor Dillon?
I'm here.
Thank you. Councillor Downey?
Present.
Thank you. Councillor Fonseca?
Good morning, I'm here, thank you.
Thank you. Councillor Fortini?
Good morning, here present.
Thank you. Councillor Groves?
Good morning, I'm here, thank you.
Thank you. Councillor Innes?
Good morning, present.
Thank you. Councillor Kovac?
I'm here. Good morning.
Thank you. Councillor Mahoney?
Good morning, present.
Thank you. Councillor McFadden?
Good morning, everyone.
Thank you. Councillor Medeiros?
Here.
Thank you. Councillor Palashi?
Good morning.
Thank you. Councillor Parrish?
Here.
Thank you. Councillor Raz?
Here, I am having technical difficulties this morning, so if I go on and off, that's why.
Thank you. Councillor Sato? Councillor Sato? Councillor Santos?
Yes, good morning.
It's Mayor Crombie. Councillor Sato was taking the call from her car, so she just may be having some technical trouble as well. She was on earlier.
Okay,
Hi,
great.
sorry, I am here. Can you hear me?
Yes, we can hear you. Thank you.
Okay, thank you.
Councillor Sinclair?
Present.
Thank you. Councillor Starr?
Here.
Thank you. Mayor Thompson?
Present. I see Mayor Brown is on now.
Okay, thank you. Councillor Vicente?
Here.
Thank you. And Mayor Brown, I believe I've heard you're present.
Yes, I am here now.
Thank you. Yep, we've got quorum.
Thank you. And let the record show, I think their colleagues should know and their constituents that Councillor Carlson, Downey, and Parrish used to dutifully come in even on these COVID days, and I give them credit. And today they dutifully stayed home as per the direction of our medical officer of health. So well done to all. Next item up, declarations of conflict of interest. Are there any declarations of conflict? Seeing none, I guess in a roundabout way, I have a conflict in that I'm rather conflicted about the fact that I have to announce this is Andrew Farr's last meeting. Many of you know that he's taken on employment to our neighbors to the west, and it's the ultimate example, as I said to him myself, of that phrase bittersweet, because we're certainly very happy that he's moving on to with his career and going to a great place next door in Halton. But boy, are we conflicted about the fact that we're losing one of our finest. He served us so incredibly well. I must tell you, as chair, his direct, insightful approach to problems was very, very welcome by me and I think the whole team. And so I'm really not surprised that people like him, like so many of my staff, seem to get plucked to go elsewhere because we have a very good crew here. So I will tell Andrew as well, I had a chat with the chair next door and said, you know, you finally got us back for stealing Nish. So turn around is fair play because he's got a good one. So Andrew, congratulations to you. Andrew, if you like, I would welcome if you wanted to have an opportunity just to say a last comment to your council colleagues.
Well, thanks, Chair Ianika, and thank you to all of you around the table. I've certainly appreciated all your support over the last year and a half. I know the last 6-7 months have been certainly challenging for all of us, and I just want to thank you. I've grown a lot in the last year and a half, and it's because of how you push us and to get better and push us to do a better job. So I've learned a lot. I'm really excited for what the next challenge holds, but every day that I'm working here this week and next week, it's just that little bit harder as I say goodbye to a lot of wonderful people I've known for 20 years. So I wish you all the best in your endeavors, and I will be, I'll admit, I'll probably watch some of these meetings in my spare time from time to time as things go. So good luck and thanks a lot.
Andrew, we're wishing you every success from all of us. Well done. Okay, that brings me on to the minutes of the October 22nd Regional Council meeting. Moved by Mayor Brown, seconded by Mayor Crombie. All those in favor, are there any opposed? Councillor Medeiros, with regards to the minutes?
Yeah, that's fine.
Oh, very good. Okay, so that is dealt with. I'm then on to the approval of the agenda. I'm going to read this out because we have some additions, then I will take any questions or comments. The movement of the agenda has been moved by Councillors Parrish and Downey that the agenda for the November 12, 2020 Regional Council meeting include a delegation from Dr. Sergio Borja, a Corporate Chief of Infectious Disease and Medical Director, Infection Prevention and Control, William Osler Health System, regarding COVID-19 and hospital capacity, to be dealt with under Delegation 7-2. And further, that the agenda for November 12, 2020 Regional Council meeting include a delegation from Kulvinder Gill, Peel resident and physician, regarding concerns with the Region of Peel's response to COVID-19 to be dealt with under Delegations Item 7.3. And further, that the agenda for the November 12, 2020 Regional Council meeting include a communication regarding ROPA 30 to be dealt with under in-camera Items 24.8. And further, that the agenda for the November 12, 2020 Regional Council meeting be approved as amended. It's been moved and seconded. All those.
Sorry,
Councillor Medeiros, did you have something with regards to the agenda? You're up.
Yeah, and that's what I requested. So it's just an addition. It's an in-camera item related to item 15.2, but I would request that we go in camera to receive legal advice. And I've already spoken to our Patrick through Catherine Locklear. So.
Very good, and that's duly noted, and I will add that to our agenda as well. So to my colleagues, will you approve the agenda as
Mr. Chair?
amended? Mayor Crombie, yes.
Sorry, it's Councillor Raz. I'd
Oh,
like
sorry.
to add changes to the Conservation Act under other business.
Very good, and can you just be clear? I'm sorry, I missed it. The exact item you want added, please?
Changes to the Conservation Act under other business.
Okay, very good. So we will add that, changes to the Conservation Act under other business. Thank you. Mayor Crombie, I see your hand. Yes?
Yeah, I was trying to get in. So I do have an updated agenda, and I don't have a 7.3 and 7.2. What are they?
Yeah, those were just what I read in the motion. Those are the additional items with regards to a presentation from Sergio Borja and a presentation from Dr. Kulvinder Gill. Two delegations. Okay? Okay, any other further speakers to the amended agenda? Seeing none, I have a motion from Parrish and Downey. All those in favor, are there any opposed? If not, that is carried. Thank you. That brings me to the consent agenda. So we have our delegations to deal with. COVID report. That takes us to communications asking for consent. Item 9.1. On consent, 9.2. On consent, 9.3. Consent, 9.4. Consent, 9.5. Consent, item 10.1 is held as a presentation. Items related to human services, item 11.1 on consent. Thank you. Item 11.2 on consent. Communications, item 12.1. Consent. Items related to planning and development, 13.1. I believe we want that held because the commissioner does want to make a comment with regards to 13.1 as well. So if we could have that held as well. 13.2 on consent. Thank you. 14.1, communication item.
Hold, please.
To be held, 14.1. Thank you. Items related to enterprise programs and services, 15.1. On consent, 15.2 is to be held. 15.3. On consent, communications items, 16.1. 16.2. 16.3. All on consent. 16.4. On consent. Items related to public work, 17.1. On consent. 17.2.
Mr. Chair?
Yes?
Sorry, it's Pat Sato. I'm on my phone, so I don't have my agenda open, but can we hold the waste management minutes, please?
Very good. So item 17.2 to be held. Thank you.
Thank you.
Certainly. Communications items, 18.1. On consent. Items related to health, 19.1. On consent. Other business and inquiries from councillors we'll deal with then. The motions are then the bylaws. I'm just going to jump to the in-camera. I certainly know that we have to deal with 24.1, 2, and 3 in-camera. 24.4, would we have consent on?
Mr. Chairman, if I could bring it to your attention, the temple box is down and we just can't get that stuff to open up to go through everything on that. Can we somehow get that fixed, please? Thank
Okay,
you.
through to staff, the temple box is down and we're doing what we can to sort that out. Thank you very much, Mayor Thompson. Coming back to in-camera items that might be held on consent, certainly 24.1, 2, and 3 are to be held. 24.4. Do I have consent? Very good. 24.5 is on consent. 24.6 of the in-camera, also on consent, and 24.7 needs to be held. Very good. With that, Madam Clerk, over to you. A motion to deal with the consent agenda.
Thank you, Mr. Chair. Got a motion moved by Mayor Thompson, seconded by Councillor Dasco, that the following matters listed on the November 12, 2020 Regional Council agenda be approved under the consent agenda items, and this does require recorded vote. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes, I support.
Mayor Crombie in favor. Councillor Demurla? Councillor Demurla? All right. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini? Councillor Fortini? Councillor Groves?
Yes, in favor.
Councillor Groves in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Counselor Raz in favor. Counselor Sato?
Yes.
Counselor Sato in favor. Counselor Santos?
Yes.
Counselor Santos in favor. Counselor Sinclair?
In favor.
Counselor Sinclair in favor. Counselor Starr?
In favor.
Counselor Starr in favor. Mayor Thompson?
In favor.
Mayor Thompson in favor. Counselor Vicente?
Yes.
Counselor Vicente in favor, and that carries. Thank you.
Thank you very much. So that brings us to delegation, and it's my privilege as 7.1 to be able to introduce Deborah Flynn, President and CEO, Greater Toronto Airports Authority, who's here along with Michelle McKenzie. You know, it is a privilege to have Deborah here giving her inaugural presentation to us here at Regional Council. May I say that when I go to bed at night and count my blessings after my first blessing, which is to work with such a great team of councillors and mayors here at the Region of Peel as chair, my second biggest blessing is the airport, because it's the rising tide that lifts all boats in the Region of Peel. And to have gotten Deborah Flint to be our new president and CEO there, let me tell you, she's in niche category. We've got a great police chief, and we got the person that everybody else wants to run their airports. I've had the privilege of speaking to her, and what a marvelous individual to have at the helm of the airport, and what a great backstory that she's come back home to us to serve in the Region of Peel. So, Deborah, with that, welcome to you and to Michelle. Your presentation, please.
Thank you so much. It's such a pleasure to see you again, Mr. Chairman, as well. And Director McKenzie will begin with our remarks.
Thank you, Mr. Chairman. We feel the same way as you do about our new CEO. So it's a great pleasure to be with you this morning, and mayors and regional councillors as well. So my name is Michelle McKenzie. I'm Peel Region's nominee to the Greater Toronto Airports Authority Board of Directors. Chairman, mayors, councillors, and regional staff, I want to start by commending you for the way that you've managed through this global pandemic. And I want to thank you for your public support of Toronto Pearson at this difficult time, particularly Peel Public Health and the way they've collaborated with the airport under Dr. Lowe's leadership. And so I'm delighted to be joined here today by GTA's new president and CEO, Deborah Flint. Deborah started her role in February of this year and brings decades of aviation experience from her time at Los Angeles World Airports, and Oakland International Airport. Deborah's born in Hamilton, Ontario, which also, by the way, happens to be where I was born. We're thrilled to have Deborah back in Canada to have someone of her caliber at the helm. Of course, when Deborah began, none of us could have predicted the challenges that 2020 would bring. Together with Deborah and the management team at Pearson, the board of directors has been working tirelessly to deal with the impacts of COVID-19. Sitting on the GTA's board of directors has taken on an added level of importance in these unprecedented times. As a former president and CEO of the Canadian Tourism Commission, I have to say COVID's impact to Canada's travel and tourism sector, airports included, has been staggering. Today, we're going to share with you how COVID-19 has impacted the Canadian aviation ecosystem and Toronto Pearson specifically, and how Toronto Pearson and the board are actively taking steps guided by our healthy airport commitment to rebuild confidence in air travel and ensure Toronto Pearson is prepared for the future and can return to its role as a national economic catalyst. You'll hear about how Toronto Pearson, together with McMaster Health Labs and Air Canada, are already doing important work on arrivals COVID-19 testing, gathering information to support evidence-based decision-making by public health and elected officials. I think there's an opportunity for GTA and Peel Region, Peel Public Health, to work together to safely introduce rapid testing at Toronto Pearson soon, like we've seen introduced at Calgary Airport in partnership with the Alberta and federal governments. Rapid testing could be a game changer. With that, I'll turn it over to GTA's President, CEO Deborah Flint, to walk you through the remainder of our presentation. Thank you.
Thank you so much, Michelle, and greetings once again to each of you. Such a pleasure to see you, though of course it would be even more enjoyable to do that in person, and we all stand strong in the belief that will happen one day. We can't wait for 2021 to get here soon enough. As you probably see and you know well from your years that Michelle is an incredible leader. She's very valued on our board, serving on both the governance and the human resources committee, and she's lended an incredible insight, which of course has been more important this year perhaps than ever. And I have to give a shout out to another one of Peel Region's own, which is also Director Hazel McCallion, who is an incredible leader, renowned for her wisdom and of course for her political savvy. A pleasure for her to be on the board as well. So I'll just frame up a few things from here locally and from an industry perspective to give you an update and look forward to dialogue and answering any questions that you might have. It's going to be no surprise to share with you as Michelle said, what's happening in the industry and how it actually manifests itself here regionally and in our streets and neighborhoods is nothing short of staggering. Airports are set and the industry is set to lose $100 billion. Sometimes the billions just flow through, and I think maybe this pandemic has reflected what millions of economic impact mean and what hundreds of billions of economic impacts mean, particularly when it's taken away, and how that translates into impacts on real lives, real homes, real communities, and regions and countries. That it has been absolutely the same for us at the GTAA. As you know, GTAA is a nonprofit, non-share capital corporation. We're funded by our own activities across the business. And with most of those activities having been centered around passenger volumes, we have suffered significantly. We've had to take many of the difficult decisions that you've seen others have to take as well, which includes, laying off, again, for no fault of their own, almost 30% of our workforce, implementing salary reductions as well for the board, for the leadership team at GTAA. And we realize that even if there was to be that miraculous vaccine or cure, medical solutions immediately or even into 2021, it will be several years, very much into 2024, 25 timeframe for there to be what I would call a quote unquote full recovery. But we recognize that this business really is forever changed. It won't be the way that it was. This is absolutely the case for Canada's largest airport at Toronto Pearson, but for all of my colleagues across the Southern Ontario airport network, as well as across the great country of Canada. So we all have to prepare for a new future and a new reality. We can turn the slides. Thank you for the person who was driving the slides. I appreciate that. That probably just covered my my remarks. So I think there should be the next page, if you don't mind. And so I'll talk a little bit about what we've been doing on site over the course of the last couple of quarters. Similar to the other cost cuts we've made, we reduced our capital program by hundreds of millions of dollars. It sits at about half of what was planned and mostly for projects that were underway. But we have taken advantage of the lesser activity to shore up our airfield. And it was twofold. Number one, to be able to do that work more efficiently. But number two, this airfield program that we implemented created 450 local jobs. That was very, very much needed at the time. You can see that our aircraft movements are down also by more than 50%. And accordingly, the aircraft noise complaints are also down by approximately 80%. We do have to realize, however, that as travel and traffic ultimately will resume, that we all have the expectation that some might welcome the reemergence of noise. I've actually gotten some emails from the public, when they're happy to see and hear an airplane, but we also know that noise is a serious disturbance, and we'll remain committed to continuing to work with our communities across the aviation sector to mitigate noise impacts. We also, as I reflect back on the last couple of quarters, and I think you might appreciate this, is that Pearson has played a very important role in the supply chain. And we know that many countries have suffered severely from disruptions in the supply chain. We've seen an over 60% increase in the amount of cargo flights. We actually have this new thing called freighters, which are passenger aircraft that were converted to full cargo aircraft, and we dealt with them actually at the terminal facilities in a very creative way, thanks to some of the amazing people that we have at the GTAA, ensuring that medical equipment, supplies, inventory for the manufacturing companies that are here in the country were all flowing. And of course, that became very, very mission critical. On that stead, as we think forward, that will be a very important element for us here in the region, as well as across the country, is to ensure that Canada's supply chain is very, very strong. And we also believe that that is an economy of the future. So there is an imperative for us to move away from paper-based processes, which are still very much in play in our cargo supply system here. We've convened several roundtables in the past with Minister Garneau and Minister Fedeli, with the Ontario and Canadian Chambers of Commerce. And we certainly have a call to action to ensure that our cargo and goods movement strategies are moved into place very, very quickly. What I just referenced about cargo and supply chain, et cetera, is also a reflection of cooperating and really the essence of partnering. I think, the word partnering has been used so much, but never has it been relied on as much as actually when we're in a crisis like this one together. So we take great pride in how we partner with our communities around. And I'll cite, for example, our partnership with the Toronto Airport Workers Council, which represents over 400 employers across the airport. In the midst of the layoffs, where over 13,000 people across the airport environment also were placed out of work, we've worked with them very closely to create worker support services and online training support services as well. Specifically in the Peel region, we've had very strong partnerships with what we know are needed, like the SIVA Food Bank, the Malton Black Development Association, Ogaden Somali Association, and Access Employment, just to name a few. The work of these organizations, of course, is more important than ever. And when we take that moment to think about the future and how we must be competitive, we know that the other currency for great cities, great countries, is the most efficient, effective, reliable, and clean transportation systems. And I have no doubt that that will not continue to be important in the scale of tomorrow's mega cities and competitive countries and economies. And so that will remain a priority for all of us. We're so pleased, of course, to see the continued advancing of the plans for the Eglinton Crosstown, the Kitchener GO corridor, all to Toronto Pearson. And we, of course, also recognize that there have been delays in the Brampton and Mississauga rapid transit connections, and we are hoping and also supporting that there is an opportunity to get those projects back on track in the year ahead. And we will continue to work and message and advocate for the regional connectivity solutions and stories. We heard from our transit roundtables last year in 2019 that integrated fares and integrated services across the region were an opportunity right there for the making and would bring great value. As I close out, I will speak a little bit about our healthy airport. I hope it's not a surprise to you. Many of you have come to the airport and toured, and we appreciate that. Councillors and regional staff and mayors, you're welcome at any time to come and see, how we continue to evolve, being at the top and the forefront, really, of the industry, taking advantage of the fact that the three largest, most notable aviation policy organizations are based here in Canada. We were the first airport in Canada, and really we tied with Boston as the first airport in North America to receive global healthy airport accreditation through Airports Council International. And that's a reflection of us very early on recognizing that we needed to change and to adapt and to do things differently and deploy new approaches to health. Because even if back then when we were contemplating this in April, if COVID had been fleeting, we believed and have seen come to truth that the expectations on health and hygiene in travel and in life in general was going to be different than it ever had been. So we're proud of all the Canadian and local firms that we've partnered with on innovation, from disease modeling and detection, like with Blue Dot, to other companies that are providing innovation through ultraviolet light, our hospital grade quality air exchange, which is best in class. Many of these innovations I hope that you have seen and heard about, and again, we're happy to show you with that. Just like airport security, whether it's post 9/11 or other significant challenging events, the aviation sector is renowned for its safety, for its ability to adapt to new threats and new risks. And we will continue to do that as we have done with a layered approach that involves the things that I've said, but also, of course, our very close partnership with other agencies, whether that's Transport Canada, the Border Services Agency, CATSA, Public Health of Canada, and of course, Peel Public Health as well. There continues to be a lot of action and collaboration and exploring solutions together, which is why I believe we've done a stellar job at the airport in our tools and our approaches and our practices to ensuring that it is a healthy environment. Lastly on that, you might have seen that we engaged in a very important, one of the kind of the first of its kind and largest scale testing pilot programs with Air Canada, McMaster University Health Labs, to understand and get scientific data towards quarantine. And thus far, those results are very, very positive in terms of what we're seeing with positive cases. Very, very few, less than 1%, and zero change in positivity between day 7 and day 14. That test with over 16,000 participants, the last participants came through the airport on October 31st. And so over the next few weeks, you will be hearing more about the actual official results. The results will be peer reviewed, tested deeply again, and a formal report will be available in January of 2021. Thank you in advance. We've been pretty vocal at GTAA and across the aviation sector about the need for sectoral specific support. We're the only G7 country that hasn't provided aviation sectoral support. Countries recognize that the airports, the transportation, logistics systems are the hallmark of innovation for countries when viewed on a global scale. And it is very important that this sector and the jobs that are just as we talked about, even in this region, have an opportunity to be restored and to be part of the workforce and the economy of the future. And so we're very pleased that just last weekend, we heard from the government that their intention to provide sectoral support. Most important to us immediately, as I stated, the difficult financial situation we are in is to receive rent relief from the federal government, but more importantly, to also have a system that allows us to safely, methodically, and nimbly be able to turn on and off travel corridors within Canada, as we still have provincial barriers, and also outside of Canada as well. We expect that we will have to coexist with this virus for many, many years, and we need the tools and the capacity to be able to do that as a country. So thank you. I know this is an important relationship for you all, with 25,000 jobs being directly facilitated by the economies around aviation at the GTAA, the over $200 million in direct procurement that takes place in Peel Region because of the GTAA. So thank you for the opportunity to gather with you this morning and to work with you in the months and the years ahead. And myself and Director McKenzie welcome any comments or questions that you may have.
Deborah and Michelle, thank you very much. Are there any questions of clarification at this time? Seeing none, Deborah, I'm going to thank you for your presentation, and I'm glad you touched upon the great work that's done in terms of transportation logistics at the airport. I had the privilege, along with Sabir Saeed, to give a presentation to the legislature this week. We were called with regards to continuing with the rejuvenation of the marketplace, and we put at the top of our list our Smart Freight Initiative. In fact, normally you get 7 minutes at the legislature. They kept Sabir and I there for an hour and 6 minutes talking about our Smart Freight Initiative, off-peak good movements, and the logistics of moving product, which, as you know quite rightly, and I'm glad you mentioned it, Deborah, we move $2 billion a day of product through the region of Peel, much of which emanates from your premises, from the airport, and it works very well and seamlessly. So shout out to you for that. Shout out to Sabir for the great job he did this week as well. With that, I'm going to ask for receipt of the delegation from Mayor Crombie and Mayor Brown. All those in favor? Any opposed? That is carried. Thank you very much to you, and we move on to our next delegation. Our next delegation is Dr. Sergio Borgia from William Osler. Dr. Borgia, welcome.
Mr. Chair, thank you very much. Councillors and mayors, can you hear me okay?
Yes, we can. Please
Great,
proceed.
Wonderful. Thanks very much. Good morning. My name is Dr. Sergio Borgia, and I'm the Medical Director of Infectious Diseases and the Infection Prevention and Control Program at William Osler Health System. Thank you for hosting me here today as we face a tremendous health challenge in our community. In recent days, the trajectory of COVID-19 in Peel Region has changed. I'm sure you're all well aware of that. We are seeing record numbers of people testing positive for the virus in the region of Peel and in Brampton specifically. And we're also seeing a corresponding increase in the number of patients who are seeking care at Osler's hospitals. And it's from this perspective that I want to frame my remarks this morning. Currently, there are 99 COVID-19 patients admitted to Osler's hospitals. 50 patients are at the Brampton Civic, and 5 of those patients are in the intensive care unit. We also have several suspect cases at Brampton Civic. These are people who have been tested, but for whom their COVID results are still pending. While we're not experiencing the levels of critical and fatal illness that we saw in Wave 1, it is possible that without community intervention, that could yet change. One of our primary challenges with the rising number of hospitalized and suspected COVID-19 cases is the physical space that's required to safely isolate and care for these patients. The reason is that patients who are infected with or suspected to have COVID-19 typically require a dedicated single occupancy room to ensure the safety of other patients. And this impacts our ability to make full use of all of our inpatient areas. Caring for over 50 COVID positive and suspect cases in the hospital places a tremendous strain on our infection prevention and control practices as they relate to bed and room access and flow due to these isolation constraints. And this significantly impacts our ability to move patients from our emergency departments to an inpatient bed. It also reduces Osler's overall ability to care for people in the community who need our services. These pressures are further compounded by 2 COVID outbreaks that we are actively managing, as well as a significant shortage of healthcare workers, in particular nurses, some of whom remain furloughed as a result of exposures at work and, more importantly, in our community at large. You see, councillors and mayors, our workforce is a mirror representation. It's a microcosm of our very community demographic. And we need to ensure that our staff are always safe inside and outside the workplace. To ensure patients continue to receive safe, high-quality care, last week we partnered with other hospitals in the GTA to care for some of Osler's patients. Hospitals and communities as far away as Collingwood came to our aid, and for this we're very grateful. So far, we've transferred more than 25 patients to other hospitals to help ensure Osler has the capacity needed to care for patients in our emergency departments and to admit new patients to units. To create additional capacity, we've also postponed some non-urgent surgery. However, even with these changes, capacity challenges persist. Our emergency departments are busier than ever. We are in code gridlock daily across our sites. We have been in code gridlock for a very long time, even before the COVID pandemic began. And we need to talk about that. Our teams are doing their very best to care for both COVID patients and those who suffer from other illnesses. During wave one of the pandemic, elective surgeries and procedures were postponed under Ontario government guidance to help us create capacity to care for COVID patients. We've seen the adverse impact this has had on the overall health of our community, and we're working very hard to ensure that we're able to continue to serve the needs of everyone without resorting to those measures again. But when wave two befell us, we were already at 100% capacity. We didn't have a half decanted hospital waiting to receive patients. As medical professionals, it is our responsibility to make decisions that protect human health and that are guided by and rooted in scientific evidence about the virus and how it behaves. We don't have all the answers. Clearly, there is no one single path forward in the absence of a vaccine and better treatments. But we've learned a tremendous amount in the last 10 months. We know that COVID-19 can spread rapidly, primarily by droplet transmission in environments where people are in close contact without using appropriate personal protective equipment. We know that tracing, testing, and isolating contacts is essential to interrupting transmission. And we know that breaking this transmission cycle can succeed by very basic yet simple and inexpensive interventions: physical distancing, meticulous hand hygiene, masks and eye protection in high-risk or healthcare environments. These few interventions alone can limit the spread of COVID to acceptable levels. The enhanced public health measures that were mandated by Dr. Lawrence Loh, MOH for Peel Region, and the Region of Peel are important to help reduce the spread of COVID and to ensure our healthcare system does not become overwhelmed or that healthcare for all who need it is not compromised. They adopt an approach proportional to our unique situation, neither a full lockdown nor a complete disregard for basic infection control and epidemiological first principles. I truly wish they were not required. I really do. As we look at Europe presently, the evidence has shown that overly restrictive policies do little to deal with the COVID-19 in the long term. But I do believe that these particular enhanced public health measures by Dr. Loh are justified. I do believe that at the risk of some societal fatigue and hardship, they can effectively provide a temporary and much needed reprieve so that we at Osler and in Peel Region can catch our breath, can recalibrate, can reduce hallway medicine and allow for the safe and eventual lifting of restrictions once the numbers are again manageable. No one expects a COVID-free world at this juncture. That would be unrealistic. But from time to time, there are focused, targeted, and strategic interventions that may be appropriate contextually in the right setting and for the shortest defined period of time required to regain security and safety. I think our community is one such population. We face unique challenges in Peel and in North Etobicoke. We have many households with long traditions of multi-generational living. We have a high number of healthcare and support workers. We have a large number of congregate businesses, manufacturing and factories, food processing, trucking, foreign student roommates, and a fair amount of international travelers. We just heard a presentation from the delegation from the GTA. And we need to act decisively to at least attempt to curtail the 15% positivity rate we are seeing in Brampton. Unless we undertake a significant united reset effort, we do risk a significant human health misadventure. While Osler's healthcare teams are working their hardest to combat COVID, we need help to ensure that we can continue to do so. Reducing the COVID case count that ends up requiring admission and critical care and keeping our community safe and healthy in Peel Region takes a concerted effort from everyone, government, healthcare professionals, and most importantly, the public. Now, more than ever, we need the community's support to help us fight COVID pandemic and to follow the most current recommendations. And we need the support of our elected officials to champion these messages in the community and enable our medical community to provide care for our patients. I agree these are challenging times for us all, but the path forward is one that all of us must take together. I ask you to support us on our front lines by encouraging residents to adhere to the public measures that have been enacted to keep them safe and healthy. I'd like to thank you all for your time, and I'd be more than happy to accept any questions at this time.
Yes, Dr. Borgia, thank you. And thanks for staying close to the 5 minutes, by the way, as the previous delegation did as well. And I hope everybody will be mindful of that going forward as well. I have a list. Demerla, Mayor Crombie, Councillor Dasko. Councillor Demerla.
Thank you, Chair and Dr. Borgia. Thank you very much for that presentation that gives all of us so much context. I do have a couple of questions for you. One is, I just heard you say Brampton has a 15% positivity rate. There are many countries in Europe that have gone into lockdown. What was the threshold there compared to where we are in Peel? I'd like to know that. My second question is, at William Osler, I thought you said you have shifted close to 400 patients to other hospitals. I'd like to know, has there been any impact on elective surgeries, cancer patients, and that sort of thing in the last couple of weeks? And finally, I'd like an understanding, and it's related to question 2, where you said that despite the much higher numbers of COVID that we have now, that you are not as swamped at William Osler as you were in phase 1, and I'd like greater clarity as to, is that because you're able to offload patients to other hospitals? Like what's going on that despite higher caseloads, things are tough at the hospital, but you're saying they're not as bad as they were back in phase 1. Thank you.
Dr. Borgia.
Right. So, Councilor Demerla, thank you very much for your questions. I'll try and hit them in order. If I go back to your original question about percent positivity, it's very important to understand that, my opinion is that what works for individual areas has to be specific targeted interventions for that area. We need to really adopt what I guess I could call a micro-regional approach. We can no longer look to global sweeping recommendations nationally, provincially, regionally, or to other countries. We need to focus on Peel, on Brampton, on Mississauga, on Caledon, on North Etobicoke, what's very specific for our particular community, because we don't have a lot of acute tertiary care hospitals in our region. So the percent positivity of 15%, I mean, it's plus or minus a few percent, but that doesn't mean 15% of people have the infection. It just means that when we do the widespread testing, we're finding that about 15% of all the people that go or present for testing are testing positive. And that's a very high number, Councillor. That's certainly well above any medical professional's comfort zone. And I'm going to defer the rest of my remarks about that to Dr. Lowe, whom I believe will be addressing council later. Your second question about elective surgeries. Thank you. So yes, to be honest, we have had to curtail some non-urgent operations, particularly at our Etobicoke facility. William Osler is a corporation of 2 large hospitals, and we actually straddle that geopolitical line between Peel Region and Toronto, with Etobicoke being in North Etobicoke, obviously, and Brampton Civic being in Brampton. So we work very, very closely with the public health units. Dr. Mohammed, our senior team, myself, our IPAC team work very, very closely with the officials in Toronto as well. And we have had to curtail some non-urgent surgeries at Etobicoke as a result of what's happening on our 8th floor vis-a-vis our outbreak. And that leads me actually into the segue response for your final question about, what's the state of affairs at our Osler institution and what's happening. And you mentioned that I said things aren't as bad. So I want to clarify. You're right in the sense that it depends what you mean by what is as bad. I mean, we all agree that everything comes with a trade-off. What really matters is what is the price that society or people or ourselves are willing to pay, and what's our comfort zone. So in terms of not being as bad, we're certainly not seeing the critically dire situation that we ran into in wave one with the long-term care sector and with the unfortunate deaths and the high critical illness. But that's not to say that we're okay or we're in a comfortable spot, because our hospital is still over capacity. We had the luxury in wave one of being able to absorb COVID patients because we had planned for that capacity. We had a half-empty ICU. We had ramped down the outpatient department. We had ramped down the elective surgeries. We were buffered. We were buffered to weather that wave one storm. And we had a merciful summer with respect to COVID. And now in the throes of wave two, as the numerator cases continue to increase, we didn't decant. We were at 110% capacity even before wave two began. And so that really puts a big strain on us from an IPAC, infection prevention control perspective, because we've got patients admitted waiting for beds. And so while the critical severity of the illness may not be as dire as it was before, we are still in gridlock. We are still facing numerous challenges every day at the hospital with staffing, with accommodations, and with making sure that we can offer services to patients who need care for other illnesses as well. So thank you for your questions.
And just, I didn't quite get some of the answers I was looking for, if you will, Dr. Borgia. One was around, you said that some elective surgeries have been curtailed. I don't know the extent, but that is worrisome. I also wanted to understand what's going on with acute care patients who need their chemotherapy. I just want to understand. I know that in phase one that got derailed. I'd like to understand what's going on.
Yes. Yes, thank you. So point of clarification, I forgot to mention, apology, I heard in your original remarks or comments and questions about the movement of 400 patients of those. That's actually not the case. We have had about 25 transfers out to partner hospitals who very graciously agreed to help us during this crisis, so that we could get the patients into an actual room, into an actual bed, both here and at other facilities. So that was 25. And in terms of the actual complement of services, to your last question, you're quite right. Those things have not stopped. We are continuing to perform surgeries, for sure, all urgent surgeries and most non-urgent surgeries. It's only been a very small number of non-urgent elective surgeries at Etobicoke while we dealt with the acute issue of the outbreak on the 8th floor. All other services, dialysis, chemotherapy, our cancer care program, our renal program, our infectious diseases program, our outpatient program, those things continue to run unaffected with heightened precautions. Those services are running well and smoothly. Our challenge really seems to be on the inpatient side at the moment.
Well, that's very good news to hear. Thank you. And I just want to show you that, certainly I take the advice of experts seriously. So I will be listening to you and Dr. Loh later on very intently. But thank you for everything that you did.
My pleasure.
Thank you. Mayor Crombie.
Thank you, Dr. Borgia. Thank you for coming today, and I'll ask you perhaps what I would ask Dr. Loh. We now see that Peel is responsible for 1/3 of all cases in Ontario. We have surpassed the Toronto numbers a couple of times now, and including yesterday, not today, but very close. And we know that we are experiencing fewer deaths. Perhaps the demographic being affected in the hospitals is a little younger than in the first wave, and maybe that's the reason, I don't know. But I do know our cases per 100,000 are very concerning. Peel, almost 120 cases per 100,000. In Toronto, it's only 88. So something's changing. Positivity rates, yes, while they're high, we are also encouraging people who are symptomatic to go get tested. So that explains a little bit of it for me. But the cases per 100,000 are probably some of the highest in the country. Now, with respect to the framework that the province has outlined, it's very broad, and it's a baseline, and it's allowed our medical officer of health to impose more restrictions. I would ask you your advice on where you think that should go. Would you be giving Dr. Lowe advice to close down more, and what that would be? And then finally, with micro-targeting messaging that you mentioned, how specific do you want to be with respect to, I mean, I see the case counts moving exponentially since September. We opened up schools, we opened up businesses. Thanksgiving, 2 weeks later, we saw a huge surge. I'm holding my breath now. It's Halloween party results coming in, and this weekend is Diwali. And it gives me real indigestion, I'll be honest with you, because I know it's Christmas time for our South Asian population, and it's really tough when we know that we're all social beings, but the South Asian population in particular like to get together and celebrate. And of course, this is a high holiday, and we're very concerned. And what messaging can you help us send that that should not be done other than in the immediate household this holiday season, and limit activities to essential activities only? So with respect to micro-targeting, the messaging that you talked about, and guidance on the provincial framework.
Mayor Crombie, thank you very much for your questions. And I'm going to once again I'm going to partition them off into two categories. You know, I'm not a political person, and so I'm not going to make any comments or pronouncements about how and why the provincial government landed on the framework. But I can say that I think that the provincial government is doing a good job. And I must also commend Dr. Lowe, because he's taken a further step with the latest set of directives. And I like your term, Mayor, of micro messaging, because that's really speaking to what I mentioned in my introductory remarks about how there is no one-stop shop solution for any region, any city, any hospital. My responsibility, my professional and ethical and conscientious responsibility is to protect the safety and welfare of the patients that find themselves inside of Osler's walls. You know, my duty is to my patients, our community, our chief of staff, our CEO, and our elected officials, as well as our medical officers of health. We have a very, very good and close working relationship with Dr. Lowe, with Peel and Toronto Public Health, going way back to the days when we started the tuberculosis clinic here with Dr. Davila, when she was the MOH for Peel. So these are not decisions that are made haphazardly. They're not decisions or recommendations that are made without much care and collaboration amongst all of us. So when help is required, I turn to public health officials, and similarly, they turn to us to get a feel for what's happening inside of the hospital. Because to your second point, micro-targeting our messaging to the community, that's actually my concern. You are quite right. The numbers per 100,000 are alarming to me in Peel Region and in Brampton. And so we need to ask, in a micro-targeted way, our community to help us, because what happens outside the walls will eventually have the trickle-down effect to what happens inside of Osler's walls. And so you're right, there are holidays coming up, and people are getting tired, they're getting fatigued. I'm not denying that. One can hardly blame them. I like to see my family. I like to celebrate Christmas. This is true. But I think that if everybody does a little bit, then nobody has to do a lot, right? We're sort of all in this together. And so I don't think it's overly onerous what Dr. Lowe is asking of our community. I can tell you that there are some groups that have a hyper razor focus on a very small part of the problem. They seem to spend 80-90% of their time and effort just talking about one small thing, like the restaurants and the gyms, for example, or whatnot. That's a very small part of our problem. The restaurants and gyms, maybe 5% or whatever. Really, it's the congregate settings. It's not having a 200-person wedding. It's not having a gathering of 60 people. It's the roommates in basement apartments that aren't part of the same family that are living together. It's our factories. It's not coming to work sick. It's having the luxury of being able to say, you know what, I'm not feeling well, and I'm not going to go to work sick out of a sense of misplaced duty because you're exposing your colleagues at work. And so we implore, our occupational health department is working 36 hours a day to try to help our healthcare workers understand the importance of not coming to work sick, of using the appropriate PPE, of not undermining the screening tool, et cetera, Mayor. So I hope I've addressed some of your questions in those remarks.
You have, thank you very much. Just a final comment would be that, you know, restaurants and gyms, 3% each of the total package. There's a lot of community spread, some of it workplace, but it's those social gatherings, you know, people coming together when they really shouldn't at this time, fill their social calendars. We thank you for the work that you're doing at the hospital and keeping us safe and alive. And with respect to our responsibilities, we have to balance lives and livelihoods. So we do get a lot of pressure on the other end, but of course we'll always make the right decision, which will keep everyone healthy and safe as you would expect. Thank you very much for your comments.
Thank you. Councillor Dasco.
Thank you through the chair, and Dr. Borgia, thank you for this this presentation and the time that you've given us. I find this quite interesting and enlightening, and also equally alarming what we're hearing. I guess one thing that you did touch on is with regards to contact tracing. From what you're seeing, are you finding that what is being done currently effective, commensurate to what is coming into William Osler?
Thank you for your question, Councillor Dasco. So this is a perfect question for Dr. Lowe, and I hope, and I know he will speak to it. So I'm not going to sort of steal his thunder on it, but I can tell you that certainly epidemiology 101, contact tracing, is important. No healthcare professional in infectious diseases, public health, or epidemiology would say it isn't. Having said that, one can understand that as the number of contacts multiply exponentially and commensurate with the rising numerator case counts in the community of over 100 per 100,000 residents, that task becomes Herculean. It becomes very, very difficult to do in a way that's manageable. You know, there are lots of things written, which I'm happy to share at a different time, about one of the metrics of this pandemic, which is not just the R0, the reproductive number, but a variable called K, which is dispersion, and the way that this virus over disperses. And when that happens, contact tracing in a reverse way could be useful as opposed to prospectively. You know, in Toronto, they had some challenges with that. They really struggled with the sheer volume that they had to do. And so it's my hope that contact tracing continues in Peel region. It really is my hope. It's my personal belief that it's important, but I need to defer to Dr. Lowe on, you know, how those decisions are made and in what context. But thank you for your question. I do believe contact tracing is important and useful.
Okay, thank you. And just one last question that I do have is, with regards to, I guess, the first wave that we got, we shut down visitors by and large, unless it was for, I guess, palliative and things like that. Do you know in the hospital networks now, are we still allowing visitors? And I just curious about that.
Right. Excellent question. Thank you. I didn't comment on that. I mean, we could have a 5-hour council session meeting just on the COVID response in Peel. Obviously, we have the town halls, et cetera, but we're not able to get to everything. But in relation to your question about visitors, we took a hard line during wave 1, and I think quite appropriately so. And I think part of the reason was because of the challenges in the LTC sector and the critical illness and the deaths. We relaxed those visitor protocols over the course of the summer, and I think that was the right approach. And they remain relaxed as far as I'm aware in most areas provincially. However, to your question, here at Osler, This is a topic that we have revisited as of 2 weeks ago, because actually 3 weeks ago. But, it's difficult to make decisions overnight there. We sort of tend to, rule by consensus as opposed to by decree. Nevertheless, we have put forward recommendations. Myself and my team have put forward recommendations to once again return to a significantly curtailed visitor policy, very similar to what we had in wave one. And that again speaks to the micro-regional approach that I think we need to take. I'm not here by any means trying to say that all hospitals should do this, or all regions, or all cities, or all provinces, but our situation here at Osler is quite unique. We're 3 campuses, almost 1,000 beds, and we need to make sure that we can always keep our finger on the pulse of what's happening inside our walls. And visitors, while they're certainly welcome and important and critical for the mental health well-being of our patients, do pose a non-trivial infection control threat to the hospital as it pertains to household contacts who may be pre-symptomatic or asymptomatic. So it's as much for the protection of the visitors as it is for the protection of our staff and our patients. But we are looking to revise the visitor policy in the next few days in that direction.
Thank you very much, Doctor. Really appreciate it.
My pleasure.
Thank you. Mayor Brown.
Thank you, Chair Inika, and thank you, Sergio, for your hard work and passion about keeping this pandemic under control in Peel Region. I thought there's a number of things that you illustrated very well. You mentioned, being micro-specific in terms of where we can minimize spread. And as Dr. Lowe has said many times, the environment in Peel is different than the environment in other regions. Where in Toronto, we saw spread in restaurant and gym settings. It wasn't the same in Peel Region, where we've really seen a number of workplace outbreaks in industrial settings. You talked about how we went into this pandemic with a healthcare capacity that is already stretched. I think that's important for everyone to recognize. In Ontario, the provincial average for beds is 2.19 hospital beds for 1,000 residents. In Brampton, it's 0.96. So we went into this pandemic with half the healthcare beds that is the provincial average. We've been talking about code gridlock in our healthcare system for the last 5 years. I remember being a provincial MPP 5 years ago asking about the case of Nathan Lee Ball, code gridlock at William Osler. And so I really think the pandemic has laid bare the health inequities that exist in the province. And so, is that part of the assessment that you see, Sergio, in terms of the health inequities? If we had the provincial ratio of beds, which would be double the beds that we currently have, just to have the provincial average, it would be a bit of a different picture. But I think because we went into it already at a disadvantage, it really enhances the threat we face right now. And so there isn't much more capacity, and a little bit of leniency right now could really push us over the edge in terms of our ability to handle the current volumes. And Sergio, maybe you could just add some context to that. How do the current healthcare inequities in Ontario put us at a disadvantage in Peel Region?
Mayor Brown, thank you for your comments and your questions. They're worth repeating because you'll get no argument out of me. This is incontrovertible fact, what you're stating. The resource misallocation, or whatever you want to call it, absolutely, there may be a mismatch in expectations of what we can safely deliver versus what we've been given. And so you were quite right. We on a per capita basis, we're struggling in Peel and in Brampton. Part of that right or wrong, good or bad, has to do with our growth. I think growth is a wonderful thing. I think it's great for businesses. It's great to make us proud representatives and ambassadors of Peel Region. It's a wonderful place to work. I've worked here for nearly 20 years, and so growth is great. We've got new Canadians. We've got a tremendous high proportion of foreign-born population that contribute meaningfully to our society, who come here to start their families or continue their families. Absolutely. And it's not an accident that that's all happened in a very concentrated period of time. There was a time when Brampton was quasi-rural. So you're right. And so our supply has, to a degree, outstripped the demand. But there are fixes for that. We saw some of that just a couple of weeks ago when Premier Ford came and announced some help to us over here. It's a good start. It's a good start. It's not enough, but it's a good start. I'll continue to advocate passionately for increased resources along with all of you. But to tie it back into the reality of COVID and Dr. Lowe's upcoming recommendations in our community, you're completely right, Mayor Brown. We are playing the hand we're dealt. We are where we are, and we've got to work with what we've got. And so if we were at 100% capacity to begin with, and we don't curtail community transmission, we will get spillover into the hospital. Maybe not people that need the ICU, but maybe people that do need the ICU. We've got to put these poor patients somewhere. And so, there's only so many levers that one can move. I mean, it's a zero-sum game. If you move something over, it's like that game of tiles where if you move one thing, everything else shifts. There's a lot of intersectionality here. So you're absolutely right. Addressing the underlying global healthcare resource allocation for Peel Region. I mean, as I mentioned, I'm not a political animal, and I'll leave that to you folks, but you get no disagreement from me on that point.
And the second question I wanted to ask, Sergio, is yesterday I was listening to a speech in the provincial legislature by Garatin Singh, an MPP in Brampton East, and I thought he really highlighted an important point that I'd love to get your take on. He talked about that we have a number of residents in Peel Region and Brampton that are taking on precarious employment, essential work, at a disproportionate level. I've talked about the 8,500 people that work in the food processing sector where we've had outbreaks, the 11,000 people in the transportation logistics sector where we've had outbreaks. Dr. Lowe's talked about our truckers acquiring COVID south of the border. MPP Garatin said there needs to be some definition that we have people taking on roles that have an inherent greater risk. If we were living in Timmins and didn't have major food processing plants, it would be a different picture. But in a dense urban area where you have a disproportionate amount of essential work, it's not like even if you had a complete lockdown, they wouldn't be locking down these sectors. They're integral to Canada's supply chain. And so people say, oh, does this mean a potential lockdown down the road? Even in March, these weren't shut down. Even when we had the height of shutdowns, it's not like our border was completely closed and the supply chains were removed. And so how does this change the picture in Peel Region that we have such a high number of essential workers? And what type of pressure does that put on our healthcare system?
Mayor Brown, thank you. I can speak to that. I mean, it places a tremendous pressure on us in the healthcare sector. I can tell you that the patients I care for, I'm so lucky to have a practice here at the hospital that really is made up of exactly the kinds of people that you're talking about. These are hardworking people. These are honest people. These are people who need to put food on the table, and it breaks my heart when I hear that sometimes the rules got disregarded, not out of maliciousness, okay? Not anybody trying to on purpose undermine us or do something bad or wrong, but there is a sector of the population, as you mentioned, that are essential to the functioning of society, be it in commerce, be it in trade. I don't live far from, I drive by the airport every day on my way home. I see lots of 777s flying overhead. I mean, these planes got to be going in and coming out and going somewhere. Okay, so you are right. There is no lockdown. This concept of lockdown is an artificial. It's not the way to go in the sense of that's how the focus should be. These people are essential, it's particularly in the healthcare sector, and what we're trying to do now is develop a plan so that no one feels strained because of job insecurity or because of the fact that they have to choose between going to work, paying the bills, or taking either a personal or societal risk with COVID. And we're working on that. And I hope Dr. Loh can speak to that. And I mean, that requires a paradigm shift. That's a cultural change that society has to make to ensure that people get protected, but at the same time that these very, very vital, essential services continue. We have patients who need care for lots of other things, and those patients have not and will not go away. We run a very, very busy viral hepatitis clinic. We have a tuberculosis clinic, which, by the way, is an airborne disease, and we've had 150 cases of active TB in Peel Region a year. That's not going anywhere. Those people still need care. That's a contagious disease. So we've got to learn to live with COVID and do this, as you will, this sort of interplay dance. So we do this as safely as possible without completely quashing, as you say, Mayor Brown, these essential sectors: the food processing, the trucking, the trade, the healthcare workers. I don't have I don't have the sort of magic bullet. I wish I did. I mean, that's pretty much all I can say about that.
Well, and my last question, Chair Yanika, and I want to get this one in, is we have a deputation coming later today from the local Peel Region physician, Kulvinder Kaur. And she has written us saying that the current restrictions are far more deadly than the virus. And I want to get your perspective on that. And the second thing is that what is the definition of a pandemic? Because it's suggested by this physician that we're not in the definition of a pandemic. And I know sometimes when we get divergent perspectives, it can be frustrating, but it also, when you hear different perspectives, sometimes it leads to having a broader conversation that leads to better decisions. So what do you say to critics who are saying that these restrictions are unnecessary and that we're not in an actual pandemic? Now you look at this, you look at the data every day, and so what context would you share for when we hear this delegation later today?
Okay, so thank you, Mayor Brown. I'll speak to that. I guess what I can't do is, give you all of the necessary medical and epidemiological background to define pandemics as they're done by different jurisdictions, including the WHO, PHAC, the CDC, et cetera. I can tell you that you don't need to be an epidemiologist to know that we're in a serious pickle here in Peel Region with respect to the numbers, the case positivity, and the disease. So, I suppose one could debate the semantics of what you want to call something, but there's no doubt we've got far too much COVID than what we want and what we can handle. So, I think that's sort of incontrovertible. But to get back to your first point about another physician or other delegations who may make contrary points. I can say that, to be honest with you, I think where part of the problem lies is in adopting an obtuse, polarizing opinion, either one way or the other. I'm very much a centrist, middle of the road type of person and type of professional. I'm relatively risk averse as a physician, and infectious diseases physicians do tend to be somewhat risk averse, but at the same time, I'm not the type of person that will adopt a polarizing position about lock everything down, global lockdown, bunker down in the basement, don't come out until the nuclear fallout of COVID, settles. But neither am I going to be the type of person that says, well, caution to the wind, do nothing, forget about it, it's a bad cold, it'll all go away. That's not true, Mayor Brown. We do see serious health consequences to this disease. Now, I will tell you, yes, to be fair to contrary points of view, one must recognize that there are some collateral hardships, some collateral damages to a too restrictive of a policy. We certainly saw that in the mental health sphere, in the addiction sphere, in the oncology sphere, in the education sector. I personally believed that schools should have reopened a little earlier, to be perfectly honest with you. My kids are in school right now, and I was pushing them in front of the line. And so far, thank God, that seems to be going okay. So I like to take a balanced approach. I feel that what Dr. Lowe and what the province framework and what Dr. Lowe has proposed is on balance proportional to our particular micro need here in Peel Region. I think they're targeted. I think they're focused. I think they're hopefully short-lived. And so that's what I would say to any other presenters or delegates. Clearly, there are some other collateral aberrations and fallout, but we want to try to keep those to a minimum because, as I mentioned before, it's a zero-sum game. If we get overrun with capacity problems and we don't do anything about it, then we won't even have the resources to deal with the people who need all the other services. So it's a very fine balance, Mayor Brown.
Thank you very much.
Thank you, Councillor Downey.
Thank you, through you, Chair. Thank you, Dr. Borgia, for your presentation and all of your responses. I think it's been really great for all of us to hear what you have to say. Obviously, we are challenged with questions from our residents on a daily basis, and very case-specific questions. I guess one of the things that you said that caught me was the luxury. You mentioned the luxury that we all have. Most of us around the table have the luxury to work from home or to, refrain from going to work when we were not feeling well or what have you. And I think that is a really good, that's a piece that we need to concentrate on in communicating with our neighborhoods and our communities, and that not everybody has that luxury. And I wonder if you could maybe speak to that and what we can do within our communities to help those that don't have that luxury. Those people that are choosing between putting food on the table and purchasing PPE. I think that is a really key piece, and we need to focus on it.
Councillor Downey, thank you for your questions. Absolutely, I can address that. I can say that you're absolutely right. There are some people, not a small number, who don't have these luxuries. I completely agree with you. But I will say this, not having it because you have an essential job and everybody's work is important. There's merit and value in all work. That in my opinion, that does not necessarily conflict or is antithetical with doing work in a safe way. There are definitely challenges, but it doesn't necessarily mean that this is an issue about working versus not working. It's more an issue of if you work and you have to work in a certain sector or a certain job, your employer has a legal obligation to protect you, and you do as well. So one should never be faced with having to purchase PPE or going to work. The PPE should be provided by the authorities in play, be it your employer, public health, the government, whomever. We certainly would not expect workers, essential or otherwise, to have to procure their own PPE for the purposes of employment. Now, certainly people choose to go over and above and do things in their own private homes as private citizens, which is outside of our purview for sure. But I should stress that this, as you mentioned, this luxury doesn't mean that it does not abdicate one's personal and one's employer's responsibility to conduct work safely.
Thank you. Well, those are all my questions, Dr. Borgia. Thank you very much for your presentation this morning. I have receipt moved by Mayor Crombie and Councillor Sinclair. Are there any opposed? That is carried. Once again, thank you, Dr. Borgia. Next up, I have
My
Delegate
pleasure. Here to help. Thank you very much.
Thank you. Next up, I have delegation number 3, Dr. Gill, rather, on the same subject. Dr. Gill.
Good morning, Chair. Good morning, mayors and council members. Before I begin, I'd kindly like to ask an extension to my time. The last time I spoke was in council chambers. I was actually advocating for the region to remain intact, so I'm thankful that all of you are together here today. But I feel compelled to speak today because of a grave violation of the first principle of my profession, which is first do no harm. And I think it would be a grave disservice to the residents of Peel if you were not fully informed before embarking on this critical time with these decisions. So I'd kindly ask for an extension to my time.
Dr. Gill, you have 5 minutes. In fairness, I've allowed the other delegates about 6 or 7. I'm going to hold you to that 6 or 7, and if the council wants to extend beyond that, we will go from there. So why don't you begin, and we will go from there.
Okay, thank you. I'm a local resident and a local physician. My undergrad training was in microbiology. My postgraduate training was in immunology, and I had done a vaccine research at Canada's only level 4 national microbiology lab focusing on T-cell immunity to develop an HIV-1 vaccine. I wanted to highlight the concerns today. Initially, if we could advance quickly while I speak in between slides 1 until we get to slide 9, please. So I just want all of you to see that the existing issues with our healthcare resources have been long-standing for more than 5 years. None of this is new either to the region or to the province, and I think this is a huge red herring, okay? So we need to focus on what actually needs to be focused on, and I feel that all of these headlines are actually creating a significant amount of fear as opposed to allowing us to have a rational discussion. If I could go to slide 9 and 10. This was just published in the National Post yesterday, and we have from Public Health Agency of Canada data since August. You can see on slide 10 that there's been a 98% reduction in flu cases through the country. So the typical flu surges that we see, hopefully it seems like the flu will not be a burden on our hospitals this year. So that actually acts in our favor. Slide 11, you can see that we need to start focusing on actual real live data. The modeling has been terribly flawed by orders of 10 plus magnitude. Now we have 10 months of real life data that we can look at. Slide 12, you can see that there's been no excess death in Canada from StatsCan data reported to the end of July. This is in all regions of Canada, including COVID deaths. There has been no excess deaths. Pandemics are defined by excess deaths. You can go to slide 13. Updated Center of Disease Control estimated infection fatality rates, you can see, is age stratified. The risk of death from acquiring a COVID-19 infection is less than the seasonal flu, for children and for healthy adults. It's greater than the seasonal flu for those with significant comorbid disease or greater than the age of 70. Can quickly advance to slide 14 and 15. You can see that the risk of death compared to all other causes is less for COVID if you're under the age of 70 and slightly greater if you're over the age of 70. But as you can see, we have significantly greater risk from other causes. You can advance through slides 16, 17, and 18. I want council to stop the case hysteria, okay? Cases do not equal infection. This has been extensively published in over 40 publications in peer-reviewed journals, including the Oxford University Center for Evidence-Based Medicine. Cases do not equal infections. We need to stop the hysteria of cases. Cases are based on a deeply flawed PCR test, And you can see from slide 16 that we already know from Public Health Agency of Canada peer-reviewed publications that we are using highly elevated PCR cycle thresholds, which amplify at an increasingly alarming rate of 38 to 45 when it should be less than 24. Anything greater than 25 is not picking up active infectious virus. It's actually picking up inactive RNA remnants, which are likely from previous acquired infection from 2 or 3 months prior, or from cross-reactive common cold coronaviruses that the person has acquired. It does not equal infection. I cannot stress that enough. Cases do not equal infection. We need to stop the case hysteria. The province changed the definition on slide 19 for cases as well. They started to include IgG serology, which is actually immunity. We're now including immunity as well with the terribly flawed case definition that we already have. Slides 20 and 21. The WHO pandemic planning response from 2019, evidence-based policy, peer-reviewed, says that both contact tracing and quarantine of exposures is contraindicated and not evidence-based. And yet that is the madness that we are doing. The madness that we keep repeating is test, trace, isolate. This is utter madness. We need to go back to science and start following evidence-based medicine. And evidence-based medicine, even from the experts from Stanford, from Oxford, and from Harvard that have eminent professors, infectious disease epidemiologists have been speaking out. What we are doing is counterproductive and harmful to society. 22, 23, and 24 slides. First, on 22, you can see that although we've had an increase in cases, which is generated by our substantial increase in testing, we have not had a collateral increase in deaths. You can quickly advance to slide 25, which is Peel data. We actually ended a pandemic in Peel on June the 6th. Since June the 6th, we've had 0 to 3 daily deaths. Since June the 11th, we've had 0 to 2 daily deaths in Peel. We now have a case demic, which is generated by hysteria of mad testing with elevated PCR cycle thresholds, which is not evidence-based. If you could advance through to 26, we cannot rely on this carrot of a vaccine. It's already been published that the studies, first off, it's based on a press release. It is not based on published data. So Pfizer announcement earlier this week, there's no publication, peer-reviewed evidence that has been out there for doctors to see. It was merely a press release. It was a marketing gimmick, and it certainly resulted in trillions of increases in the markets, but it will not help humanity, because if you look at what's been published in the British Medical Journal, as well in Forbes, as well in other publications, the vaccine trials are not designed to actually find out if the vaccine will prevent transmission, if the vaccine will prevent death, if the vaccine will prevent hospitalizations. In fact, what was published by a leading professor in Forbes is that all we know is that the vaccine may prevent some minor symptoms, such as a mild cough or a headache. Okay, and for something that has a nearly 99% recovery in the majority of the healthy population to be putting everyone under tremendous hazardous lockdowns and tremendous catastrophic restrictions makes no sense. And it's actually been called a crime against the very people that politicians are supposed to be serving by leading experts around the world. You can quickly advance through slide 28. You can see jurisdictions in the US on the bottom that did not do a lockdown. You can see that there's no elevated deaths per 100 million. You can see slide 29, the Sweden slide, which did no lockdown. Schools were kept open for, as well as daycares under the age of 14. Businesses remained open. There were no masks that were mandated. There were no mandates that were put in place, and yet they followed the same flattening of the curve, because the flattening of the curve has nothing to do with what we do. It actually has to do with community acquired community-acquired immunity, which is mostly coming from T-cell immunity. And that's been published now in 40 leading publications in peer-reviewed journals. You can advance to slides 30 and 31. You can see Sweden's response with no lockdown compared to the EU, as well as compared to the rest of the world, has still led to significantly fewer deaths per 100 million. And what's more important is we shouldn't be comparing countries to other countries. We should be comparing countries to themselves from the previous years. So slide 32, you can see Sweden's excess deaths from 2020 compared to their average of excess deaths from the previous 20 years. It is actually estimated to end the year with either net negative or net zero excess deaths in 2020, which shows the utter madness that the world has come to, because Sweden never did any lockdowns and never enforced all of these horrific conditions upon their residents, and yet they will have a net zero or net negative excess deaths for 2020.
Dr. Gill, thank you. So you're well past the 5, but I will give you a minute or 2 more just to wrap up, please.
Okay. So if you could go to slides 33 and 34 just very quickly. 33 was published by a Professor Emeritus of Public Health here in Canada. I strongly recommend going over the peer-reviewed paper. It goes over all the errors in the public health response and the harm and the ethical legal violations with our response. 34 is the World Health Organization's affirmed original 1984 and reaffirmed 2020 definition for health, which we are not following. Health is not just about the absence of a disease, it's holistic overall health. And our public health response is actually anti-public health. And slides 35 to 37 go over the immense horrific harm that we're causing to humanity. This is a significant crime against humanity, something that we have never seen in our entire lifetime. 38, 39, and 40 are leading, respected, prominent, eminent professors of epidemiology and public health from Oxford, Stanford, and from Harvard that had started the Great Barrington Declaration to return to a normal pandemic response. Our pandemic response right now is not normal. I have signed this petition. Thousands of Peel residents have signed this petition. Thousands of doctors in Ontario have signed this petition. It now has over 700,000 signatures, and we're calling for a return to a saner, more moral, scientifically based, traditional public health response where we don't have a myopic focus on one virus and we start looking at the tremendous harm and death that we are causing to humanity. Thank you.
Thank you for your presentation. I have a question. Councillor Demerla.
Thank you, Chair, and just want to thank you for coming out and making your presentation to Peel Council. I know you did make a presentation to Mississauga. I'm just kind of curious. You spoke to a lot of things that you say you don't like are being done. So could you like talk about what would you like to see done then?
Yes. So slide 40, 43 and 44. So 43, you can see is slide 40. So 43 is a slide that was shared yesterday by a physician colleague. This is her father. So she gave me permission to share these pictures. And you can see that in the first picture, this was her father when she went and first saw him on October 30th at a long-term care home here in Ontario after 7 months of lockdown and day 7 of room isolation. And yesterday she shared the picture next to it, which was taken on November 5th, just 5 days after coming home. So she removed him from the long-term care home that was essentially killing him with these lockdown conditions and these horrific isolation protocols, and brought him home. And many of the deaths that we have seen in our long-term care settings have not been due to COVID. We need to understand that aside from the definition of cases not equaling infections, cases and deaths are being defined with COVID, not as a result of COVID. So many patients who die of other causes will have a swab done.
Sorry, Dr. Kulvinder, giving me an example. I just wanted to hear from you.
So that goes into my next slide, but I'm just doing the segue. So it's really important to understand, looking at the numbers, even though we know that with the case demic that the PCR is giving us up to 90% false positives, is that even the ones that we do have, they're not direct result of the virus. So if you go to slide 44, we can start implementing health promotion and disease prevention mechanisms that are the basic premise of public health. And if you go to www.gbodeclaration.org, which is the petition that's now been signed by over 700,000 public health experts, physicians, nurses, concerned citizens, you can see a very detailed explanation of this. But aside from what's listed on that website, we know vitamin D deficiency is in significant risk for people of color. And in Brampton, nearly 75% of the population is actually persons of color, similar to Peel. And we know that people of color, as well as seniors living in northern, in our northern climate, have significant risk for a vitamin D deficiency. And in published data, vitamin D deficiency has been is paramount for having an effective T-cell immune response. And there has been significant correlation between vitamin D deficiency and acquiring a COVID-19 infection, as well as death. So several countries around the world have been recommending vitamin D for their residents for almost 6 months. The UK and Scotland has actually gone further, and they're actually supplying people who are in lower socioeconomic groups vitamin D free of charge to ensure that they are not deficient, because it's paramount to be able to have an effective immune response. So if the UK can do this, if many other jurisdictions in the world can do this, there is no reason that we can't. But we haven't even gone to the point of even talking about vitamin D. We need to start talking about exercising. We need to start talking about our mental health, and social interactions are crucial to actually maintain health. Balanced diets. We also have over 100 peer-reviewed studies now looking at early treatment with outpatient HCQ within the first 5 days. And we know that decreases both hospitalizations and it decreases deaths. And it's been part of official treatment protocols for many countries around the world. And many of those countries have the lowest deaths per 100 million. However,
Dr. Knapp, yeah, I'm getting the idea. So I mean, I don't think we have enough time to go into the minutiae, but dissenting views are always important, I think, in a democracy. So you brought that view forward. I'm just going to end by saying, as much as I respect some of the things you're saying, I was just reading that Sweden, which you mentioned, is now, the Prime Minister has just said that all of the trends are going the wrong way. And in fact, they're looking at imposing more restrictions. So I don't think this is as black and white, but anyway, thank you.
So if you want to...
No, I'm sorry. No, we're not to debate. No, I'm sorry. That's it. Thank you very much. I'll move on to my next questioner, Councillor Kovac.
Thank you, Mr. Chair. I might have a little bit of lag and I don't have my video up right now. So if you want to let me know whether it's choppy at any time, that would be appreciated. So Dr. Gill, I just want to thank you. And Councillor Demerla made the comment that dissenting views are important in a democracy. You're not the only one to have a view that might be perceived in some ways as different from whatever the standard messaging is right now, but being that you have a background in healthcare, it's appreciated that you're here today to provide some of those views. I had a chance to go through the presentation, and just on the T-cell immunity point with regard to Sweden and then some of the other countries, or European Union was mentioned as well. Why do you think where Sweden sort of charted up and then down, and you referenced T-cell immunity as being behind that, for countries such as France, Spain, the United Kingdom, and the Netherlands, they have kind of come back up. So would the T cell immunity argument not, not work in that case there? Like, how would you explain why for Belgium, France, UK, Netherlands, Spain kind of came back up, but for Sweden it did not?
Yeah, so first to slide 29, you can see that there has been no dramatic change in deaths for Sweden. So again, we need to keep the focus off of cases and keep the focus on deaths. Slide 28, which is, slide I think 31 is the one that you're referring to. So those other countries went under lockdown. So what you see is when they ease lockdowns, then you see a dramatic rise in cases because they have never acquired that community immunity. Now, we know that similar to other respiratory viruses, we have T cell immunity, which is one arm of the immune response aside from the humoral, which is the antibody immune response, play a crucial role in our body's ability to be able to fight off viruses. And there have now been nearly 40 publications looking at T cell immune responses for SARS-CoV-2, which is a virus that leads to COVID-19 disease. And what we do know is that within the population, there are two things. One, a significant number of the population in the studies published has been anywhere from 51 to above 80% of the population has pre-existing cross-protective immunity to SARS-CoV-2 from our pre-existing immunity to common cold coronaviruses. So our previous exposure to common cold coronaviruses have led to a memory immunity that we have, which has cross-protection against SARS-CoV-2. We also know from published data that those who acquire SARS-CoV-2 actually mount a very strong T cell immune response. And although antibodies wane, and we know from published data now that the antibody response to SARS-CoV-2 wanes after about 2 to 3 months, the T cell immune response actually bodes very well for long-term immunity. And we know this from a peer-reviewed publication from just a few weeks ago that found that patients were found to have T-cell immunity still 6 months after they acquired infection. And a publication in July found that patients who had SARS 17 years ago still had strong T-cell immunity to the SARS virus 17 years later. And not only that, they actually had strong cross-protective immunity to the new SARS-CoV-2 virus. So what's really important to understand is that there has been publications also done looking at what's known as herd immunity threshold. Now, oftentimes we hear about the number of 70 to 90% thrown around is what the community immunity needs to be through a vaccine for there to be herd protection or community protection of our vulnerable population. However, there are now significant papers that are published from leading scientists, epidemiologists, who have done the data looking at our pre-existing immunity, and we know that we have a heterogeneous population, not a homogeneous population, which is what the modeling has been based upon, but the pre-existing immunity leads to a heterogeneous population. And based on that heterogeneous population, we know that the herd immunity threshold is likely only 20%, meaning that we need 20% seroprevalence acquired infection from SARS-CoV-2 to actually lead to that herd immunity, community acquired immune response. And that's what we're seeing around jurisdictions around the world, is once their seroprevalence data gets to around 18 to 20%, when they look at both IgG and IgA with the pre-existing T-cell immunity, we start seeing that flattening of the curve, which is what you're seeing with Sweden. Sweden's flattening of the curve happened with acquired, community acquired immunity. There was no lockdown that was enforced. As I mentioned, schools, daycares stayed open. There was no social distancing in schools. There was no masks in schools. Sweden published so their government published a study in August, which actually found that there were 0 deaths amongst children, despite them having no enforced measures in schools. And they also found that the transmission of the infection from children to adults was actually very low. So children are actually very low sources of actual infection. And there was a large study published in the American Academy of Pediatrics this past month, which is another large peer-reviewed journal, which looked at over 50,000 childcare providers, which are childcare providers. So each of those childcare providers has many, many more individual children. And what they found was that there was no significant transmission of SARS-CoV-2 infection from children to their providers. So children are actually acting as significant sources of immunity. And if you go to slide 41, the premise of the Great Barrington Declaration. Now, I hear some councillors trying to minimize my voice by saying that I'm a dissenting opinion. I'm actually trying to get the council to go back to how we have always responded to a pandemic. So what is important to realize was that Sweden's response was not abnormal. Sweden's response to a pandemic was a normal response. Sweden's response to the pandemic was exactly what the World Health Organization's pandemic response document outlines, which was published in 2019. Sweden's response is actually what Canada Public Health Agency pandemic response also outlines. Why we have abandoned all of our pre-prepared evidence-based models, which have been followed for every pandemic to date. For this pandemic, it boggles the mind. I don't know why it happened, but thankfully Sweden kept strong and it followed science and it followed their existing protocols. And they will be stronger for it because they have avoided the carnage of harm and the carnage of death, which has been actually inflicted upon Canadians here and the rest of the world. And what's important to realize is that the Great Barrington Declaration, which again is not dissenting views, this is the majority view and the view that had been held for decades to date in terms of how to respond to a pandemic, goes back to the holistic response, and that we need to take away from a myopic focus on the virus and actually look at the harm that the actions are causing. And it actually goes back to 3 basic principles of public health, which this lockdown or restrictive measures are ignoring. 1, minimizing long-term rather than short-term COVID mortality. 2, minimizing morbidity and mortality from all diseases, not just COVID-19. And 3, minimizing disease and mortality in the entire population, including the working class and the poor. I was thankful that Councillor Downey was the only one so far to actually bring forward concerns about marginalized groups. All of us on the call here are extremely privileged. We need to recognize the privilege that we have, and we need to recognize the harm that these actions are actually causing. It's destroying lives. It's causing deaths amongst marginalized groups, amongst people of color, amongst immigrants, amongst the poor, amongst the working class. And you're putting the burden of illness and the burden of your horrific decisions upon those people who don't have a voice. We don't have them on the call today. So I'm very thankful for Councillor Downey for trying to bring that perspective into the call, but we need to look beyond just COVID-19. We need to look at the huge amount of collateral damage that this is causing to lives. And it's
Dr. Gill, I'm going to stop you there. Point of clarity, Councillor Kovacs, are you satisfied your question's been answered?
I am, thank you, yes, and it was not my intention to make you feel like you're being cut off at in any way, Dr. Gill. It's just that I do thank you for providing a very fulsome response to my original question. I think it is important to draw attention to the sociological, the psychological, the social cultural, and obviously clearly the economic would be the second one that we're focusing after the health. But those two are health effects. Or let's say you can be impacted from a health standpoint, sociologically and psychologically and those other ways. But I would say that I feel that we're not doing enough locally, culturally, globally, continentally, or whatever, to talk about what we can do to boost our immune systems. Exercise more, diet well, make sure you're getting your vitamins. And I guess I'll just leave that as a point and be respectful of everybody's time. Thank you, Dr. Gill, for being here today.
Councillor Kovac, thank you. With that, Dr. Gill, thank you for your presentation. I have receipt moved by Councillor Kovac and Councillor Demerla. All those in favor? Any opposed? That is carried. Again, Dr. Gill, thank you for your presentation. That brings us down to communications items. Item 8, related matters 8.1 rather, Peel Public Health COVID-19 response, presentation from Dr. Lawrence Loh, Medical Officer of Health. Dr. Loh.
Thank you very much, Mr. Chair, and I look forward to presenting today. Before I begin my presentation, I think it's absolutely vital for me to address the deputations that were recently presented on the part of Dr. Borja and also, Dr. Gill.
And Dr. Loh, if I may interrupt, you're coming in a little faint at my end. If I get you to speak up or crank up the volume a touch, please. Thank you.
How's that?
Not much better, but carry on.
Okay, I'll just make sure I speak up. I apologize. I'm going to bring, I'll try to bring up the heavy hardware for this one. My apologies, Mr. Chair and Council. All right.
Hello? Hello, Mr. Chair.
We can hear you, Dr. Loh. Please go ahead.
Okay, wonderful. Thank you. Thank you very much, Council, Mr. Chair. I'd like to, before I launch into my update, I did want to address my perspective on the deputations that came forward, and really just with gratitude for the opportunity to dialogue with our local physicians. I think I want to make something very clear, though. We track all sorts of things when it comes to a pandemic. Cases ultimately become hospitalizations and ultimately become ICU stays. And that's really the way it goes. Now, that said, not all cases end up there. And certainly I would take Dr. Gill's point that many people do have a mild illness. But the reality is we don't know who, especially when you have a novel disease that no one's actually been exposed to before, how their immune system will react and whether they do have that element of residual immunity that Dr. Gill has identified. So the idea that a surge in cases can lead to a surge in hospitalizations from that proportionally, and subsequently intensive care and deaths, that is the cascade that we have continued to track since this pandemic began. And in Peel now, we are seeing that, in fact. Thanksgiving and Halloween are driving our case numbers through the roof, and COVID-19 is adding demand, as you heard from Dr. Borja, on what is already one of the busiest hospitals in the country in Brampton. And so the facts are clear. As a physician who is a specialist in public health, I'm deeply concerned with what we've just heard. I think we can all talk about, the test and theories of immunities and really this shell game of deaths from the pandemic versus mental health or economic loss. And I call it a shell game because the reality is that in communities where COVID-19 has run rampant, we're still seeing those same indirect impacts play out in addition to the ravages of the disease itself. So at this critical juncture, our best move is to keep COVID under control while also keeping what we can in our day-to-day lives moving forward. Now, I remember in medical school, they always taught us when you take a test to avoid extremes. I've never recommended hiding in our basement for months, never have. But the other extreme of just letting it all loose is also a very difficult idea. There is some suggestion that doing so, the latter, in fact, letting it all loose, will actually lead to hiding in our basement for months as hospitalizations and deaths spiral out of control. And while we can argue all about cases and definitions and cycle thresholds and tests, there is no debate when patients start ending up in the hospital and also in the ICU, as they did in Wuhan, in Lombardia, in New York City, Guayaquil, Manaus, Madrid, Mumbai, Jakarta, Rostov, Port Elizabeth, South Africa, Liège in Belgium, Prague, Winnipeg, El Paso, most recently. We are seeing hospitals overrun, oxygen supplies running low or out completely, field hospitals, crematorium overflowing, morgue trucks, our fellow healthcare workers and humans sick and dying. So I must say with the utmost respect that this is not a conspiracy. This is not a joke. This is the largest open book test in the world, and many places before us have not seen good results. On a balance of probabilities, there's little evidence to suggest that the perspective that Dr. Gill has advanced today is helpful or correct. Statistics Canada did in fact report in August that we saw 7,000 more excess deaths in the first wave of the pandemic. Sweden, while it did not impose a government lockdown, emphasized social responsibility and their population distanced on their own. It's also understood, as I've said before, that if COVID-19 were to roar loose, as you see in the US, you will see the exact same effects on those most vulnerable to us, the impacts on mental health issues, the indirect morbidity and mortality from other health conditions where healthcare systems are overwhelmed, and the mental health impacts due to fear, with people not understanding where this goes or how they can stay safe. Dr. Gill herself said that we should not compare ourselves to other jurisdictions because they're incredibly complex pictures. So I want to remind that we are not somehow different or special. We are still human beings here in the region of Peel, the same that are susceptible to spread from person to person. So prevention, by stopping transmission in the first instance, is needed to reduce cases. We need to track the cases. Tracing is needed to limit forward spread and to understand where the cases are coming from. And treatment is necessary to save the lives of those who tragically fall ill. I'll close by highlighting that Dr. Gill also suggested that we should respond to pandemics just as we always have. In 1968 to 1969, there was another pandemic, the novel influenza H3N2 pandemic. And I wasn't around then, but I understand things kind of went on as normal. They had Woodstock 69 and all the rest of the stuff that happened in those years. That influenza virus killed 4 million people worldwide because we continued as normal. COVID has killed 1.3 million people and counting, and that was with the measures that have been taken. And as Dr. Borgia has highlighted, Osler is already seeing more and more patients with COVID. And those aren't crisis actors. This is real. Those are our residents. So I have and will always be for a balanced approach. And when it is safe, I will always advocate to reopen the community so that we can make sure that we minimize the other impacts of COVID. But the other part of a balanced approach is when the balance tilts towards needing to control COVID-19, you must control COVID-19 as best you can with, reasonable, proportionate measures to try to turn it back around. And that's where we are right now. So with their indulgence, Mr. Chair, I will now begin my presentation. And again, thank Council for the opportunity to provide an update on the situation in Peel. This presentation accompanies a report on our first wave and the resourcing that will be required to sustain our response going forward. I'm also going to share some recent data for your situational awareness as we are at a critical time and juncture in our community, which is likely why our physician colleagues came to speak today. As I declared on October 21st, we are now in a second wave in the region of Peel, and the golden window for disease control that I just discussed in the first wave is again before us and is slowly closing as the number of cases has continued to increase and transmission continues to differentiate in our community. This is why I have enacted and have been grateful for the support for the recent instructions and recommendations that I have put in place to try to make the most of what's happening, try and make the most of addressing where transmission is happening, while leaving critical things like schools, essential business, etc., untouched, but with precautions in place. We have to act decisively now. And we must also be prepared that if these numbers accelerate further and our contact tracing and hospital situations deteriorate even more, that we will need to work with the provincial government to act even more decisively and perhaps prevent a catastrophe, as mentioned in some of the jurisdictions that I listed earlier. I will state this: we are likely at the point of no return. This is probably our last chance to turn this around without returning to broad closures and curtailments, as we saw in the spring. I'll advance to the next slide, please. I'll just remind Council, with your indulgence, of the objectives that we have in public health in our attempt to advance a balanced approach to responding to COVID-19. We wish to reduce morbidity and mortality, and that refers to both in relation to the virus as well as all other healthcare conditions. We also want to protect the healthcare system, not only from COVID-19, but with the recognition that people fall ill from many different things, and that healthcare capacity is crucial to ensure that they do not succumb in an emergency situation. And finally, we do recognize that the pandemic, should it be fully unleashed in our community, would have broad impacts, and this is borne out in many communities in the United States. And we also want to make sure that when we get COVID-19 levels to a place that supports ongoing contact tracing and a slow burn, that we reopen and that we actually take steps to mitigate the broader impacts of the pandemic on our community. Next slide, please. Last week, the province set forward a 5-pillar framework that allows for tightening and loosening of public health measures and also provides for local restrictions to be placed as needed. Metrics were put in place by the provincial government to help identify each category. And for Peel, the weekly rate placed us in the red control stage. We'll go to the next slide, please. This graph illustrates the weekly COVID-19 rate per 100,000 for Peel overall and by municipalities. For the week of November 1st through 7th, Peel, Brampton, and Caledon all currently have rates indicative of control measures. However, the trajectory of rates continues to increase in all municipalities. At 120 in Peel, 75 in Mississauga, 100 in Caledon, and 182 in Brampton per 100,000 residents. We'll continue to the next slide, please. Epidemic growth continues in Peel. Note that it is higher in Caledon and Mississauga despite having fewer cases. Any number over 1 means that one case is infecting more than one other resident, and we want this to be 1 or less ideally. Next slide. Another measure of the extent of infection in the framework is the test positivity. Generally, the aim is to ensure that the proportion of tests is returning 3% or less. Anything above is assigned to check for what the other trends are doing to determine if you are testing enough or if you are seeing a true increase. For the week of November 1st to 7th, the test positivity continues to increase and was over 10% in Peel as a whole, 13.4% in Brampton, 9.2% in Caledon, and 7.2% in Mississauga. Staying at 3% test positivity is the internationally established benchmark in the previous, as well as the benchmark in the previous provincial framework. Test turnaround time has now improved since the backlog that occurred around the reopening of schools. And while it may take longer for negative as opposed to positive results, the people who are testing positive are getting results within 2 days. The overall November 7th 7-day moving average saw 44% of tests returned in 1 day and 80% completed in 2 days. And our provincial partners are continuing to work to open additional testing sites in our community. Next slide, please. With high case volumes, we are now starting to see capacity challenges. And as you heard from Dr. Borges this morning, the first wave hospital prepared and shut down everything and was ready. And now they're basically trying to catch up on that backlog and keep going with their usual high volumes, trying to take on a COVID surge while accounting for regular business and demand. For our hospitals at Brampton Civic, we've seen patients transferred and postponed. We've seen patients transferred out across the province and surgery starting to be postponed. And while this is temporary in terms of relief, it does not help to address the overall capacity issues that we are seeing in Peel with our acute care beds. Next slide, please. Over the summer, Peel Public Health increased contact tracing capacity by hiring numerous staff and implementing a new digital contact system in order to continue contact tracing. However, as the caseloads continue to increase significantly, our ability to do so effectively is being challenged. We were able through September, October to maintain contact tracing and to be able to keep our case counts at a level between 70 and 130 for the better part of 6 weeks from the beginning of September through the middle of October. However, the Thanksgiving surge is what has pushed us over the edge. It is also why our current contact tracing ability, as it becomes more and more challenged, really speaks to the critical situation that we find ourselves in trying to control this virus in our community. Next slide, please. COVID-19 at this point in time we are seeing widespread transmission of COVID-19 at this point in time throughout many places in our community. We have seen transmission across all settings where there's unprotected close contact without masking, particularly in indoor closed spaces for long periods of time. You've heard of the cycle that I've talked about in terms of household, workplace, and social. 40% of our cases are due to exposure in the household, and recognizes the fact that we have larger households, sometimes with families, multiple families, or congregate living. When it is introduced into households, it then gets propagated into other settings, such as private gatherings, schools, celebratory events, workplaces, and our institutions and congregate settings, such as schools and long-term care. Transmission in workplaces, particularly in sectors where you cannot work from home, where physical distancing is challenging to maintain, and where people who might be precariously employed might be incentivized to work if they are sick or ignore exposure, ignore isolation, and therefore cause outbreaks because they're concerned about their job protections, continue to be a large driver in our community. And in response to a request from Council, we have now placed a workplace outbreak tracker on our dashboard, which is one of the tabs that you can review. We have also seen many clusters in celebratory events, particularly weddings, at places of worship, and small household gatherings between friends and family members who may not live together. Most concerningly, in the past week, we have started to see an increase in hospital and long-term care outbreaks. As you heard from Dr. Borgia, they now have 2 outbreaks there. Trillium Health Partners also has an outbreak on one of their floors, and we have a number of long-term care outbreaks, including deaths that are now occurring in those settings again. This despite the fact that we continue with our Ontario Health Partners, with the hospital partners, with our long-term care administration partners, to try to keep this out of long-term care homes. We're also seeing more and more cases in schools. And while the precautions in schools have largely prevented this from going forward, and science suggests, as Dr. Borgia identified, that kids don't necessarily spread this as much, if you keep throwing cases at the school, eventually something is going to stick, as we've seen with some school outbreaks in recent weeks. Next slide, please. Just want to share a few recent examples of some outbreaks in social settings, which speak to the reason why our recent instruction was provided. At a wedding of 100 guests, there were 46 cases, so an attack rate of 46%, of which 33 residents were from Peel. These were pre-wedding events, which were held. This wedding included pre-wedding events that were held in private homes, and then subsequently bus for transport of guests was used to get to the ultimate banquet hall. Our investigation found that at this wedding, there was limited mask use and physical distancing, and there was also buffet-style food service in contravention of the regulations as they stand. Places of worship. There was a temple with leaders who live on site. There were 9 cases, including the leaders, and they interacted with visitors while they were actually infected with the disease. On site at this place of worship, there was also inconsistent physical distancing and masking, and there's also been a challenge in that they were not acquiring contact information on visitors, which limited our ability to contact trace. And finally, a symptomatic visitor from another province visited one household, and then multiple visits between that household and another household following the visitor's departure resulted in 8 cases across 3 generations in 2 households, including elderly individuals. So this is what contact tracing allows us to figure out. It allows us to figure out who's at risk, how the risk happens, and how the transmission is occurring. Next slide, please. I'm going to now speak to the letter of instruction that I issued last week. And I know that a copy of the table with the measures was circulated to Council this weekend. As I mentioned, we are now at a turning point around the COVID-19 pandemic in our community. Our picture is dire. And with the provincial announcement and in the absence of a vaccine, it is imperative that we work together as a community to translate what we know to be effective in addressing COVID transmission and in all of our individual and personal interactions and into community settings to flatten the curve and allow us to emerge again with adapted precautionary aspects in living. We also know and have seen elsewhere in the world that if we are not successful with these measures, that more must be done to bring COVID under control. Now is essentially our final chance before we yield control back to the virus and are left with the choice that Western Europe and so many other places have faced before us of whether to let it loose or bring down a bigger hammer. We cannot let this overwhelm our hospital and kill our residents, as has been seen elsewhere, which is why the immediate need is to address COVID-19 so that we can get to minimizing the impacts on the longer term needs. People say that the measures do hurt, and I absolutely recognize that. But as I've always said, uncontrolled viral spread does the same thing. People can't access care. People live in fear. People lose their livelihoods because nobody wants to go dine out when they know the virus is spreading furiously through the community. So we can either try to choose to take some hits now and prevent COVID, or we can let this get so bad that not only do we take hits then, but then we're also going to have the impacts of COVID on top of that. Essentially, we're trying to choose the least worst decision here that will ultimately save and protect as many of our residents as we can in the long run. That's the beautiful, and just as a note, if this doesn't work, then yes, we know where this is going next. But if it does, then some might question whether the measures were necessary. But that's the beautiful thing about prevention. You build a guardrail at a cliff, and you marvel that there isn't a collection of flaming, burning wreckage of fallen vehicles when you peek over the edge. And then some might question whether the guardrail was really needed. Of course the guardrail was needed. We'll go to the next slide, please. This slide summarizes some of the recommendations that I've made to our Peel residents to complement essentially above the provincial framework for what we are seeing in our community. For the next 2 to 4 weeks, I'm not asking for residents to hide in the basement. I'm not calling for a full lockdown. I'm asking residents one thing: stop meeting in person as much as you can. This disease cannot spread from person to person if you are not meeting. If you have to meet someone outside your household for an essential purpose, ensure that you are distancing, masking, and please don't meet up if you're even the slightest bit sick. Meet virtually as much as possible, and please do not host or attend large gatherings. COVID is a door crasher and loves a party. So, next slide, please. There are also additional recommendations that I've issued for specific settings, including places of worship and restaurants. These are not enforceable, but to the extent that we can limit opportunities for people to congregate and be exposed, we will limit the possibility of this getting into households, which, if you remember from earlier, is really where this all starts. If we can stop mixing households, we will bring down the rate of spread and hopefully be able to return to a broader reopening. Slide 14, please. In addition to these measures, the slides remind us of the overall key functions that Peel Public Health has undertaken in the response. We have done case contact exposure and outbreak management, nearly 17,000 case investigations, and 177 institutional outbreaks. Enforcement and collaboration with partners, we've responded to over 2,000 COVID-19 requests for service, together with our police and bylaw partners who've responded to more. Surveillance and epi-analysis, we have over 30,000 visits a month to the COVID-19 dashboard and the weekly epidemiologic updates. Public communications, external stakeholder relations in terms of keeping the public informed through our call center and in responding to public inquiries, and also maintaining critical public health programs and services for all the other things that impact health, including our harm reduction services. Next slide, please. As outlined in the report, despite the effort and our current circumstances, we do require more staffing resources to urgently achieve appropriate service levels across all public health functions. All options to utilize existing resources to sustain our COVID-19 response have been exhausted, and so are my staff. Without these resources, the continued risk to public safety and our reputation is high. Our report asks for support of a staffing strategy that will support 32 temporary positions to be hired for case and contact management, immunization, healthy sexuality, and health protection programs, and specifically 3 permanent positions for the opioid strategy, which will collaborate with stakeholders to advance the Peel opioid strategy and a broader Peel drug strategy, and respond to increased demand for already strained harm reduction services, all of which continue to remain a crisis that has been exacerbated by the arrival of COVID-19 in our community. Next slide, please. We are at a critical juncture But regardless of what happens in the next steps of the response, myself and my team at Peel Public Health will continue to work to save lives, to protect the healthcare system, and minimize the impacts of COVID-19 in Peel as identified in the earlier parts of the presentation. We need to continue to work together and take actions now to keep doing what we're doing, and even after a vaccine arrives, to be able to continue to keep our public safe. And we also need to remember that keeping COVID under control is one part of the equation that will allow us to also address the other health issues faced in our community and the impacts of any intervention. It's a fine balance, and in my estimation, this is our last kick at the can before we may need to contemplate more drastic intervention, which I really do not want to do unless it's absolutely necessary. So with that, I will thank you, Mr. Chair and Council, for the opportunity both to respond to our delegates this morning and to present the current state of play and the specific ask for public health going forward. Thank you.
Thank you. And we have quite a list of questioners. Crombie, Dasko, Demerla, Kovac, Brown. Mayor Crombie.
Thank you, Dr. Lowe, for the summary. And for your budget request, this is something I could support. Two questions on the budget request. First is, was our budget cut, the provincial public health budget, the public health budget by the province? And secondly, what would be the cost, and would there be any reimbursement from the province on the full-time and part-time positions you're seeking?
So thank you, Madam Mayor. With your indulgence through the chair, I will ask if Colm is able to speak to that from FSU.
Thanks, Dr. Lowe, and through the chair. I believe the first question was on the temporary staffing. So just to be clear, the temporary staffing for these positions, the 32 temporary positions, those would be funded by the Phase 1 COVID Safe Restart funding. So those will be fully funded by the province, that temporary funding that we received. On the 3 permanent positions, right now they wouldn't be funded by the province because our funding is frozen at 2018 levels. But in future budget requests, we could submit those as part of the overall funding to be reimbursed as part of that 70-30 split. So right now we would have to fund them upfront for the 2021 budget year, but there is potential to get funding for later years. And Mayor Crombie, just to your other question about I believe your question was about the 70-30, 60-40 split. The province hasn't gone down to the 60-40 split at the moment. They're still holding it steady at 70-30, but they have indicated a willingness to keep going to that 60-40 split for the funding allocation.
Mayor Crombie, is that all? Oh, I'm going to guess it is, but we'll come back if not. Councillor Dasko.
Thank you through the chair, and thanks, Dr. Lowe, for the presentation. I just have a few questions. I guess one that I just wanted to ask a little bit more about is with regards to contact tracing.
Sorry, I got cut off and my Wi-Fi cut out. I wasn't quite finished. I'll wait till you're done, Councillor Dasko, but I do have 2 more questions for Dr. Lowe. Sorry about that. Wi-Fi cut out.
Actually, I'm okay to give time back to Mayor Crombie and let her.
Provided
I'm
sure
next.
I'm not the only one. So Dr. Lowe, Colin was saying that we were clawed back to 2019 levels, or was it 2018 levels? What amount of money did that represent for us? That's where I lost you.
So through the no worries. So through the chair, maybe back to Colin if you're able to respond to the specific numbers.
Thank you, Dr. Lowe. And through the chair, the funding right now, the allocation, that 70-30 split, is based on 2018 levels. So we submit expenses, the total expenses is based on the 2018 funding. And then the province hasn't increased it for 2019. It was a bit of a blip, and 2020 we haven't finished. So we have had additional expenditures since then, inflationary expenditures, but it's still been frozen at that 2018 funding level.
So we'd be interested to know how much that could have been for us, because it's a clawback, right? It could have been an increase to us, or to keep us whole, and it wasn't. So that's an important number to know. So just to Dr. Lowe as well, and I asked Dr. Borgia earlier, we're all balancing lives and livelihoods, and you hear that every single day. But the reality is we're now 1/3 of all the case counts right across Ontario, and that's pretty scary, frankly. We are in a dire position I know you just went through the case count numbers. Peel, it is 119 cases per 100,000, Mississauga 74, Brampton 182, and when you compare that, Toronto is at 88. So it's pretty dire. And the positivity rates, yes, while they're high, we sort of expect them to be because we're sending symptomatic people in to get testing. So my question to you is, we've seen increases in September after the kids went back to school. After Thanksgiving, our numbers went up quantum. I'm now worried about seeing the 2 weeks after Halloween and Halloween parties, and Diwali is this weekend. What advice will you give us? And with respect to that micro-targeted advice, how will that work? Secondly, you're suggesting we're at a turning point. What would the indices be that you will look at to determine whether or not you would recommend to Dr. William that we enter full lockdown? The framework is established as it is, we support, but it does give us the flexibility to tailor that framework to the local data. And we know where our sources of transmission are, and that's hence where you have added your restrictions. They're different in Peel than they are in Toronto than they are in Ottawa, and hence that. So, and then finally, my final question is one that Mayor Brown and I were asked, and I think you may have been asked also at his press conferences, with respect to schools. If we're considering lockdown as the next step, potentially, what are the indices? What about the schools? Has the province given any consideration? If we're at that point in Peel, will the schools stay open, et cetera? So what criteria will be used for both? Those are my questions. Thank you.
So thank you through the chair and to Mayor Crombie. I apologize if you could repeat your first question because I didn't quite write them all down. I apologize.
I think, basically the micro-targeting
right.
events like Diwali is this weekend, and it certainly is going to harm Hanukkah and Christmas for everyone, not Diwali, but just generally families getting together for high holidays and significant events, Thanksgiving, Halloween, even we're seeing now the evidence of that, Diwali, et cetera. So micro-targeting and messaging and what else can be done. And then certainly with the framework, what is criteria you'd be looking at for lockdown? And thank you for now sharing more of the data with us. I've been passing it on to my council as you bring it to us, and we're very grateful for the data, and we do make our decisions based on data, and when we see it, we support you 100%. So, and with respect to schools, has come up, I think it was on the GTHA mayor calls this week, Monday, that one of the chairs mentioned that he had heard they may close down early this year for the holidays, the Christmas holidays. So I wondered if you had heard anything like that, and maybe it was just speculation, I'm not sure. But basically, what criteria would you use to go further with restrictions, and what is the message we should be sending this weekend with the people celebrating Diwali? Many of our residents will be.
Wonderful. Thank you, Mayor Crombie, and through the chair. So in respect of micro-targeting of events and just sort of overall advice, I'll start with my overall advice. I think it's very plainly clear. We need to try to limit, at least just for the next little while, 2 to 4 weeks, close contact only with the people that we already live with, and any essential supports. And so I think there's a lot of confusion out there around what immediate household means, et cetera. It's the people that you live with on a day-to-day basis right now. It's really the mixing of households that increases some potential risk, especially if it's discretionary mixing at this point in time. Besides that, outside of the household, we know that there are a certain number of activities that we all have to engage in person, whether it's work or school or healthcare or accessing necessities. When you do go for those essential purposes, try to limit numbers, try to ensure that you're taking all the precautions that you can while you're out and about to try to minimize your risk with those interactions. And I think it goes without saying that large gatherings or just social discretionary gatherings, any sort of in-person interaction, that represents an opportunity for person-to-person transmission. Even with precautions being taken, you might get together with family, friends, you might be starting out 6 feet apart, but people draw closer depending on what happens. So it's best just not to take the risk, at least for the next 2 to 4 weeks. So as it speaks to, for example, Diwali, but also other holidays that will be coming, which I'm really hope that if we get this under control, we might have a shot at Christmas. And certainly the December holiday season. But at least in respect to Diwali, this is something that our team has been preparing for over the last 2 to 3 weeks. They have developed key messages. They've put editorials out in South Asian Health magazine. They have put out, they've undertaken community outreach through the community resourcing table in Brampton and Etobicoke area Ontario Health Team, together with the World Sikh organization. They have undertaken a social media campaign in multiple languages, both organic as well as geo-targeted, really telling people just not to gather, not to congregate. They've got some influencer videos that have been put together. So like Harnan Singh from Hockey Night in Canada Punjabi, MPP Gurax Mali, William Osler's Dr. Bajwai, who created a viral video earlier in the pandemic, and Peel Police's Nav Shinzer. Those are some of the people that they've had to put together on influencer videos, educational visits, outreach letters to religious leaders, and amplification by all 3 local municipalities. That's work that my team has been doing over the last 2 to 3 weeks in anticipation of this weekend, and with the goal of getting the central message out there, which is just no gatherings, do not hold, do not attend gatherings, celebrate with the people you already live with, and even if they're family members that live elsewhere, live in a different household, just meet virtually, just for the next 2 weeks, just for this year. Every other holiday has looked a little different, and so that's kind of where our advice is and how we have sort of targeted messaging, both around what we know is a driver transmission in our community and what we need to do there. I think the other pieces in terms of thresholds, I mean, this is stuff that my team continues to weigh, but I would just say as a ballpark and an overall sort of estimation, the goal is that we are going to try to see and hopefully see our reproductive number drop back to 1 or less than 1. Hopefully that cases will peter out at the current level. So if they basically manage to flatten out at the 400 a day or so that we're at right now, and then start to go down, the hope is that will happen. Certainly, as well, as long as tracing, while challenged, and we are starting to alter our processes to deal with the surge in cases, and eventually we'll, once we've landed on how we're going to do that, we'll certainly communicate it to council. But keeping an eye on that and our ability to track where the pandemic is in our community, and also with the hospital. Right now, as we understand, they still have a few escape valves, release valves, as you heard from Dr. Borgia, in terms of canceling surgeries, all those other pieces. Those are temporary. Those are certainly not things we want to do in the long term. But there are a bit of an escape valve. So the idea is we don't want to necessarily push for, because we do know that there are, certain impacts that come from a longer term closure and curtailment, a circuit breaker, if you will. But at the same time, I will not hesitate to issue a circuit breaker if it looks like the hospital is all out of escape valves. We're totally losing control, track of where the pandemic might be in our community, which I will say we're close. That's why I make the point that our contact tracing is becoming increasingly challenged. And then really, if the cases are just continuing to rise, despite our best efforts to communicate to our community that what we really need to do at this point in time, and just, and I'm going to be watching closely everything that happens over the next few days. We just really need people to stop their in-person interactions as much as possible, avoid large gatherings, stick to the people that you live with right now as much as you can to really try to bring this under control. So I hope that clarifies how we're messaging things and sort of some of the thresholds that are going into our thinking around when we might be calling for more significant measures to be taken, Madam Mayor. Thank you for the question.
Thank you.
Was Mayor Crombie, you had that pending question about the schools as well, or?
Oh, sorry. Yes. If I may, with your indulgence, Mr. Chair, I wrote it down, but I didn't answer it. So certainly we do recognize, at least in respect of schools, that these are a vital component of well-being for our children and youth, that they get a lot from being in schools, from their learning, their development, their education, their socialization, being with peers. And we have had success so far with the precautions in terms of trying to limit and prevent transmission and spread in the schools. But as I said in my remarks, if the community cases keep rising, and if they stay even at this level, the more you throw at schools, then at some point the measures are not always going to get everything. So it's really incumbent upon all of us to take the measures that we can to ensure that we can keep schools open and bring down the case counts. And certainly if the situation dictates it, we're currently, as I said, my team is in the midst of finalizing our sort of approach to different thresholds at which we would recommend other closures or curtailments in the community and or broader restrictions to Dr. Williams and certainly to all of you as council should the situation continue to deteriorate further. And schools in general, I think, will place fairly low down on that list, fairly low on that list because those are really seen as some of the more essential places, and especially just for our children and youth and their ongoing development. We want to avoid, if we're talking about unintended consequences, I mean, that's definitely one of the things that is foremost in our mind when we are also considering any intervention we recommend.
Thank you. Councillor Dasko.
Thank you through the chair. And Dr. Lowe, I guess as I started to ask, actually, I've got just two lines of questions. So maybe my first one, before the contact tracing and that line that I wanted to ask you about, if I could maybe ask about our nursing homes and long-term care. Are we looking at or doing, because I'm just not sure, I'm just starting to hear more concern in the community about possible outbreak. Are we still allowing visitors for
Yeah, so through the chair to Councillor Dasko, as part of us entering a modified stage 2 and then continuing on in the red zone, non-essential visitors are prohibited from nursing homes. I believe they are allowed 1 or 2 registered family members as visitors, but they must comply with precautions, and it has to be the same people at this point in time. And I think that's designed to limit potential importation of the disease into that setting.
Okay, thank you very much. And then just with regards to contact tracing, I'm just wondering if we're looking to put more emphasis on contact tracing. The reason why I ask is I've heard a lot, continue to hear a lot from our, especially our local restaurants, who, as many know, are on the ropes. We got very, very blessed with a really good weather summer, so that the people that were able to put up patios did. But now, as winter's coming, this is going to effectively shut down a significant amount of restaurants. They just can't weather the storm anymore. And what some of them have mentioned to me is, if the region could be, maybe have a little bit of a different tact when it comes to contact tracing. These folks, very similar to a few of them have mentioned, just with alcohol rules. For those that come in and drink underage, they get heavily fined, they get shut down. They're asking that maybe we look at it through a lens similar to that. For those that don't do all the proper protocols and extensive contact tracing and rigorous contact tracing. Is one. And then the other that gets mentioned to me a lot is with regards to the closure time, 9 p.m. They're saying effectively what that's doing, especially in places like Port Credit, where my ward is, people will come, they will gather there in a responsible, controlled environment, whether they're coming in the washrooms, sitting at a few different tables, with their 4 people. And then essentially what they're doing at the 9 p.m. range is they're going to someone's home and they're all gathering in somebody's living room, for example, and they're hearing more and more that this is where outbreaks are starting to occur. So I'm just wondering if possibly having a little bit of a different tact when it comes to that industry, because I know they're doing their best right across the region to keep people safe. And for any of those that are the few bad apples, I think should be heavily reprimanded. But seeing transmission rates or the testing rates of 3% or less, I don't think we're really targeting the right spot. So I'm just wondering if you might be able to speak a little bit about it, and look forward to your answers.
Yes, thank you for the question, Councillor Dasko, through the chair. So I wanted to clarify, certainly those pie charts and the 3% that were identified, those speak to outbreak cases in those settings. And so we know not all cases are linked to an outbreak. Sometimes they're just sporadic cases that are identified in the community. But you are right, Councillor Dasko, and certainly other members of council who have asked me similar questions around the nature of restaurants and gyms and transmission. I think think these settings, while they were not seen, at least in September, to have the similar sort of rates of transmission that we're seeing in other urban centers in Ontario, and we wouldn't see any data in October because they were closed to indoor dining. So there was just no data of anyone who had actually eaten indoors at a restaurant in October. We do know that these remain inherently high-risk settings because you are in close contact, possibly with other people who are not from your immediate household, without consistently wearing a mask. And that's essentially in areas that may be poorly ventilated. And I want to say I absolutely feel for our restaurant owners. I know how difficult this has been. We know that COVID-19 has disproportionately impacted different parts of our society, essential workers, restaurants, all these other pieces. It's by virtue of how it spreads, it creates winners and losers. And unfortunately, there's a good reason, I think, why every country on earth that has taken the decision to try to get this under control has at least imposed some sort of measure or restriction in these settings, including things like a curfew and all those other pieces. So I certainly feel for our restaurant owners. I think inherently we know, especially this is a disease that likes crowded, confined, close contact situations, that they do become inherently a high risk setting in that way. And I think the thing that I would bring it back to through the chair to Councillor Dasko is at this point in time, we're really just asking people to limit their non-essential in-person activities, and especially the mixing of households, which is a big thing. So if you must go to a restaurant, and certainly I'm sure our restaurants would appreciate help, as I understand it, certainly takeout is another great option, and that limits any potential risk of being within that venue. And you can really support them. You can order all kinds of takeout. I actually take out a whole bunch of stuff from many area restaurants when I'm in the office and keep it in the fridge for the week. Kind of feeds me for the whole week. So it's one of those things that I'd recommend. If you're able and privileged enough to be able to support our restaurants in that manner. But I think the big thing that I would highlight is just at this point in time, we're just really asking people to stick to the people they live with as much as possible. So if you feel compelled to indoor dine at a restaurant, go with your family, go with your immediate household, make sure you're sticking to the precautions as much as possible. What we don't want to see is really what you've described, Councillor Dasko, in terms of 6 poker buddies getting together, having a carousing time, and then continuing it in close contact with someone's homes, because that is essentially the perfect storm for how people transmit COVID.
Thank you, Dr. Lowe, and that's exactly what is happening. Just to let you know, I'm hearing that ad nauseum down in my community, and I know I've heard it from others as well. And so I'm just hoping that we're targeting people in the right way. And then my last request that I would make, and this is also from the restaurateurs, is if measures are coming to have any kind of further shutdown, we give them some runway. The last set, people just went out going into a weekend, bought a lot of food, especially on the perishable side, and they were just hammered with it, some of them with money they didn't have. So if we could put out some clear rules, and also with some runway for them there, because they went out, they spent a lot of money on acrylics and things of that nature, PPE. Again, money they didn't have. It's almost like akin to the provincial smoking ban in restaurants, and you could have a smoking room. People went spent thousands, and then they changed their mind and said, "No, you can't do that." Akin to that, and so everybody's trying to pivot the best they can. So I would just ask that we keep this in mind, because it's a health pandemic, but it's an economic pandemic as well, as we all know, and these folks are absolutely getting destroyed. I had one of a restaurateur in tears, as I mentioned. So if we could really keep that in mind, that's extremely significant.
Mr. Chair, if I may respond through you to Councillor Dasko, in my letter to Dr. David Williams, I did request that any future provincial changes at least have a minimum of 3 days notice, just to ensure there is that. I will say, Councillor Dasko, as you can imagine, the rapidly evolving nature of this pandemic, on occasion, it may not be possible to provide that notice, but I think to the extent that that is a principle that we have communicated to our provincial partners, and that they have committed to ensuring, we certainly don't want to leave anybody out more than they have to be, just given how challenging this year has been. Thank you.
Thank you, Dr. Lowe.
Thank you. My list is Demerla, Kovac, Brown, Thompson, Parrish, Downey. And just a heads up to everybody, once we get past this very important subject, just to the team here, I think I am going to call a 15-minute break at that time as well. So just to give you all a heads up on that. Councillor Demerla.
Thank you, Chair, and thank you, Dr. Loh. You know, Dr. Loh, I really want to begin by first commending you for taking a very hard decision that was initially, you know, not an easy decision for you. You were first off the block. I know Toronto has followed you, and you had the courage of your conviction to go ahead. And I just admire that in anyone who has that kind of courage. So I just wanted to say that. I liked what you had to say about some of the micro-targeting around Diwali. The only thing I noticed as you rattled off a list of stakeholder groups that you were channeling your message. So very impressive, but it was sort of Brampton-centric, the Punjabi and Sikh community. And, you know, the Hindu community also celebrates Diwali in a big way. And I didn't really, there were some obvious gaps, and I'm happy to send you numbers if that helps you, phone numbers and contact. For instance, the Hindu Federation, you know, there's some big temples here in Mississauga as well. So just keep that in mind that multiple communities celebrate this. And my last comment is a couple of questions. One is, I now notice that somehow Toronto is a little more stringent than Peel, and I just wanted your thoughts on that, given that our numbers are actually higher than Toronto. So it's this kind of sort of discrepancy that makes it really hard for the general public to also follow the rules. So just wanted your thoughts on that, and how comfortable are you with the level of restrictions we have in Peel, given our numbers now?
So through the chair to Councillor Demerla, thank you very much for the question, and we would certainly welcome. I imagine my team has also contacted and recognizing certainly that the Hindu community also celebrates Diwali. So I imagine it's part of the plan, and maybe just wasn't in the examples that I provided, but we would certainly welcome any additional information and context that you can provide. In respect of Toronto versus Peel, I do believe that Dr. Eileen Davila and Toronto Public Health have brought into place measures that are targeting their largest drivers of transmission. And we do know that prior to the modified stage 2, they did have an issue with indoor restaurants, and they did have an issue with gyms. So I suspect that that's why they've moved in that manner. For our part, I recognize that there is that discrepancy and that inconsistency. But again, I'm trying to work with balance, as I said, taking a balanced approach, recognizing that whatever measures I do put in place, in somewhat speaking to Councillor Dasco's point, there are unintended impacts, and there are effects that impact other aspects of people's well-being and health. And so, to the extent that what we've seen in our jurisdiction has been small and large social gatherings, certainly get-togethers at home. I guess people are more likely to go over for dinner here in our communities rather than to go to a bunch of restaurants, as it were, or at least that's what I can discern from our data. Certainly the places of worship, which I know has been met with some resistance in the community, and I wanted to be very clear that I recognize how important faith and religious observance is for so many members of our community. But I mean, I also have to speak to the data and evidence of what we are seeing and just those pieces. So just really asking that community to work with us as well in terms of limiting congregation and gathering, really, and then the larger social gatherings such as wedding receptions, birthdays. This is where we're seeing lots of things sort of unfold, and I think that's where our restrictions came down from. It really is the key message at this point in time of stick to your household, the people you're living with, essential reasons only in person for small things, and then for the big things, like at this time, celebrate but don't congregate. Now is not the time to get together in person. Just put it online and have a big Zoom. I myself had a big U.S. election watch party on election night with friends from all over the continent. It was actually kind of neat, and to see everyone sort of in the same room. And I encourage people to think of other ways to bring together large groups, especially in the critical next 2 to 4 weeks here in Peel.
Thank you. So my second question is, and Councillor Dasco has been certainly a strong advocate for restaurants, and rightly so. So my question is, I will follow I'm happy to support the best evidence. But the one thing that I've also heard from some restaurant holders is operators and gym operators is if we are going to allow some level of indoor dining, does it make sense to have a hard cap regardless of the size? So now we are at 10, regardless of how big the restaurant is. I just, if you want to shut it down completely because that's what the evidence says, that's one thing. But if the evidence says it's okay to have some people in the restaurant, I guess, my ask would be to look at to look at size as well. So just your thoughts on that.
So through the chair to Councillor Demerla, absolutely. At this point in time, we're asking people to limit large congregation, and so certainly larger restaurants on a percentage basis. And this is also the challenge that we have in places of worship. The more people you have, the more possibilities there are for interactions. It goes up, that many more fold. And I think that's part of the challenge. It basically makes contact tracing impossible if you have. So some of the large places of worship, for example, 30% of capacity, if you've got 300, 400 people in there, the number of interactions that could be happening both on the sidelines before and after the service, it becomes that much more challenging to really figure out who was there and how, and even if the contact tracing logs are good. So to some extent, I would even say for the restaurant owners, if there is an exposure in those instances, they're actually bearing a risk because we may actually need to name them. If we're able to manage with a small number and say, okay, we've figured out which staff and which people were on the place at this time, and those are the only people that are exposed, we can contact them all based on your logs, then contact tracing can continue. But if you've got too many people in there and there's no guarantee that they were all separated, or you're not sure if they were all separated, or if it was a staff member that was serving multiple tables, with hundreds and hundreds of people in there, then we basically have to say, well, there's no way we can reasonably contact trace this. So basically, we're just going to have to say this restaurant had an exposure. And then that's potentially negative publicity that they don't want. So it's to some extent, it's to help us with contact tracing, but to some extent, it's also helping restaurants make sure that they're managing their risk as well.
Well, thank you for that, because that certainly helps me communicate, and I was not aware of that context. And then my final question is, you're a strong communicator, Dr. Lowe, but the one thing that might help is there's things that we read in the media that we don't know until quite late. For instance, I was reading in the Star yesterday that a transmission rate of 3%, that's when things start to go out of control. Now, those numbers, so, we don't have context for those numbers. When you say we are at 3% or 15% or 7.4%, what does that mean? So I think as you communicate, my request is two things. One is, when Mississauga is now at around 7%, what does that mean in terms of exponential growth? What does that number actually mean? I think if you can communicate that, we'll have better luck in persuading people around the COVID fatigue. And a similar idea is, we sometimes focus on today's numbers, but to your point, perhaps you can also speak to if we didn't do anything and the infection rate is, the test positivity rate is around 7%. This means if we did nothing, a week from now, you will have X number of cases. I think that kind of messaging, I have not seen enough of that, and my request is that you include that. And finally, for Diwali, don't just stick to ethnic media. My plea would be, it's a much bigger festival now. The demographics have changed. So any chance you get, even on mainstream media, please put out quite similar to the way it was done with Thanksgiving, so that it's not just treated as, this small, tiny ethnic issue, but definitely much more mainstream. Those would be my comments, and if you had any response to that.
Yeah, so through the chair to Councillor Demerla, I'm absolutely happy to contextualize the numbers more. So in the future, when I present the data, I can also present where we should be. And I think that that might be helpful. In terms of where we are going, there's obviously challenges with predicting the future in general, but I would say to a large extent, I've tried to leave the modeling more to the provincial modeling table, and to the extent that their models are often split out by health units, and to where the province goes, you can expect that that's largely where Peel is going to go, because we have the bulk of the cases at this point in time. But I think I've been very clear that we are at a bit of a tipping point here. Exponential growth means it's similar to compound interest. It starts out pretty slow, but as a friend of mine who's a physician in the Netherlands explains, you're sitting at 500, 1,000 cases, and the next thing you know, it's 16,000 cases 2 weeks later, kind of thing, depending on how quickly it grows.
Yeah.
So that's kind of where we're at. And I think if we keep that, just the idea of compound interest in mind in general, that's the overarching piece. But I do know that the province's new modeling numbers are going to be released this afternoon, and I would encourage everyone to pay careful attention to it, because I think it really underlines the very significant caution that I've provided in this today. And the last thing I would say, absolutely, we're saying both mainstream media as well as ethnic media. I'm happy to share this piece as well. I did high school in Malaysia, which is where my family's from originally, and enjoyed many Deepavali and Diwali celebrations in Malaysia. And certainly it's a festival that's very close to my heart. And for those of us that are for those in the community, I would just say, it's just going to have to look a little different this year, as with everything else. But wishing everyone a happy Diwali, obviously. So thank you, Councillor.
Well, thank you. And it's great to have you in our corner. Thank you so much, and happy to you as well. Thank you, Chair.
Thank you. Councillor Kovac.
Thank you. And through you, Mr. Chair. And again, if you want to just kindly let me know if there's lag and you can't hear me and it's a bit choppy. Dr. Lowe, I appreciate your presentation, and just with respect to places of worship, it's comforting to hear from our Director of Enforcement at the City of Mississauga, just to share with others here, that to date, all of the reports that have come in necessitating by law enforcement officers to go out and take a look at places of worship, that they've all been identified as having been following the rules really well, whether that's physical distancing, parishioners wearing masks. So it's been pretty positive so far. Councillor Dasko earlier talked about Port Credit, restaurants, our business community, and I as well have been hearing from a number of business and restaurant owners, and he had made mention of, if it's gathering in a controlled and responsible manner, then that is, I guess, something that needs to be considered. And you had mentioned the nature of restaurants and gyms. I have a Square One shopping mall, and I've been given an impression, not just from patrons, but from employees, people who work there, in addition to a couple of conversations that I had with MLEO officers at the city, that it's a little bit of a tougher situation over there. And I'll just read 3 quick sentences from an email that I just got this morning from an employee within Square One. The weeks ahead will see a great number of people passing through the mall with Black Friday on the horizon, Christmas shopping and Boxing Day, the busiest day of the year. Since the mall's reopening, government regulations have not been complied with by the majority of our patrons. Later on, traffic in the mall has picked up, especially between the hours of 5 and 7 on weekdays, at which time we close. It is likely that the mall hours will be extended towards the end of November. As an employee, I'm not able to walk even from point A to B and maintain social distancing, not even a bit during those hours. That came in from an employee. I don't know, how would you recommend that we work with our partners in the business community, such as Square One and other malls?
Yeah, so thank you, Councillor Kovac. And, that's really helpful data from your enforcement folks. If I, through the chair, might supplement with data from public health, in the month of October, we had 50 case investigations, which were linked to a place of worship, either an individual who was infectious and attended a place of worship during their period of communicability and subsequently transmitted on to people, or who had received a positive, and the only potential place of acquisition that they identified was potentially a place of worship. So certainly it's good to hear that the measures are being followed to the extent that they are, but it does appear that some breaches or some lapses may be happening, and certainly that people may be attending places of worship while they are meant to be isolating or maybe sick with symptoms of COVID-19. So that's the additional data that I would bring to bear to shore up the full picture, certainly from the enforcement data that you've provided, and really support the reason for my instruction instruction, but now a recommendation to places of worship to really consider virtual services at this time. In respect of working with the business community, I've had some really great conversations with all of the Board of Trades across and certainly the Caledon Economic Development Office throughout the course of the pandemic. We provided guidance and webinars around safe reopenings, and I think it's the business community I think understands that important balance we're trying to figure out around if we keep COVID-19 under control, our economy will stay largely open in some sort of adapted fashion, versus if we reopen the economy, then eventually the economy ends up closing again because the virus spins out of control. So I think to the extent that people are identifying these challenges in these settings, I would encourage them to continue to bring them, and certainly all of council, if you're identifying these, I receive questions around this all the time. I'm always passing them on to our team. But the most essential things are, certainly distancing, if it's not possible, masking indoors where distancing is not possible. And maybe it's a matter for operators, owners to really look at the nature of occupancy and crowding in their venues. Ventilation is another thing that I understand people are being encouraged to look at through provincial and federal guidance. And so we'll continue to work with our business community, but I think I would underline, and I think most of the folks that are out there know that keeping the population healthy and keeping COVID under control is an essential part to also keeping our economy open with confidence.
Thank you for that, Dr. Lowe. You mentioned the Core 4. In addition to our encouraging and continuing to encourage that people practice the Core 4 to the best of their capabilities, would you not also see to some, to a degree, some benefit in our additionally suggesting or encouraging that people get their bodies healthy, get outside, exercise, walk, get some vitamin D, take vitamin supplements. I don't want to go as far as saying, eliminate alcohol and caffeine and sugar, but, get themselves into a better state. And then just a spin-off question of that, would that allow for our being healthier, allow us to better fight off the effect of COVID if we were to get it? I guess that would be my question.
So through the chair to Councillor Kovac, it's a great question. I will never argue against recommending that people try to live lives as healthily as possible, eating healthily, ensuring that they get exercise, limiting their alcohol consumption, not smoking, quitting smoking if they already do. All the basic advice of public health in terms of how we can ensure that our health status is as optimal as possible is something that I will always advocate for. But I think in respect of COVID-19, in addition to those pieces, we do really need to take the Core 4 very seriously. Part of the reason why we are having this challenge and why we need to do this is that we are still learning about this disease. We know that young people who have it, most by and large, may have mild illness, and certainly they may be ill, but we have people who are perfectly healthy, who have taken all the steps that you've mentioned, and subsequent to their infection continue to have long-term consequences, continue to have chronic complications. This is borne out by much of the data that's coming out of the United States from people with their post-COVID syndromes, or long haulers as they're called, just simply by virtue of how many people have been infected in that country. So we don't know in the long term how it's going to impact people. We also don't know in the short term how things are going to impact people, because what happens with a new virus that the body has never experienced, in many cases, the severe presentations are because the human immune system overreacts to the virus. So it's actually your immune system is maybe too good and too primed, and it results in this sort of cytokine storm and all these other pieces that result in people requiring intensive care with steroids and all those other pieces that have been identified. And so it becomes a bit of a game of roulette, because you don't know how your immune system is going to react, and you don't know if you're going to have long-term consequences afterwards. So our best defense, in addition to the regular preventive advice that you've said about keeping healthy and having good healthy behaviors in the event of an exposure, is to really try to limit and prevent any potential exposure by, at this time, besides the Core 4, trying to just limit your in-person interactions, at least for the next little while we get this under control.
Thanks for your response.
Thank you. Mayor Brown.
Thank you, Chair Yanika, and thank you, Lawrence, for your dedicated hard work. I know these are challenging days. I know we got some good news on Monday night about a isolation center that'll be a big help for our essential workers, those in precarious employment, those living in crowded living conditions who don't have a safe plan to isolate when they test positive, or people that simply can't afford to isolate. Do you have a timeline on when that's going to be operational? I'm getting a lot of questions saying, how long, now that you've got the funding, will it take for that to be effective so that we can communicate it to the public that it's open?
So through the chair to Mayor Brown, thank you for the question. In the application we put forward to the federal government, the date that was requested was December 1st. However, we are now in communication with our federal partners, recognizing that the facility is already operational and is already providing providing isolation for individuals in the shelter system who test positive. We could obviously continue to press our federal partners to see if that can get scaled up sooner rather than December 1st.
Well, I think that would be very helpful if you could press them. The sooner we get that operational, the better, because I've heard too many incidents of frankly, COVID positive individuals who are isolating in crowded living conditions that's contributed to household spread. So I think the sooner that is operational, the better. And thank you for your advocacy on that. And Mayors Crombie and Thompson, I know we had to get a little bit noisy to get the federal attention. I know you had to put in 4 different submissions, but at least that help is on the way. The second thing I wanted to ask you about is this morning on CBC Metro Morning, Jaspiran Singh Sandhu, who many of us are familiar with, quite involved in the community, said that Peel Public Health needs to do a better job at cultural engagement on COVID messages. And I know you've started some new initiatives, and I think Deepika was referencing this as well. But maybe you could highlight where there are opportunities for us to do more, particularly with Diwali and Bandi Chor Divas so close. Is there engagement with local Gurdwaras and Mandirs, and is there anything we can do as regional councillors to help you with that engagement of cultural communities in our cities?
So thank you for the question, Mayor Brown, and through you, Mr. Chair, and through you, Mr. Chair, to Mayor Brown. I know that, in fact, there has been tremendous work done with the community, and again, I know that for our public relations and communications, they've identified all the major holidays throughout the end of December. Navratri, Diwali, Bandi Chor Divas, Gurpurab, Hanukkah, Christmas, Kwanzaa. Like basically, these have all been identified. And as has been mentioned, there's always key messages that are being developed together with the community through the community response table, and providing weekly updates there, and an engagement survey. Certainly working on social media with influencers as I've described. There's a lot of work that is getting done. That said, fully recognize that there's always opportunity for improvement. We're always willing to work very closely with the community. So anyone who has any concerns, or certainly Mayor Brown, should you or any member of council identify an opportunity, we're always looking for feedback, as well as other avenues for us to get these critical messages out to the community. So I know that our team, and certainly they've not only been doing this work specifically, but all the other broader communications work, as you can imagine, in trying to keep the whole community informed, and certainly our partners informed as well. And so we're always welcome for additional help and perspective from the community, and we continue to work with the community response table and other partners, and we'll work with all of you as council to get the messages out. Absolutely.
One last question, Dr. Loh. I know we got some good news recently from the provincial government that we're going to have 70 staff for Peel Public Health to help with case management and case workers, but I understand that it takes time to train these individuals and to get the right people for those positions. So it's not as simple as funding, because you need some runway to get people prepared. And this is a niche skill and a niche training. And so could you explain how long it takes to get people up and running? And also, if we know that numbers are going to grow, and that we're reports of a vaccine and coming out in 2021 are still some time away, can you forecast if we're going to need additional supports? Because maybe we need to do some of that preparation now. Could you envision 2 months from now, from us, for us needing additional resources for Peel Public Health. Because I was asked this morning when I was doing an interview on CP24 with Mayor Crombie, what else do you need from the province? And so I think I put that question for you. If we know we're going to have a deteriorating situation, if we know that this environment could become more challenging, what specifically do you need more of, and do you need more runway to prepare?
So thank you for the question, Mayor Brown, through the chair. The report lays out the immediate resource asks that we really do need, both to support the ongoing COVID response as well as the key emergency, at least around opioids, that has been impacted by the COVID response, and us pulling those off, but still seeing that percolate through our community. I think at this point in time, it contains things like immunization coordinators, the case and contact management, folks, all the aspects of that resourcing that have been really meant to try to shore up what we need. I think as the situation continues to grow, we will continue to shore things up, and we're certainly grateful for any resources that can come in this regard. But I think in keeping the community safe, our focus, if the picture is starting to deteriorate, needs to turn away from just focusing on case and contact management and really more towards broader measures that encourage the public to do the right thing. And so that's why the letter of instruction came forward, because certainly as a fire grows, there is you can keep throwing more fire trucks and firefighters at the issue, but you may also need to look at how the approach is changing to encourage people to stop setting fires in the first place. And so that's kind of the balance that we're trying to find here. But I want to be very clear that the report speaks to the resourcing needs we need at this point in time. It's difficult, as you can imagine, as this continues to unfold, and to the extent of any anticipated immunization program that may be contemplated beyond what we've asked for right now. But I will provide at least the assurance that as additional resource needs are identified by our team, we will certainly continue to bring them back to council. And in respect of how long it takes to train up, it varies depending on the individual. But we have people that are up and ready to go within 3 to 4 days, but we have other people that over 1 to 2 weeks with mentorship, et cetera. It all depends on the individual and just really how quickly they grasp the key aspects of case management and contact tracing. But we are always looking for ways to make that process more efficient and more streamlined without compromising quality and the work that's actually being done.
So the additional staffing that the province just announced, when do you envision that being operational?
So through you, Mr. Mayor, Mr. Chair, to Mr. Mayor, as I understand it, this actually speaks to the ongoing resource commitment that they have made for us already, and so we continue to receive case managers and contact tracers on a rolling basis from the province. I believe our next batch is scheduled to come in about 1 or 2 weeks' time.
Okay, thank you.
Thank you. Mayor Thompson.
Thank you, Mr. Chair, and I'll keep it short and sweet if I can. Dr. Lowe, I know we've been talking about a number of the issues where our contact or where our breakouts are, but it's also people showing up to work because they have to, especially the part of the public. What are the percentages on that?
So through the chair to Mayor Thompson, just to clarify, you mean what are the percentage of people that are showing up and then causing a workplace outbreak?
Yeah.
So through the chair to Mayor Thompson, I don't have that number offhand. However, the point is that someone is showing up to work while they are infectious and then causing a workplace outbreak and exposure. So the presumption would be that all of the workplace outbreaks are caused by someone showing up ill at work. Now, we do know that asymptomatic transmission occurs, and certainly our own data identifies that 10% of people may be asymptomatic up to. But that would still mean that you're looking at 90% where people may have showed up, they just had a runny nose or whatever the case might be, and subsequently resulted in some form of exposure outbreak at work.
Well, I know with factories and manufacturing and different things, people are showing up. I'm just wondering, Mr. Chair, I'm circling back to you because you're meeting with the MPs tomorrow, and maybe it should be even going out as a letter as, maybe we need to ask the province and the feds for sick pay. So that we are not forcing people to show up sick, infecting everybody else. It's just helping get things under control, and maybe something we can ask. And also, Mr. Chair, when you're meeting with your MPs tomorrow, and you also ask where show up with the money, because I think where Councillor Dasco and DeMarla were going is a lot of businesses have used up money that they don't have. They're expanded their credit cards and everything else because the money that's promised to them still hasn't flowed. Even their employees, when they've been off, the money hasn't flowed. So people are showing up doing things because the money isn't there. So I think that's something that maybe I'm willing to do a combined letter again to, to say, hey, put your money where your mouth is. Let's get the flows flowing, because I really think that's where the angst is with people. It's getting dark. People are getting financially stressed. Holidays are around the corner. And I think it's leading to mental illness. And I know it's getting tied up in Ottawa through debates, but I don't care what stripe you wear in Ottawa, get the money flowing because our public need it. Quit out the political posturing. People don't care. Just get the money flowing. And I think that's something I'm going to ask that we can, as leaders, to take the lead. And I know that sick pay, I can't take the credit on that. That's really Mayor Crombie through a number of discussions as well. But I think this is something we need to ask, because I think what all the little things we do right is going to fix the big problem in the end. Thank you.
Yes, Mayor Thompson, what I would say is you can rest assured that was on my list tomorrow for the MPs and the MPPs. Great, all the pronouncements, and you're right, Mayor Crombie is incredibly diligent at saying, we'll thank them when we actually see the money. So I was going to convey that, and I like your idea of a letter as well. So I'll leave that with the chair. Councillor Parrish.
Yes, thank you very much, Dr. Lowe. I'm about to send out a newsletter to every household in my ward. I'm still old-fashioned. I don't do them electronically. Would it be possible for you to send me a template for the color levels? Something simple, that red, yellow, orange. And then if there's a separate one for your particular requests, you could do that in another column. It doesn't have to be perfect, but because I have a graphic guy that can move it around, but I want it to be accurate. We had a long discussion at our council yesterday about how we can get the message out quickly on the colors. Color's easy. Like you could put roadside signs up and it just has orange on it, but they have to be able to go to one that they've stuck on the fridge and look at it. And I think it would be valuable for anybody who's doing a newsletter right now. Secondly, I want to reinforce what everybody's saying about the restaurants. I got a letter from a family that's been in the business for since 1978. I can't do the math. He's got 1,700 square feet for seating. He has a space for 120 occupants. And he said the occupancy level should be determined by the size of the space and keeping people apart. And it's already his lawful duty to ensure the health and safety of his clients. And he's safer than a supermarket in Peel. So if you are talking tomorrow, Nando, with the MPs and MPPs, you maybe tell them that this is one thing that's really annoying people because they don't understand it. So they can go on a patio and sit there and be fairly close to other people because there's some air circulating. But I think Councillor Dasco made the point that these restaurateurs have spent their lives following health rules and being very responsible. And they don't want outbreaks in their restaurants because they get closed down. So if we could just do that one, I think people will understand. As you said, kids need to go to school for a whole bunch of reasons, socialization being one of them, keeping them getting antsy, like my grandkids. But I think adults, if they could take a break once a week, once every 2 weeks, and go sit in a restaurant for an hour, it would probably do them some good, and they'd come back fortified to follow the rest of the rules. But those are my 2 points, and I want to report to you, I have had a runny nose since the end of August, my friend, and I don't have COVID, but when I wake up, I go, today's the day. I'm looking for a frost. I think that's going to stop it all. It's this allergy stuff. But if you could do that template or have somebody do it for me, I would really appreciate that. A lot of the older people want something in writing.
So through the chair to Councillor Parrish, thank you for that. I will bring that back to my team, and they will reach out to your office to figure out a template, and we'll be sure to share it with all of council, because I think that certainly that's something that that all of council would probably benefit from, and certainly in terms of the restaurants, I think that's That's well understood. Has been brought up here and there. I do want to reiterate, at least for the immediate future, for the next 2 to 4 weeks, to the extent that we can try to get people to limit their in-person meetings to the most essential and to keep it to people in close contact that they already live with. Hopefully that will get us to a point where it will be more reasonable and safe for people to start perhaps patronizing things more frequently out in the community as a whole. So I just wanted to sort of, I agree, certainly social contact is important, but really it's the mixing of households that we're trying to target at this point in time. But thank you so much, Councillor Parrish, for your support.
Well, my granddaughter understands. She's 11. She came over the day before we were supposed to, stop because I don't know when I'm going to see you again. And if my mom's car's on your driveway, you might get arrested. I'm kibitzing with me, so it was nice to see her. But I'm going to miss them. Everybody misses all their friends and their relatives, but everybody's doing a good job. Everybody's sticking to the grind, and thank you very much. The Toronto Star complimented you highly, and I agree with it.
Thank you. Councillor Downey.
Thank you through you, Chair, to Dr. Lowe. Lawrence, if you wouldn't mind if we could just go back to the conversation surrounding schools. I had a question regarding support workers and the Erin Oak Centre, and if we were to go into any form of closure, if that would be considered essential. Spec Ed parents are, obviously at the end of the road most of the time. And this situation is not obviously helping that. So that's one question. And also, in terms of communication and all of the avenues that we're using, are we utilizing our partnerships or our relationships with our community partners, such as schools, to utilize their signage, their modes of communication to get our message out at a broader level, because I think that if we were to give that direction and make that communication with our school board partners, with local churches, anybody that basically has a sign at the end of their drive, have the core four, recommend that people are staying home and staying within their bubbles, really encouraging people to use whatever methods they have to pass our message. And then thirdly, a question that kind of came to mind during this conversation, in regards to the places of worship. I sit on my church executive, and we went virtual in March, and it was a tough decision, but we did it, and it was surprising and impressive to me that 90-year-old members of our church community could figure out how to Zoom meeting and get on their iPad. So my take on it is, if they can do it, we can do it. And I wonder why there are still places of worship that are not following suit, and if there's anything that we can find a mechanism to really impart on those places of worship to follow suit and do their part in what we're all doing together.
Sorry, I don't know how that happened. I apologize. I ended up on mute. So through the chair to Councillor Downey, in terms of what was described at schools, the Erin Oak Centre and support workers, I assume these are support workers that are coming on site to assist with teaching, etc. My understanding is the advice that we've given around workplaces that no essential visitors be on site leaves the definition of essential up to the operator and the owner-operator, and essentially is broadly defined as someone that is not necessary for the function of the business. From what I understand and what you're describing, it sounds like they would be necessary for the instruction and the functioning of that business. So presumably that they would be designated as an essential visitor. In respect to communications, that's really wonderful. I imagine our communications team has looked at stuff, but I will go back and I'll go back and double check. Certainly with our comms team, if that avenue has been fully explored. Then in respect of local churches, I did receive quite a significant amount of correspondence from many churches that, not just churches, but many places of worship, following the issuance of the letter of instruction that resulted in walking back the letter of instruction to a strong recommendation, recognizing that different places of worship and different faiths may choose to practice it in a different manner. And I think the compromise in what we had done was certainly a strong recommendation for virtual celebrations. But if in-person sessions had to be held, that they also be capped at 50 with physical distancing and seating only with one's immediate household. I think the strong recommendation still stands to the extent that places of worship can move virtually, especially during the next 2 to 4 weeks. That will limit congregation and limit the possibility for transmission. So, it's really great to hear, Councillor Downey, what your church has done. And I think to the extent that, what I may bring back to our comms team is, can we maybe highlight some of these success stories of places of worship that have made it work in the pandemic and kept their congregations or their adherents and the community safe. That might be a way to really, from a positive side of messaging, show that it can be done, and to show that it can be a way forward for some of the places that are trying to grapple with the same questions.
Thank you, Dr. Lowe. It's disappointing to hear that you received pushback from places of worship. I think that we all recognize today's actions build tomorrow's reward, and that 2 weeks virtually or 2 to 4 weeks is a small price to pay to make sure that we don't see ourselves in a worse position than we did earlier this year. So any support that we can give there, I'm happy to put forward. Thanks.
Thank you. Councillor Fonseca.
Thank you, through you, Mr. Chair, and I apologize, my video's off. I am experiencing some lag with my kids going into their quad 2 today, and the sudden announcement that it was going to be from home rather than at school. So anyway, I do want to say thank you very much, Dr. Lowe. A number of my questions have been answered, but so I will just echo in terms of around the supports for the restaurants. I'll just echo what other councillors have said, Councillor Parrish, Councillor Dasco, Councillor Demurla. I think the conversation today, you've made it very clear, but also I will echo in terms of giving these businesses a runway wherever possible and a heads up and notification. They truly are struggling, and I recognize that we have to find a balance, and it's for the good of all of us. But I just want to echo on behalf of the businesses, the restaurants and hospitality, that they've been hit extremely hard. I do have a question to that extent. Another business, another sector, in terms of giving them runway and notice, and I'm starting to receive questions around this, and it's with regards to daycares. So daycares that are standalone daycares or daycares that are attached to schools. Will there, or do you foresee any changes? So I've received questions not only from the daycare staff or owners, but also parents. So do you foresee any changes in terms of protocols or policy with regards to daycares?
So thank you for the question, Councillor Fonseca, and through the chair. At this time, for us at the Region of Peel, we're not identifying any changes to schools and daycares beyond the extant precautions that are being taken in those settings. We do recognize, as I've mentioned, that the cases that we're seeing in schools and daycares are more a reflection of, rather than a major driver of transmission in our community, especially with the precautions in place. So to the extent that we can bring community transmission down, we can continue to protect those settings. And I think the only other thing I would add is most of the guidance and the precautions that have been put in place are governed by provincial protocols. So any major changes to the nature of protocols in those settings would likely come down from the province.
Okay, thank you. With regards to the long-term care homes, and some of my questions have been answered, but one that that I have, are provincial inspectors continuing to go out to the long-term care homes on a regular basis? I mean, a number of the outbreaks that we've seen recently, and as you referenced, there's Peel has done a great job out of the learnings from the March and April timeframe or the spring timeframe, and moving through into the summer, just in containing and putting best practices in place in the long-term care homes. But just curious, are the provincial inspectors still continuing to go out to these long-term care homes?
So through you, Mr. Chair, to Councillor Fonseca, thank you for the question. As I understand it, the Ministry of Long-Term Care continues to inspect on a compliance basis various long-term care homes. I don't have any insight as to their schedule and the frequency of these inspections at this point in time. What I can speak to, at least in the region, is that we do have our integrated response table, which still continues to meet regularly on, I believe it's like a once or twice weekly basis to assess what the situation is in our long-term care homes, to identify homes that may require visits from infection prevention and control specialists who may have staffing challenges or other pieces. Peel Public Health is still part of that process in our homes. And I think that's been part of the reason why up until just recently, when community transmission started to take off, we've been able to keep things to mostly just a couple staff cases here and there picked up on surveillance testing. So I know that we're continuing to be in those homes and to work with those homes as we need to, but I'm not sure where things are at with the ministry. I do know as well from, I believe, the Commissioner of Health Services has advised me previously that all long-term care homes needed to put together a COVID-19 preparedness plan and submit to the ministry, at which point they might undergo review or audit. And so I would imagine the Ministry of Long-Term Care is still very involved, but what I can speak to is really our ongoing local response, which is really trying to keep this out of the homes altogether.
Okay, thank you. My final question, or I guess combined comment question. You've raised on a number of updates the importance of the advocacy for paid sick leave. A number of councillors have raised it here today. You've also recommended or proposed or requested in terms of staffing and staffing in the overall budget, a number of immediate resources in terms of different staffing requirements to address COVID. And Mayor Brown actually asked one of the questions that I had with regards to the training, which you answered. But in terms of the paid sick leave and the advocacy, and this being a turning point, I know that we are, I guess it was brought to my attention, there's a meeting that went out that's going to be held with the MPPs on Friday morning, and MPs. I do think it's unfortunate that that communication went out. I guess it only went out through government relations or two members of the government relations committee. We've had a number of discussions that collaboration. I think we here at the region, we're all on the same page. We've had discussion week after week on the importance of protecting all of the residents, the staff, the hospitals, the long-term care, the schools, of course, all the residents right across the spectrum in terms of ages, and how important it is to have the conversation and the coordination and collaboration with the MPPs and the MPs. And I just think it's unfortunate that we're having this meeting with the MPPs on Friday morning, that we weren't all notified of it. So in terms of advocacy, and on a point such as this, where we know and we've heard that those that are very vulnerable are fearful and returning to their workplace because they're fearful that they may not have a job if they don't. Or they may be going to their their place of work because they feel that they may only have a sniffle, and they need to do that in terms of making sure that they can, because they're bringing home, they're the major income earner in their homes. But at the same time, I don't think we've actually sat down outside of AMO and had a direct conversation with the MPPs and the MPs and the and also ourselves at regional council, at least the MPPs and the MPs in the region of Peel with Dr. Lowe. I recognize there's many tables where everybody is at, but in this case, with this turning point here and the state that we find themselves in, I would request that if there is another opportunity beyond Friday to speak directly with the MPPs and the MPs, I think it would be greatly appreciated. It's just unfortunate. I know that Friday morning, a lot of us sit on Credit Valley Conservation as well as Toronto Region Conservation Authority, right smack in the middle of the time when the meeting with the MPPs and the MPs is going to be going on. And I, for one, if I had known, well, maybe not, because the TRCA meeting is also an advocacy. We're going to be having discussion about the importance of, again, of COVID and advocating to the province around the Conservation Act. So I recognize that it's a challenge to bring everybody together, but we do keep talking about the importance of collaboration and coordination and being all on the same page. And this being such an important turning point and threshold when it comes to whether or not we're going to be moving into complete lockdown. And so I do think it's fairly urgent that we all elected officials have an opportunity to get together to have this discussion. And unfortunately, I don't know how many of us are going to be available for Friday morning. So I guess that's more of a comment than a question to you, Dr. Lowe. But I do know from the paid sick leave standpoint, you've raised it a number of times. And I do think our advocacy is important, but it's just very difficult for us to advocate if we don't have the opportunity to do so directly to the MP. So thank you.
Thank you, Councillor Fonseca, but I think the Commissioner of Corporate might like to put some clarity around this Friday meeting if she could. Go ahead.
Thank you, and through you, Mr. Chair. Friday's meeting came out of the very successful meeting we had with the local MPPs and MPs prior to our annual AMO conference. And it was decided at the Government Relations Committee that we should try to have a few of those sessions a year with the Government Relations Committee as well as the MPs and MPPs. This Friday's session was meant to be an emphasis on housing as well as a review of some of our general advocacy positions. Just this week, because of the events that have happened recently and the letters of instructions, et cetera, there was a request to add COVID and Dr. Lowe to the agenda for Friday's meeting. So though that is the impetus of those meetings. It was set up some time ago, and it is a Government Relations Committee meeting that all council is invited to attend, but it is with a focus on the Government Relations Committee. So it is open to all council. We were aware of the conflict with the Credit Valley Conservation Authority board meeting, and I know that we did lose a few of the councillors to that meeting, but this was, as you can imagine, it's difficult to find a date that we can get the local MPs and MPPs to, and we are going to have quite a good turnout on Friday, so I apologize for the conflict in the dates, but that is the impetus and why we had that meeting scheduled. Thank you.
And I would just add, as many are aware, you want to meet with an MP or an MPP, the only day you can meet is Friday, because many of them sit Monday to Thursday, so we're kind of limited by that as well. But yeah, everybody welcome as always, but maybe the next time beyond the government relations, we'll publish it a little bit more far and wide. So your point's duly noted, Councillor Fonseca. Councillor Starr.
Thank you. I'll try to be as brief as possible. Dr. Lowe, I brought this up at our meeting yesterday in Council of the City of Mississauga that I'm not sure and how scientific and how logical or how the numbers were determined, i.e. 10 and 100 and 30% and all the rest of it. To me, give you an example, a small restaurant with 22 seats, they can have 10 people. a large restaurant with 158 seats, they can have 10 people. There is no way that these restaurants can reopen and service their clients. In fact, I spoke to one of the small restaurants that we have here. It takes 4 to 6 people to open up a restaurant. And so they serve 20 meals during the day, whatever. They're going bankrupt. As simple as that. And, and they have $7,000 a month to pay in rent. I know there's alleviation on all that, but I'm bringing this as a comment. Maybe there's a way you can find out what the empirical data is showing, why the numbers are that way. And I guess being a little bit of a technical person, I just can't see that whenever we go up and down, it just jumps to some parameters that somebody has come up with, and how are they working? And I want those questions asked because I think it's important. I've been asked that already, and I don't really need a response on that. But the other thing is, too, with the other one that came through loud and clear was gaming centers. The same thing. Those are huge centers. We have one in Mississauga called RAMA. It supports probably 40 charities. And we're saying allow 10 people. I think it's down to 10 now. If you ever saw the facilities, you wouldn't see where those 10 people were. And where's that number coming from? And if you ever took a tour of that place, you'll see that they have had 4 people completely sanitizing almost on a daily basis. So it's the numbers aren't there. And the last point is food stores. Food stores are jammed with people that don't respect the whole system. I was there Saturday in the fruit department trying to buy some kumquats or mangoes or something. And there's a fellow with a mask down around his chin like this, no gloves, going through all the fruit and talking to his wife and, and putting up fruit like this and actually smelling it and putting it back. There's got to be either better signage or better control or something there. Somebody's got to bring that up. I mean, the lady beside me said, "Oh, that's it." Well, I said, "That's it for me too. I'm not buying any fruit today," because you don't know how many other people have gone through that and doing exactly the same thing. And that was total disrespect when this person had that. And the lady spoke to him, and I heard him say in soft terms, those 2 words, 2 famous words. I mean, to tell a lady that, I was appalled. There's so much disrespect out there and thinking that it's not going to happen to me. And I'm passing these comments on so that you folks, when you have your deliberations at a higher level, try to get some answers for that. So that's my brief comments. And I know we've kept on and on with all of this, but certainly those are things that are bothering me and probably a lot of other residents too. So keep up the good work, but it's not good news, unfortunately. Bring some good news one of these days. Thanks.
Thank you, Ron. I think I'm going to tell you, I think my wife was in that same food store at the same time and came home with nothing because it's quite prevalent, I'm told, as well. Councillor Fonseca.
Thank you, Mr. Chair. I just really briefly, I apologize, my screen went black completely when in the middle of Catherine speaking. So Catherine, I do appreciate your response. I guess what I was getting at was just in terms of advocating and collaborating with the MPPs around specifically COVID. And I greatly appreciate all the advocacy that was done at AMO and the fact that there was an agreement to have ongoing meetings. Just in terms of advocacy for COVID and in the ever-changing, especially in the last couple of weeks, and as has been noted, that this is a turning point, just the advocacy specifically to the MPPs on how to support the immediate needs of those in Peel region that Dr. Lowe has outlined in the budget, and not sort of waiting to say, well, this is not in our budget when it comes to providing additional staff. Just advocating to ensure that the MPPs are very aware that this is something that we need to see. We see come out of COVID support funds that the province has already announced ongoing in the last couple of weeks and months throughout the pandemic. So whoever is on that call on tomorrow morning, if that could be, I hope that will be part of the discussion with regards to advocating for support funds for those in Peel region around COVID recovery support staff. Thank you.
Thank you. That ends my list. I first need a motion by Councillor Starr and Councillor Fonseca that we receive Dr. Lowe's presentation. All those in favor? Are there any opposed? That is carried. And now I need a recorded vote with regards to response 8.1. Madam Clerk, over to you.
Thank you, Mr. Chair. I've got a motion moved by Mayor Crombie, seconded by Councillor Downey, that the staffing strategy as outlined in the report from the Commissioner of Health Services and Medical Officer of Health titled Peel Public Health COVID-19 Response be approved. And further, that the funding related to the adoption of the staffing strategy using a combination of COVID-19 related and other external funding be approved. And further, that the Region of Peel continue to advocate to the provincial government to ensure that appropriate funding is provided to address long-standing system pressures in public health and any current needs due to COVID-19. And this does require a recorded vote. Mayor Brown. Mayor Brown?
Yes, can you hear me? Yes.
Yes. Oh, Mayor Brown in favor. Thank you. Councillor Carlson.
Yes, in favor.
Councillor Carlson in favor. Mayor Crombie?
Yes, I support.
Mayor Crombie in favor. Councillor Demurla.
Yes.
Councillor Demurla in favor. Councillor Dasco.
Yes, support.
Councillor Dasco in favor. Thank you. Councillor Dillon.
Yes.
Councillor Dillon in favor. Councillor Downey. Councillor Downey. Councillor Fonseca.
Yes, in support.
Councillor Fonseca in favor. Councillor Fortini.
Yes.
Councillor Fortini in favor. Councillor Groves.
Yes, in support.
Councillor Groves in favor. Councillor Innes.
Yes, in favor.
Councillor Innes in favor. Councillor Kovac.
Yes.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Paleshi.
Yes.
Councillor Paleshi in favor. Councillor Parrish.
Yes.
Councillor Paleshi. Councillor Parrish in favor. Councillor Raz.
In favor.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor.
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. Mayor Thompson.
In favor.
Mayor Thompson in favor. Councillor Vicente.
Yes.
Councillor Vicente in favor, and that carries. Thank you.
Thank you. That carries unanimously. Okay, with that, we're going to give the team here a bit of a break as well as yourselves. We're going to recess till 12:40, about 15, 20 minutes, and we will see you all back promptly at 12:40. We stand in recess. Thank you.
You mean 1:40?
Thank you. 1:40. Thank you. Okay, everyone, welcome back. I'm just going to give a moment to let the staff tell me most people have had a quick bite or a bio break or what have you. And while we were having that break, maybe I'll forewarn some of you. A suggestion was made in the interest of time, given that we're getting close to 2 and have a great deal more to deal with on the agenda. The suggestion was made if council would entertain moving to the November 26th meeting, so our next meeting, deferring 13.1, which is the proposed work plan for Region of Peel Advisory Committee that Adrian Smith would have otherwise spoke to, and 15.2, election of regional council section chairs and vice chairs and appointment of members to committee. So it was suggested that that might take away some of our burden this afternoon while we still have plenty. And would the councillors consider doing that? So that would be to defer 13.1 and 15.2 to our next meeting. I would need a mover and a seconder for that.
I'm happy to move that, Councillor Damerla.
Deepika, thank you. And I see Ian Sinclair, I saw acknowledge first that he waved. So I'm going to take that vote now that 13...
Mr. Chair, my apologies. If you wish, we could also defer the staffing update, the Public Works staffing update that's in camera. We certainly want to bring that to you, but it's not time sensitive for today.
So, and you've heard the CAO kindly offer that another matter, item number, if somebody could... 24.7 might be included in the deferral because the CAO says that can wait for 2 weeks as well, the staffing matter and how we're deploying staff now. So again, it would be 13.1, 15.2, and 24.7 to be deferred to 2 weeks hence, as moved by Councillor Damerla and Councillor Sinclair. Any speakers to that motion? Seeing none, all those in favor? Madam Clerk, do you need a recorded vote for that? Are there any opposed? That is carried with thanks to all. Okay, so moving on from there, the next item that I have up is staff presentation 10.1, update on the development service fee review, presentation from Sean Michael Stephen from Watson and Associates. And I remind him as well, we have the full report before us, and I remind him as well, we have about a 10-minute time limit on these as well. So Sean Michael, you're up.
Good afternoon, Chair Unica and members of council. My name is John Hardcastle, and I'm the Interim Director of Development Services. I will be speaking to you today about the Development Services Fees Review we have been undertaking throughout the year of 2020. Last year, council endorsed a temporary site plan review fee and commencement of a study of development-based fees to address a growing revenue gap that we are experiencing. This presentation will provide you with highlights of the great work that we've done this year and recommended fee changes. Next slide, please. One of the key objectives of the review was to establish a framework for fees that is consistent, fair, and transparent. Outside of inflationary cost adjustments, the fee structure and baseline assumptions that inform the region's current development-related fees have remained largely unchanged for more than 10 years. It is a common best practice for municipalities to review fees to address changes in legislation, development processes, application characteristics, and cost recovery levels to ensure that the fee structure accurately reflects current processing efforts. Also important for the review is to include an equitable fee structure that allows cost recovery from those who benefit directly from the service, known as the beneficiary paid principle. This objective is well aligned with the region's long-term financial planning strategy, which establishes that users pay where appropriate, where users should cover the cost of services provided to them. Development-related fees collected are intended to recover the actual costs of reviewing various development-based applications to ensure that regional interests and infrastructure are protected. Planning legislation changes and increased development and redevelopment in urban areas are contributing to this shift. For this reason, and the other objective for the fee review was to establish a fee structure that reflects the emerging mix of application types and development in the region. In recent years, we have received an increasing number of site plan applications while receiving fewer applications for draft plan of subdivision. The current fee structure relies heavily on subdivision-related revenue, and only recently have we made an adjustment to the fee structure with the introduction of interim fees for site plan applications in 2020. It is also noted that complex development applications require the consideration, evaluation, and implementation of new approaches to development review. While these approaches allow the region and local municipalities to be more agile and collaborative in responding to the changing development trends, these are time and resource intensive in comparison to traditional greenfield development. Without a more relevant fee structure that reflects the ongoing shift in development application types and complexity, there will be a growing cost recovery gap that contributes to an increased reliance on the tax base to provide development application processing and review services. Next slide, please. Development services staff were supported by Watson and Associates, Economists Limited in this fee review. Joining me today, Sean Michael Stephen, manager at Watson. He will be detailing the methodology and key findings from the study. I'll hand it over to Sean Michael at this point.
Thank you, John, and good afternoon, everyone. In regards to the overall scope of the development services fee review that was undertaken, the specific broad categories of fees that have been assessed included next slide, please, included the planning application fees, the engineering and site servicing fees, as well as traffic development and permit fees imposed by the region. Next slide, please. And so with regards to the objectives that are summarized here that were largely covered in the introduction, one of the key objectives I want to reiterate is the need to ensure that the ultimate fee recommendations are prepared with regards to the applicable legislation and are defensible in that respect. Next slide, please. Next slide, please. So in terms of that legislative authority for the different types of fees considered, the planning application fees are imposed under Section 69 of the Planning Act. Within that act, what it does identify is that municipalities can impose fees to recover the anticipated cost of processing each type of application. And what's important in that provision is the identification of the anticipated cost of processing. And so with that in mind, the work plan that we've gone through has looked in detail at what is that underlying process that staff would proceed through in processing any of the given applications. As well, the Act also does require that the fees be justified in terms of the cost of each type of application. And that's important as well when we look forward to the fee recommendations, because what municipalities are not able to do is impose a lower than full cost fee for one type of planning application and make up for that shortfall in revenue in higher fees for another type of application. Engineering and site servicing fees, as well as traffic development fees, are imposed under Section 391 of the Municipal Act. And within that piece of legislation, the test for cost recovery is a little bit more broad, looking at the overall level service that is being provided. Next slide, please. So the first step in any fee review should be an assessment of the full cost of service that is being provided, and the approach that we've utilized to undertake that full cost assessment is an activity-based costing methodology. Next slide, please. And so that approach that we utilized is illustrated in the schematic, and I'll briefly explain that because I think it helps define the types of costs that have been included in the ultimate fee recommendations, as well as the process that we proceeded through with staff. And so the first step in the work plan was to look at what are the costing categories or application types that would be included within the fee review. And if you look starting on the right-hand side of the illustration, those are identified within the green boxes in terms of the three broad categories of development-related fees that have been considered, including many individual fees within those categories, such as subdivisions applications within the category of planning applications. Having then established what the categories that will be utilized in the full cost assessment are, the next step was then to go through a detailed assessment with staff to understand and develop what are the detailed steps that would be involved in the processing of each one of the individual application types, who from across the organization, regardless of what department or division they might reside in, would have a direct role in the processing of that application, and how much time would they typically spend on any one given application or process. The next step then, which is fairly key in the overall methodology, is to test the effort estimates that were provided by staff to make sure that they're reasonable and that level of service can be provided on an annual basis, so that the costs that are being considered for the fee recommendations are reflective of the deliverable level of service. And in that regard, we should also note that the costs that are being included within this determination of annual processing activity relates only to that time spent directly on processing applications. It would not include staff time related to other organizational initiatives, time spent preparing for or on defensive applications at LPAT, other special projects, planning policy, for example. That level of staff effort on an annual basis, having been determined to be reasonable, is then used as a driver to allocate not only the direct salary, wage, and benefit costs of those direct participants, but also their share of other departmental direct costs, such as materials and supplies, and as well as a recognition of the budgeted overhead and capital costs within the organization that are required for those individuals to provide their service. And then, further to that point, as identified in the applicable pieces of legislation, it does give the Planning Act and Municipal Act do speak to a full cost definition that would include both direct, indirect, and capital costs of service, which have been included within this review. Next slide, please. So within the three broad categories that have been included under development-related fees, the individual planning or the individual application types are listed in the next two slides. Within planning applications, we looked at the types of applications for which the region currently imposes fees. For example, regional official plan amendments or plan of subdivisions, while also identifying other planning application processes that the region is involved in, which there currently is no cost recovery mechanism, such as zoning bylaw amendments. Next slide, please. Within engineering and site servicing fees, as well as traffic development and permit fees, the individual categories are reflective of the types of fees that are currently imposed in the region. Next slide, please. Moving on to the costing results and fee recommendations. Next slide, please. Firstly, to understand what the full cost of service is, based on the annual utilization of staff directly participating in the processing of applications and permits, the total annual cost is estimated at $5.5 million across the three development-related fee categories. In aggregate, the region is recovering about 82% of those costs, or $4.5 million, resulting in about $1 million being funded from the general levy. And then looking a little bit more discreetly within the three categories of development-related fees, we can see that planning applications are currently recovering about 56% of the annual cost of service, about an $800,000 annual shortfall, and the majority of that shortfall being related to application types for which the region does not currently impose a fee. As we can see, the existing fees are doing a fairly good job of recovering that full cost of service at about 84%. Engineering and site servicing fees currently recovering the full cost of service, while traffic development permits are recovering just under 60% of the full cost of service, which is about $490,000 annually. Next slide, please. And the recommended fees and structures that have been prepared have been done so to align the recovery of the processing cost to the current application characteristics, while also making sure we do have regard for the legislative compliance as identified earlier, as well as the applicant benefits and affordability concerns and municipal revenue certainty. And so firstly, with regards to the planning fee recommendations that have been made for those fees which you currently, or those application types which you currently do have fees for. As you saw on the previous slide, a number of those fees are doing a fairly good job of recovering the full cost of service. And as such, minor fee changes have been made to improve the overall level of cost recovery. However, when we look at site plan fees, those were first introduced in 2020 on an interim basis to start to have some level of cost recovery prior to undertaking this fee review. It was also mentioned at the outset that site plan applications are comprising a greater share of annual application activity, as well as becoming increasingly complex, and as such, a fair amount of time was spent with staff to determine the appropriate fees and structures to be put in place with regards to site plan applications. And so what has been determined is that there will be a tiered approach of utilizing a full scoped and limited site plan fee, reflecting the differences in complexity of those types of applications, with a limited site plan fee or limited site plan application having no associated fee. Next slide, please. In terms of the potential new fee categories, consistent with the approaches used in other regional municipalities within the GTA, it's been recommended that the region would impose fees for consent applications as well as zoning bylaw amendment applications. And then as well, the other category of potential new fees would be a separate fee for secondary plans, which are currently imposed under the category of a local official plan amendment, and that would be done to reflect a greater degree of accuracy in the level of effort that is associated with a secondary plan amendment and the associated costs. Other categories that there have not been fees recommended for, which consume a fairly large share of regional staff time, would be minor variance applications because they do have a benefit to the broader community as well as furthering regional interests. Next slide, please. So the comparison of the current and recommended fees are shown in this table. And as you can see, there are more significant fee increases recommended for site plan applications based on that change from the interim fee than for the other application types. And then as well, you can see the new fees imposed for consent, zoning bylaw amendments, and secondary plans. Next slide, please. As mentioned, there are no changes to the recommendations for engineering and site servicing fees as they are recovering the full cost of service. However, when we look to the recommendations for traffic development and permit fees, they have been, the increases in those fees are on their face seem slightly more significant. And the reason for that is due to the fact that these fees have not been reviewed in over 10 years. As well as the similar to site plan applications, increasing the increasing complexity of these applications and the level of efforts associated with those processes. Next slide, please. So in terms of the impacts on anticipated revenues of the recommended fees, the overall level of cost recovery would increase from 82% to 94%, improving overall anticipated revenue by about $700,000, improving to $5.2 million annually. In terms of planning applications, as expected, there would be an increase in the cost recovery for the existing fees, improving to 94%, improving from 82% or 84%, and 82% overall cost recovery across the planning application types when including the revenue associated with the new fee categories as well. Traffic development fees would, the cost recovery increase by about $200,000, improving from 50% cost recovery to 100% in that regard. And while the recommendations that have been made towards moving to full cost recovery, thereby reducing the burden on the tax base, what's important to note is that determining the extent to which the fees recover the full cost of service, as well as the implementation of those fees, is at the discretion of the municipality through your development of your individual or your specific fee policies and principles. And this will be addressed further in the presentation when discussing the proposed implementation strategy. Next slide, please. And before discussing that implementation strategy, what we have done, which we feel is fairly important in this process, next slide please, is to look at what the proposed fee increases would mean in terms of the impacts on applicant affordability with regards to the current fees as well as the proposed fees, not only for the area municipalities in the region, but as well as for, or in comparison to the fees imposed in other GTA municipalities. And so this is fairly key because what we feel that does is it puts the development related fees that are being recommended into their proper context in terms of the impacts relative to the total cost of municipal development fees to the end applicant, and doing so looking not only at the planning or engineering fees, but as well including the cost of building permit fees, other engineering fees, and development charges as well, and those that would be imposed not only at the regional level, but at the area municipal level as well. And we've done that to look at those impacts for both residential and non-residential development types, as well as for differing densities and sizes of developments to understand those impacts on a cross-section of potential applicants. Next slide, please. And so the development services fees that have been assessed through this undertaking represent a fairly small portion of the total municipal development fees that would be payable. As you can see on the slide, ranging between 2 to 16% of that total cost of municipal development fees, depending on the size and density of the developments, with smaller developments having less economies of scale, and therefore the development-related fees for the region comprising a greater share of that total applicant cost. The fee recommendations then, while representing a small share of the total development fees, that the impacts of those are to increase the total municipal development cost to the applicant by between 0.1 to 0.3% for low and high density residential development, between 0.3 to 0.4% for medium density developments, and 0.4 to 2.5% for non-residential developments, again, depending on the size of those developments. And so, while in the previous slide, some of the fee impacts may have seemed more significant on their initial face, when we look at those in terms of the overall impacts on the cost of development to the applicant, the impacts of those recommendations are fairly nominal. Next slide, please. So the next two slides, which are included for two of the sample development types, have been looked at and are included in detail in the report as well. Just illustrate those impacts, showing firstly for a 100 unit single attached subdivision development, that the relative position of the three area municipalities would not change with the proposed changes in the planning application fees, and only resulting in a 0.1% increase in that overall cost of development. And next slide, please. Similarly, for a industrial development, looking at the application fees that would be imposed in that regard, again, a 0.4% increase in the overall cost of development, not materially changing the position of any of the Region of Peel area municipalities, with that competitive position remaining the same under the proposed and recommended fee structures. Next slide, please. And with that, I'll hand that back to John Hardcastle, who will be discussing the proposed implementation strategy for the fee recommendations for the region.
Thank you, Sean Michael. Could I have the next slide, please? As part of developing the implementation strategy for the proposed fee changes, staff considered a balance between the region's financial objectives regarding user fees that seek to reduce reliance on the property tax base and recover service costs from users, alongside the economic and social context we are seeing today. Primarily, the emergence of the COVID-19 pandemic has had subsequent impacts on both the public and private sectors. For this reason, it is imperative that we the implementation of these recommendations be flexible, gradual, and responsive so as not to further impede regional growth and development activity while also protecting the interests of regional taxpayers. Throughout the fees review, efforts were made to include stakeholders at key points in the process. In May, stakeholder consultations were held, including all 3 local municipalities as well as the Peel chapter of BUILD. The objectives of these consultations were to present the project's initial findings, gather input on the calculated costs, and receive feedback on the implementation strategies. Comments shared by stakeholders, particularly BUILD, suggested that the region revisit any planned immediate implementation of fee increases in 2020, given the economic uncertainty surrounding the COVID-19 pandemic. Multiple consultations were held with BUILD throughout the review process, and supplementary materials were provided to address early feedback and follow-up discussions to talk about the logistics around the implementation timing of proposed fee increases. The implementation strategy has evolved throughout the year, and we believe it responds to the changing economic context and feedback received during consultations. Not implementing the proposed fee increases immediately will assist the development community during COVID-19 recovery while simultaneously balancing and protecting regional interests, such as reducing the burden on the property taxpayers who are currently bearing the cost of under recovery through our fees. Next slide, please. The proposed phased implementation strategy is detailed in the report and is presented as an overview here. All recommended fee decreases are proposed to be implemented immediately as part of the 2021 annual budget process to comply with issues with respect to the Planning Act. This includes reductions to and the recategorization of local official plan amendment fees. Effective July 1st, 2021, 50% of all applicable fee increases should take effect and be subject to 2021 user fee bylaw and budget processes. As part of the 2022 budgeting process, it is proposed that the full extent of the recommended fee increases be implemented. Delaying the first stage of fee increases until July 2021 and delaying the full implementation of fee increases to 2022 helps manage the impacts to the development community and provides sufficient time for transition to the new fee structure while allowing the region to reduce its reliance on the property tax base contributions to the cost of development. As discussed, it is industry best practice to conduct fee reviews at regular intervals. It is therefore proposed that the next comprehensive review of fees be presented to Council in 2023. During this time, staff will continue to monitor the new fee structure and whether any cost efficiencies are realized through ongoing improvement initiatives, including technological upgrades that allow for electronic review of plans and enhanced data tracking and workflow processes, as well as the continuation of the streamlining of development approvals program, which aims to improve customer service, knowledge, and collaboration with partners and stakeholders. Next slide, please. This slide details the breakdown of fee category amounts at each interval of the proposed phased implementation strategy, as is also detailed in Appendix 9 of the Council report. The transition plan provides for a smooth and predictable transition that, in terms of the modest increases being proposed, will not prove to be a barrier to development and Peel. Next slide, please. This is a similar slide detailing the traffic development fee amounts at each interval of the proposed phased implementation strategy, and this is contained within Appendix 9 of the Council report. Next slide, please. In summary, our current fee structure results in $1 million of the cost of the review of development-related applications being borne annually by our taxpayers. This shortfall in cost recovery will continue to grow unless the recommendations of the fee review are implemented. The proposed fee changes would allow for more equity in how we recover costs by increasing fees to appropriately recover costs from the primary users of the service. The proposed implementation strategy will improve our cost recovery for development-based services from 82% currently to 94% when fully implemented, and reduce the reliance on the property tax base by approximately $640,000 annually from 2022 onward. The results of the comprehensive review also suggest we can do better to align our fee structure with current processing efforts and reflect the shifting application types and complexity we are receiving as development trends continue to evolve in Peel. In the proposed implementation strategy shared today, achieving appropriate cost recovery through user fees for the region's tax base has been balanced with a consideration of economic and social impacts due to the COVID-19 pandemic. The proposed strategy delays and phases the implementation of the fee increases over 2 years in order to mitigate any further impacts to development activity in Peel. Last slide, please. Thank you. And Sean Michael and myself are available for any questions that you may have.
Thank you. And we have a couple of questions, but I want to double back and apologize to John because I introduced Sean Michael, but forgot to introduce John Hardcastle, our Interim Director of Development Services. So, John, with my apologies, well done to you and Sean Michael. My list of questioners, Councillor Sinclair and Mayor Thompson. Councillor Sinclair.
Yes, thank you. I noticed on the list of fees, permits to take water are charged. And issue.
Councillor Sinclair, you're breaking up a bit if you can hear me. Councillor Sinclair, you're breaking up a bit if you can hear me. Why don't you try again? You look better now. Go ahead.
I'll stop the video. Does that help?
That does. Please proceed. Thank you.
No?
Yes, it does help. Please proceed without the video. Thank you. Go ahead, John.
I don't know. Can I be heard?
Yes, you can. I can hear you, and you sound better without the video. That is helping. So, Ian, please proceed.
All right. Yes, on the permits to take water, there's a proposal for no charge on a review. And permits to take water are over 50,000 liters a day, and that's very important in North Peel, where we're all on groundwater sources. And I noticed there's a proposal under the Ontario Water Resources Act current under the ER to require municipal support for newer and increased bottled water takings. There's already one large well for bottled water at Cataract. In addition, there's a proposal in the air for a dry working floor quarry immediately abutting Cataract, which may end up interrupting all the wells in the hamlet of Cataract. And then there's a whole issue of water taking for wash plants to clean gravel. So I'm surprised that there's no charge. It's going to be a very important issue over the years, and full involvement by the region in water takings, I think, would increase the understanding of Peel and groundwater budgets in North Peel. Could I get a...
Yeah, Ian, Ian, that last little... Okay, we'll try and see if there was enough there to answer the question, then we'll double back if Ian has more. Through to Sean and the staff, go ahead.
Thank you, Mr. Chairman. Through you to Councillor Sinclair. At this stage, the vast preponderance of the permits to take water that we review come in through and associated with other development applications. And those applications that are standalone tend to require modest amounts of regional efforts, not resulting in a significant amount of staff time and effort. In addition, there is a policy interest that supports our involvement in these applications that raises a question of supporting them through property tax to some degree. In addition, the administrative components that with adding fees onto these applications would in fact increase the staff efforts to a significant degree. So that was excluded as a new fee category at this point in time. But it is one that we're continuing to monitor for 2023.
Okay, supplementary question, Mr. Chairman, would be, what about permit to take water renewals, where there's a requirement to renew the permit to take water, redo the assessments, and assess whether there's any further impacts on groundwater levels and reserves in an area? Thank you.
Thank you, Councillor Sinclair. The data that we have does not distinguish between the renewals and the new categorization. So the response would be the same across the two different distinctions.
Okay.
Okay.
Thank you. Thank you. Mayor Thompson.
Thank you. Through you, Mr. Chair, to John and Sean. Excellent report. I like the format that you're taking, and I can support that. The one question I have is, we got to put our money where our mouth is. So question I have is for affordable and social housing. We're asked by the province that, take this on, start to build this in. What have we done to accommodate, to throw a bone out there to encourage the industry to buy in? Is there any way we can dovetail any of that in if it's for a social housing project or affordable housing project going forward?
Thank you. Through the chair to Mayor Thompson. This fee review has looked specifically at aligning up our costs, understanding our costs, and at this stage has not looked at opportunities to provide a beneficial impact to a specific service delivery area like affordable housing.
Well, it's just like I'm using, and I understand that with costs, and I'm just wondering, because I know we've, different times for Council for Habitat for Humanity and different things like that, we come forward. I was just wondering, while we're at that, I totally understand where you were, but I'm just wondering, is this a possibility that we could look at as, here's an opportunity to capitalize on that? I'm just asking that question. Reading through the report, that's something that triggered with me in the last day or so.
So Mayor Thompson, you may recall that in September, Councillor Groves had asked us to consider community-based use fee reductions related to the new
the bocce court, right?
Thank you. Yes, and we will be looking at that type of accommodation coming forward for our 2023 review.
Okay. No, I just wanted to see if we could do that coming through here, and I just thought I needed to ask the question because that's what's asked of all of us, is to find ways how we adopt to this. So thanks for answering my question.
Thank you. Councillor Fonseca.
Thank you, through Mr. Chair. Thank you very much for the presentation. Just two quick questions. One, with regards to existing fees and the local area municipal official plan amendment fees. So current fee is $12,000, the proposed fee $9,000. One, could you just put a little bit more clarification around the proposed decrease in this amount? And is this under review to bring back for 2023? And then the second question, and it might be in terms of how you also addressed Councillor Sinclair, under potential new fees, the environmental compliance approvals it's proposed that there be no charge. Will this be monitored to look at for 2023 as well? And why was it proposed as no charge?
Through you, Mr. Chairman, to Councillor Fonseca, the local official plan amendment fees, when we did our detailed estimates, staff allocation times, we were able to determine that we were overcharging for that, and as a result, have been able to reduce the fee from 12,000 to 9,000. The actual costs associated when we did the very detailed review that Sean, Michael, and the Watson team brought to us was able to determine that we did not need to charge that higher rate. So we were able to reduce it. And part of that was we created a subcategorization that allowed us to not charge the same rates across based upon our differences in staff time and effort based upon the different subcategories. So all of our fees will be looked at for each subsequent fee review. So we will go through a similar exercise to what we've gone through this year. And so local official plan amendment fees, as well as ECA, permit to take water, et cetera, we will look at each subsequent review, undertaking a similar exercise to what we've undertaken this year to make sure that our costing and our estimates remain lined up.
Thank you.
Okay, thank you, and thank you for that presentation. I now would ask Councillor Sinclair and Mayor Thompson to move receipt of the presentation. Are there any objectors to that? That is carried, and now I'm asking Councillor Sinclair and Thompson to move the recommendation and move it over to the clerk for a recorded vote.
Thank you, Mr. Chair. I've got a motion moved by Mayor Thompson, seconded by Councillor Sinclair, that the fees review findings as outlined in the report of the Interim Commissioner of Public Works, titled Update on the Development Services Fee Review, be endorsed, and further that the proposed phased implementation strategy as outlined in Appendix 9 of the subject report be endorsed for consideration as part of the 2021 and 2022 annual budgeting processes. And further that a copy of the subject report be provided to the local municipalities and the Building Industry and Land Development Association for information.
I see Councillor Sinclair's come back on the screen. Councillor Sinclair, did you want to speak to that motion?
Oh, thank you.
Okay, thank you. Carry on with the vote then.
Thank you, Mr. Chair. And this requires a recorded vote. Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie.
Yes.
Mayor Crombie in favor. Councillor Demurla.
Yes.
Councillor Demurla in favor. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon.
Yes.
Councillor Dillon in favor. Councillor Downey.
Favor.
Councillor Downey in favor. Councillor Fonseca.
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini.
Yes.
Councillor Fortini in favor. Councillor Groves.
Yes, in favor.
Councillor Groves in favor. Councillor Innes. Councillor Innes.
Yes, in favor.
Councillor Innes in favor. Councillor Kovac.
In favor.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Palashi.
Yes.
Councillor Palashi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor.
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. Mayor Thompson.
In favor?
Mayor Thompson in favor. Councillor Vicente.
Yes.
Councillor Vicente in favor, and that carries. Thank you.
Thank you. Thank you all. That brings us down to item 14.1, communications, as asked for by Councillor Paris to hold the email dated October 21, a copy of the letter to the Minister of Transportation regarding the GTA West Corridor Transportation Urban Boulevard concept versus traditional highway within Heritage Heights. Councillor Parish.
Yes, thank you, Mr. Chair. I just was wondering on page 5 of this letter, it says that we have put away, the region has put away 93 million, or I'm sorry, a total of 93 million between Peel and Brampton, 69 million for Peel and 24 million for Brampton. I recall having a discussion about this 2 weeks ago, or 2 weeks ago, and I don't think we've ever approved it, have we?
Through to staff.
Through you, Mr. Chair, and to the councillor, Adrian here. So there's nothing that's been approved in terms of a project or what have you, but through the development charges bylaw, the region has been collecting some funds notionally associated with the north-south corridor, and that goes back to the time when ROPA 15, when the Northwest Brampton lands were brought into the regional boundary, and at that time, the GTA West process hadn't quite initiated, so the region prudently started collecting some money with the knowledge that some transportation infrastructure, significant infrastructure, would be required. So we're collecting that, but there's no specific project or anything that's been approved by council associated with that.
Thank you. Don't interpret that I'm against it. I was just curious. Usually when we start funds like that, there's a specific purpose for them, and I remember the conversation 2 weeks ago, but I don't remember what we decided. I didn't think we had. Thank you. Good answer. Thank you.
Thank you. With that, all I require is receipt as moved by Councillor Parish, seconded by Councillor Raz. All those in favor, do I have any opposed? That is carried. Thank you. That brings me down to items related to Public Works. 17.2, report of the Waste Management Strategic Advisory Committee as held by Councillor Sato. Councillor Sato.
Thank you, Mr. Chair. I just had a question of staff as to how we are communicating the issue of the producer responsibility. And the reason I'm asking it is that I saw a few people were tweeting a Mississauga News article, and the headline was that Peel residents or Mississauga residents can now recycle all plastic products. And the article went on to say that, and this is because of the producer responsibility program, that we were now accepting paper plates, plastic containers, coffee cups, and all of the things that we're actually not accepting yet. So I was rather concerned because it was giving a message to residents that this has already started. And I haven't actually seen anything from the region, any communication out to citizens with this regard. So I wonder if Andrew or someone could respond to that.
Hi, Councillor Sato. Thanks for your question. I was hoping Norm could join us because he knows a little bit more about this than I do. I'll have to be honest, I might have to take that offline and get back to you directly with a better answer. But yeah, because we haven't been doing much communication so far on extended producer responsibility. But I can get you a better answer on what the plans will be over the next weeks and months as it rolls out, and as we change what we collect.
Well, I guess I'm not really concerned about what we're going to communicate weeks from now. Mississauga News is communicating, and they're communicating inaccurate information. So I think that staff need to jump on that and get well, first of all, probably ask the Mississauga News to correct it. And I'm surprised that no one from staff saw it. I would think that our staff would monitor media. And I was a little bit shocked when I saw it, and that was the headline, was that Peel residents can now recycle everything made of plastic. Not the exact wording, but that was basically the headline. And of course, people were saying, oh, that's great, and they're retweeting it, so it really gets out there. So I think we need to get a message out there quickly to the public that it has not started yet. And otherwise we're gonna get all kinds of contamination in the recycling again.
Okay, and I appreciate that, bringing that to my attention. I'll be honest, the reason we haven't started communicating is because the regulation's actually not finalized yet.
Oh, no, I know that. No, I realize that. But I'm just saying that I think we need to react to the wrong information that's being put out there.
Okay, I think that's good. I'll take that as a good advice. Thank you very much.
Thank you. Thank you, Mr. Chair. That was my only question.
Thank you, Pat. I think that is direction above and beyond requiring a recorded vote on the matter itself to be now received. So, Councillor Sado, if you'll move that as seconded by Councillor Innes. Madam Clerk, over to you. Thank you.
Thank you, Mr. Chair. Get a motion that the report of the Waste Management Strategic Advisory Committee meeting held on October the 29th, 2020 be adopted. And this requires recorded vote. Mayor Brown? Mayor Brown?
Yes, can you hear me? Yes.
Yes. Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
In support.
Mayor Crombie in favor. Councillor Demerla?
Yes.
Councillor Demerla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini?
Yes, in favor.
Councillor Fortini in favor. Councillor Groves? Councillor Groves? Councillor Innes? Councillor Innes?
Yes, in favor.
Councillor Innes in favor. Councillor Kovac?
It's Councillor Groves. I'm in favor.
Thank you, Councillor Groves. I have it. Thank you. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz? Councillor Raz? Councillor Sado? Oh,
Yes.
is she? Councillor Raz in favor. Thank you. Councillor Sado?
Yes.
Councillor Sado in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor.
Mayor Thompson in favor. And Councillor Vicente?
Yes.
Councillor Vicente in favor, and that carries. Thank you.
Thank you. Brings us down to 21. Other business councillor inquiries. First up, Councillor Raz, changes to the Conservation Act. Councillor Raz.
Thank you very much, Mr. Chair. And I have sent a motion. I know that this would be a walk-on, but it's really time sensitive. Buried in last week's budget bill was changes to the Conservation Authorities Act and also the Planning Act. And a lot of these changes, some of them are good, but there are many that are problematic. And certainly the way that conservation authorities operate are very concerning. And I'll just take you through a couple. The proposed changes would authorize the Minister of Natural Resources to issue an order to take over and decide development permit application in place of a conservation authority. That's just one example. Proposed changes would remove the unproclaimed provision for conservation authorities to issue stop work orders. And that was a new tool that we were looking forward to in our enforcement box or our enforcement toolbox. For example, if people fill in wetlands, that's a problem. We're trying to manage climate change and major changes to conservation lands that we own, and also work with landowners on these projects. And some of these changes are just very, very detrimental. There's also some concerns about how governance is going to operate. And the requirement would be for board members to represent their municipality's interests rather than the interest of the Conservation Authority, which from a board governance standpoint is not good governance and actually goes against recommendations by Ontario's Auditor General. So that's just an example. I think that many people here at our council table have shown a lot of support for both CBC and the TRCA over the last few years in terms of how we operate. We know that CBC has been accountable to Peel Council and all the councils in their watershed. And I'm looking for some support to reiterate that to the province. We have a very limited time. We expect these changes to probably pass within the next couple of weeks, and I'm wondering if maybe staff can put up the. I don't know if they can put up. Can you put up the motion, or would you like me to read it?
No, why don't we have them put it up?
Okay.
Mr. Chair, can I have it read out, please?
Oh, okay. I was going to say, happy to have it read out. And we have other speakers, and I thought while it was on the screen, people could read it while other speakers speak. But go ahead, Councillor Raz, read it out.
Okay, I will do the truncated version. So the motion is related to the Conservation Authorities Act review. And whereas the province has introduced Bill 229 to protect, support, and recover from COVID-19 Act Schedule 6, Conservation Authorities Act, whereas the legislation introduces a number of changes and new sections that could remove and or significantly hinder the Conservation Authority's role in regulating development, permit appeal process, and engaging in review of appeal of planning applications. Whereas we rely on the watershed expertise provided by local conservation authorities to protect residents, property, and local natural resources on a watershed basis by regulating development and engaging in reviews of applications under the Planning Act. Whereas the changes allow the minister to make decisions without CA watershed data and expertise. Whereas the legislation suggests that the minister will have the ability to establish standards and requirements for non-mandatory programs, which are negotiated between conservation authorities and municipalities to meet local watershed needs. Whereas municipalities require a longer transition time to put place in agreements with conservation authorities for non-mandatory programs. Whereas municipalities believe that the appointment of municipal representatives on CA boards should be a municipal decision, and the chair and vice chair of the CA board should be duly elected. Whereas the changes to the duty of members contradicts the fiduciary duty of CA board members to represent the best interests of the Conservation Authority and its responsibility to the watershed. Whereas, sorry, this is a long motion, I'm getting there. Whereas conservation authorities have already been working with the province, development sector, and municipalities to streamline and speed up permitting processes. Whereas changes to the legislation will create more red tape, not less. Whereas municipalities value and rely on the natural habitats and water resources within our jurisdiction for the health and well-being of residents, municipalities value the Conservation Authority's work to prevent and manage the impacts of flooding and other natural hazards, and municipalities value the Conservation Authority's work to ensure safe drinking water. Therefore, be it resolved that the Province of Ontario work with conservation authorities to address their concerns by repealing and or amending changes to the Conservation Authorities Act and the Planning Act, that the Province of Ontario delay enactment of clauses affecting municipal concerns, that the Province of Ontario provided longer transition period up to December 2022 for non-mandatory programs to enable coordination of CA municipal budgeting process, and that the province respect the Conservation Authority municipal relationships, and that the province embrace their long-standing partnership with the conservation authorities and provide them with the tools and financial resources they need to effectively implement their watershed management role. So with that, Mr. Chair, I will. I know that Councillor Innes would also like to speak to it as well.
And she's next up, Councillor Innes.
Thank you, and thank you for allowing us to bring this on. It is rather timely because we know that this has been brought in under the budget bill, and we all know how important that is for our provincial government to push that through as fast as possible. So, Karen did a great job in summarizing. The three key issues with this are the permitting, the planning, and the enforcement. And in regard to the planning. One of the issues that the TRCA has is we're not allowed to go to the LPAT independently. We're the largest single landowner in the entire GTA. So when somebody is going to be doing something, some sort of development application next to us, we don't have a right independently under these new changes. So these are just some of the things under the planning that is a problem. Also, when we have upper tier and lower tier governments that are in disagreement with one another, and we have service level agreements with both, we're supposed to be an independent body that is providing technical advice. And the way that these changes have been drafted causes an issue for the TRCA, and in particular all conservation authorities, on how they would act in those situations. Permitting, another huge issue. If a conservation authority says no to an application, the minister has the right to overturn that. And so we have concerns with that. And from a Caledon perspective, in particular, the enforcement is of great concern. Just as an example, in Caledon this year alone, we have 400 cases before the court to deal with illegal trucking depots. Almost all of those illegal trucking depots have brought in illegal fill so that they could park the truck. That means they're filling in wetlands. That means that they're destroying natural heritage. And as a conservation authority, we have no right to go in to do the stop work and then to actually repair the damage that's been done and put it on that person's taxes like our municipal partners do. So this is a huge concern. It's a huge concern for protecting the environment, but it's also a big concern for protecting people and property. As an example, if somebody decides to build a tree fort for their kids in their backyard, which is on the edge of a ravine, and it's dangerous because that ravine is eroding and falling in, we can't stop them. We have no right to go in and stop them. So there's grave concerns to property and to people, but predominantly to our environment. So I'd ask all of you to support this today. To be clear, that this should come back to our individual councils as well in Brampton, Caledon, and Mississauga, because the government, we are really asking that they rescind these portions or that they make amendments that are suitable. And given the timing that they are pushing forward for the budget bill, I'm hoping that they will rescind this section and continue to have further conversations with us on these important matters. The governance, as mentioned by Councillor Raz, is of importance, but all in all, I think that they see the error in their ways of some of those governance. For example, they have told TRCA that all representatives must be elected. Well, I don't think that it's appropriate that we have a majority of Toronto councillors sitting on our board, and neither would Toronto. So I think that there's been an oversight in some of those governance pieces, which is unfortunate, because I think if we had better communication with the conservation authorities, that wouldn't have happened. Even though we've been advocating and meeting, and I know I've seen Councillor Raz and CBC staff at many of the consultations. Obviously, it's still not getting through, so we will do our part, but we're asking for the support of our municipal partners to make sure that that advocacy is even stronger and louder. And thank you, Councillor Raz, for putting it on the agenda.
Thank you. Mayor Thompson. Need you to unmute, Alan.
Yeah.
Thank you.
I support all of them, but I think the enforcement is the one that I was a little bit concerned when I read the motion. The one is the enforcement under the Canada Charter that we have under Ontario. You don't have the ability, nor we have the ability, only the municipalities have the ability to enforce the illegal dumping. And we have lost a lot of wetlands. One real significant one right off Mayfield Road, dumped in on TRCA lands. We could have gone in there and put it on the property taxes and cleaned it up. Now it's gone. And it was a really integral part. And this stuff is just going to constantly go on. And it's a big loss to both conservation and everything. That's how partnerships between municipalities and conservation authorities have. We're the only ones that have got the stick to do it under the act or under the law of the province, unless they do a lot of changes, which I know they're not going to do. So I'm willing to support it, but I would really like to have that discussion on the enforcement and allow the municipalities to do the enforcement for the conservation areas. Especially, they take a high priority when it's a significant wetland under a conservation zone is a kind of conservation area, but we do the enforcement to clean it up, because those wetlands can't wait years before you come back in to clean it up. It's gone. So I think this is something that I think is extremely important. That I understand where you're wanting to go, Karen and Jennifer, but I also see as a mayor, that's a real challenge that we've got as municipalities watching our wetlands get damaged or our floodplain. That should not happen. And they know they can get away with it. They know nothing's going to happen. So I encourage to have that discussion. That's what I'm just asking for. Thanks.
Thank you, Alan. That's all my speakers. Well done to the two chairs of conservation. As you well know, it's 2 decades or more we've been trying to get this, and it's long overdue. With that, the clerk tells me I need 2 votes. The first for 2/3 to reopen and deal with it on the agenda. Oh, there's one. Oh, okay, you're not. Councillor Parrish, you're on my list now. Go ahead.
Yes, I wanted to congratulate the 2 ladies for that motion. My parents lived on Healy Road. And living in the house, it was set back quite a ways. People would just drive up to the end of the driveway and dump a dump truck load of dirt on the end of their driveway and drive off. So I can only imagine how bad it is. And I can remember my dad having a pond excavated, and he went around and found out people who needed dirt, and they arranged it as gentlemen do. But the loss of wetlands is it's a sad, sad situation, because then you lose all the animals and everything else that's in that area. So I'm glad you are watching it closely. Those pieces of legislation sometimes slide through and nobody pays attention. And thanks, Karen, for doing that. And thank you very much, Jennifer.
Thank you, Councillor Demerla.
Thank you, Chair. And I also just want to say this is a good idea, and I'm happy to support it, and happy to work with Karen or whoever else to bring forward a similar motion in Mississauga. I think we need to do it at both levels. So this is good. Thank you.
Thank you. So over to the clerk. I need the first motion to deal with the matter at 2/3 and then the vote itself. Madam Clerk.
Thank you. So the first motion is to waive the rules in order to permit consideration of the motion without notice. Mayor Brown? Mayor Brown?
Yes.
Thank you. In favor? Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes, I support.
Mayor Crombie in favor. Thank you. Councillor Demerla?
Yes.
Councillor Demerla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yep.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves? Councillor Groves? Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes, in
Coun-
favor. Good work,
Councillor
girls.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor?
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
Favor? In favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor, and that carries. And we'll move on to the main motion, as moved by Councillor Raz, seconded by Councillor Innes, and as read by Councillor Raz. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson? Councillor Carlson in favor. Mayor Crombie?
Yes, I support.
Mayor Crombie in favor. Councillor Demerla? Councillor Demerla? Councillor Dasco?
Yes.
I think that was Councillor Demerla. Thank you.
Yes.
Councillor Demerla in favor. Councillor Dasco?
Yes, just so you didn't think my voice got very high all of a sudden.
Thank you. Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini?
Yes, please.
Councillor Fortini in favor. Councillor Groves? Councillor Groves? Councillor Innes?
Yes, in favor.
Councillor Innes in favor. Councillor Kovac?
Yes.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes, of course. Thank you.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish? Councillor Parrish in favor. Councillor Raz? Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos? Councillor Santos?
Yes, yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor.
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor, and that carries. Thank you.
Very good and well done. That was Councillor Raz's other business. One more shout out for other business or inquiries. Seeing none, that brings us to notices of motion. I have three before me. First, 22-1. Motion regarding the development of a comprehensive advocacy strategy for the implementation of the Ontario Seniors Dental Care Services Program as requested by Councillor Groves. Councillor Groves. Councillor Groves, can you hear me? What I'm going to do is I will double back for Councillor Groves in 22.1 in a moment. Why don't we go to 22.2, my next notice of motion. Motion regarding advocacy for property tax exemptions under Bill 57 as requested by Councillor Dasco. Councillor Dasco.
Thank you, through the chair. I just wanted to say, this was an item that that staff asked if I wanted to get taken off the agenda, but I'd like for it to go on, maybe with just a little bit of an amendment to it. The rationale for this is fairly recently the provincial government put through legislation that essentially it exempted the legions from paying property taxes, and that would be for from the city level, regional level, and also from the school boards. And for some reason, the Army, Navy, Air Force clubs, which have been around for a very long time, were not included. And I think it was really just an oversight, and it's something that it's more of a housekeeping item than anything else. And so I spoke with Councillor Raz, who was happy to second this, and I've got to say, staff did a very good job, both at the city and at the region, in terms of trying to untangle this whole thing, because it does get a little bit complex in terms of how this all gets done, because on the face of it, you would think that the Army, Navy, Air Force clubs, of which there's about 20 right across the province, as opposed to the over 400 legions that we have. Not as well known, but just great organizations. And I think it was more of an oversight than anything. So in their most recent budget on page 236, it has that they would be exempt from property tax, just to, I guess, make amends there. So if I could, what I would just like to do is have this go forward, but acknowledge that it was in the 2020 budget, and also that that upon the passage of the budget, that this be implemented as soon as possible, because as we can all imagine, with COVID, they're all on the ropes right now. And so if we're able to do that, that would be great.
Thank you, Councillor Dasco. It is before me as moved by yourself and Councillor Raz. I have speakers. Mayor Thompson.
No, Tasco got it. That's where I was just saying, I saw it. It was in the budget book where a correction was made for that. So I understand where you're going once you explained that, because I was going to speak to it as was. So that's fine. Thank you.
Thank you. Councillor Demerla.
Thank you. And this is a long-standing issue, and I'm glad it's been corrected. But I'm just curious, once the province passes that, do we at the city, doesn't it become sort of automatic? Like, do we need to do this?
I don't know who can, but we need the province to do it, and then I guess it falls in line. But through to the corporate commissioner.
I believe our CFO, Stephen Offwigan, may have a comment about that.
Stephen, you're up.
Yes. Sorry, I'm on the line, just trying to find the buttons here. That is correct. Once the legislation or the provincial budget passes, then it will be the process will be similar to what happened with the Royal Canadian Legions, and they will become exempt. They're already exempt at the municipal property tax, so this really pertains to the educational taxes.
So we need the motion?
I think the councillor is suggesting that the motion is one that would be adjusted to continue to move it forward, but to ask the province to move forward quickly, and that obviously is subject to the passage of the provincial budget.
Okay.
But
I'm happy to support it. I just thought maybe we don't need to.
Very good. Those are all my speakers. As moved by Councillor Dasco, seconded by Councillor Raz. Madam Clerk, over to you.
I will take the motion as it is in front of council with the amendments as stated by Councillor Dasco. And this does require a recorded vote. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demerla?
Yes.
Councillor Demerla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yep.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini?
Yes, in favor.
Councillor Fortini in favor. Thank you. Councillor Groves? Councillor Groves? Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
Yes, in favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
In favor, thank you.
Councillor McFadden in favor. Thank you. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Palashi?
Favor?
Councillor Palashi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos? Councillor Santos? Councillor Sinclair?
In favor?
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
In favor.
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor
Yes.
Vicente in favor, and that carries. Thank you.
Oh, it's Councillor Santos. I'm a yes.
Thank you. Councillor Santos, a yes as well. Understood.
carries.
And that carries.
It's Councillor
Oh.
Groves. I'm a yes. Can you hear me?
Now I can, Councillor Groves, yes.
Okay, and that makes it
Thank you.
unanimous. Then.
Okay,
Thank
Councillor
you.
Groves, before, that carries, Madam Clerk?
Yes, it's
Councillor
unanimous.
Groves, before I lose you, I'm coming back to you as promised. 22.1 was your notice of motion regarding the development of a comprehensive advocacy strategy for the implementation of Ontario Seniors Dental Care. Would you like to speak to your motion 22.1?
Yes, thank you, Mr. Chair. Can you hear me?
Yes, I can. Please proceed.
Okay. Thank you. I think I raised this question a couple of months ago regarding the threshold for seniors being able to access dental care. The problem with it is because the threshold is I think it's just around 19,000 or just over 19,000, 19,700 and change for seniors to be able to qualify to access dental care. Very, very difficult difficult for most of these seniors because that's really below the poverty line, and they're not able. Majority of seniors are not able to qualify for the dental care with the program that we have. Some seniors might be like $75 over, $100 over that threshold. So I know that this is a provincial matter, and this is something that the province has to visit. And this is why I brought the motion, because as we know, dental care is very important. Good oral hygiene is extremely important, because without that, it can lead to a lot of other illnesses. And with these seniors, if they're not able to get proper dental care because they're not able to afford it, then it could lead to other things such as malnutrition, which leads to other health issues, and it becomes a very, very expensive on the taxpayers. So anyway, this is why I brought the motion forward. I know that our staff, they have been in touch with the province, and I know they speak to them on a regular basis, and this has come up before. So anyway, this is why I brought the motion, and hopefully we'll be able to get it changed at the province.
Thank you. I have a list. Councillor Parrish, who, let the record show, as I remind everyone, was the matriarch of the policy, way ahead of all of us quite some time ago. Councillor Parrish. Carolyn, I need you to unmute, please.
It makes me feel weird to be the matriarch of anything. I'm absolutely in support of all the parts of the motion, but I really like the second dot, allow for the provision of services by private dental providers and sessional time unit reimbursement upon option to pay for these services. That's what we started with, and we had a good system going. It was very efficient, and we had a lot of dentists participating, and I think they did it out of concern for the seniors, but they also managed to, young dentists especially, managed to collect lots of family of these seniors patients. So I understood when it first started that they wanted to get it rolling in a uniform fashion across the province. I'd like us to take another shot at showing them the system we used and see if we can get the province to make an exception and let us do it, and eventually let everybody do it. It's far more less paperwork. It's far more efficient. We were doing a really good job in Peel, and I am glad we started it. And I'd like to see us be able to educate the province a little bit and say, okay, you've rolled it out. Now, how about you take a look at this? So I support everything on here that Annette has done, and but I particularly am pleased with that one provision. Thank you.
Thank you. Councillor Sato.
Thank you, Mr. Chair, and thank you, Annette, for bringing this forward. You're right, it is, dental care is vitally important because poor dental leads to particularly heart issues. And we already know how busy our hospitals are right now. We don't need any other concerns. One of the things I've found over the years working with the province is that you get further if, instead of just going with a motion that says, we want you to change the system, is to give them, as Councillor Parrish alluded to just a few minutes ago, a very concrete way for them to change the system, so they don't have to think. And yeah, sometimes if they have to think about a way of doing things, as we've found with past governments over the last 20, 30 years, nothing gets done. So I would suggest that when something is sent to the province, that there be a proposal, very strong proposal, including some of the things that Councillor Parrish mentioned. One of the things that I've been preaching for years, and I still don't have it in, but I think we will at the city very soon, is support for seniors on a sliding scale. And as Councillor Groves mentioned, you know, if someone's $75 over the pension amount, they still are in a very low income category, but they don't qualify. And I've always felt that was extremely unfair. And our staff at the city are looking for our tax rebates for seniors to see if we can put it in on a sliding scale. That's going to be coming back to council. So that if you're at the threshold level, you get 100% coverage. If you're at a next level, and that would be whatever amount, and we have social services staff here and health staff that can tell us what those amounts should be, then you would pay a small amount. So you may have to pay, 10% of the fee. So you're basically paying like a deductible, and then the province pays the rest. And if you're at a higher level, maybe one other category up, you might pay a larger deductible. That would still enable the people who are in the direst need to get it free of charge, but for others to have access to it at a much reduced rate. So I would like to suggest that staff take a look at that, and when this is sent to the province, that there be a proposal showing costs. And I know we have it because I had asked for regional staff to do this some years ago when we were looking at other supports for seniors. I think the transit subsidy was one, and there were a couple of others that we looked at, and we didn't proceed with doing it. But I think every year I'm going to make the request again. One of these years I'll get it. I just think it makes sense. And instead of giving everybody the free service, you give the free service to the ones who need it the most, and then the others pay just a little bit more. So I would ask staff, and Councillor Groves and Councillor Parrish, as part of your motion, if I guess it would more be when the motion is sent, that along with it, instead of just sending a motion, along with it would be a very strong proposal as to how the region of Peel would like it to operate, with very concrete numbers in place, which I think staff should be able to do.
Thank you. With that, those are all my speakers, as moved by Councillor Grove, seconded by Councillor Parrish. Madam Clerk, the vote over to you.
Thank you, Mr. Chair. This does require a recorded vote. Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demerla?
Yes.
Councillor Demerla in favor. Councillor Dasco? Councillor Dasco?
My job to do. Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor?
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini?
In favor.
Councillor Fortini in favor. Councillor Groves?
Yes, in favor.
Councillor Groves in favor. Councillor Innes?
In favor?
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
In favor.
Councillor McFadden in favor. Councillor Medeiros?
Favor.
Councillor Medeiros in favor. Councillor Palashi?
In favor.
Councillor Palashi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. And that carries. It's unanimous. Thank you.
Thank you. It brings me down to my final notice of motion, item 22.3, motion regarding community policing and special investigation unit reform, as presented to the chair what seems like quite some time ago now by Mayor Crombie this morning. Mayor Crombie.
Thank you very much. Yeah, it's it's a long day, folks. So this is something we've been talking about for a long time, and you know that Mayor Brown and I authored an op-ed on this issue, and we've been very vocal about it in the press and also on the police board, and I hope he'll speak to it too. So it comes after months of consultation with various communities, Black communities, other stakeholder groups, across Mississauga, Brampton, and as well police consultations on police reform generally. I want to say up front that we have the utmost respect and appreciation for the women and men who wake up bravely each morning and bravely put on their uniforms to serve us here in Peel Region. And I also want to acknowledge the hard work that Chief Nish and PRP have done to continue to respond to the community's concerns and actions that have been taken, including that very historic MOU that was signed with the Ontario Human Rights Commission, as well as passing the body-worn cameras motion, which will lead to more transparency and accountability and a continued commitment for engaging Peel community on the community's well-being. However, lots more can be done at the provincial level, and that's why we want to move things along a little bit, and that's why we're bringing this motion forward here today. We've both been advocating for both police reforms at the provincial level, specifically on the Special Investigative Units, SIU, and Community Safety Policing Act and Comprehensive Ontario Police Services Act, which have been passed by the Ontario legislature, but have yet to be enacted. So we just want to get that enacted. So we're asking Peel Region Council to call on the Premier with us, Solicitor General, so we can write the letter so that this piece of legislation be enacted and that we implement the recommendations that you're all familiar with in the Justice Tulloch report of 2017 on independent police oversight review and 2017 independent street checks review. And we also are calling for changes to the Mental Health Act, which I know we've passed motions on this topic before, to permit first responders other than police officers to respond to individuals experiencing a mental health crisis. So Mayor Brown and I, as I've said, we've spoken about this, including in the op-ed, which was entitled What Effective Police Reform Must Look Like. So we're very hopeful that the members of this council will assist us in getting this motion passed, and we can call on the Premier and Solicitor General to implement the things that they have already committed to, and then at some point we may also bring this to the police board. So Mayor Brown, over to you as well, please.
Mayor Brown.
Thank you, Mayor Crombie. And just to note, this is something that Mayor Crombie and myself have been advocating for quite some time. I know when I was in provincial politics, I was an enthusiastic supporter of the work of Michael Tulloch. And for those who don't know, Michael Tulloch, who authored this report, is actually a judge, but was a lawyer from Peel Region. And so he knows he's got a great sense of what is needed to have a better balance in our system, but he also has great insights into Peel Region. And I would note at the time, the Tulloch efforts had widespread nonpartisan support, and I think a push will help this become implemented. His recommendations on SIU, I feel, are a great step forward, important progress. And as much as we have authored op-eds and are continuing our advocacy to other levels of government, I think an endorsement from this council would be a strong signal, given the fact they are weighing whether to do this. And obviously Sylvia Jones is a local MPP and minister who will have a large say in this input into this decision. I really believe that given the moment in history we saw ourselves confront just a few months ago, where people were really looking at how to build faith and confidence in our policing institutions, this is one of those steps. And I think Chief Nish is a great advocate for us. He is ahead of the curve on issues of equity, and frankly, the steps he's taking, whether it's the human rights commitment and document bilateral agreement, whether it is the rapid adoption of transparency through body-worn cameras, and now this push for SIU, I really think it'll equip us well in Peel Region. And if we're all speaking with one voice on this, it will help us push this over the line. So I wholeheartedly support this motion with Mayor Crombie, and believe that this SIU reform is long overdue.
Thank you. Councillor Parrish.
Thank you to both of the mayors. You're doing an incredible job. This SIU reform is going to be well received by all the sensible people in the world. You'll never please all the agitators that want us to defund the police, but you will please the sensible people that have asked for reforms like this. And the change to the Mental Health Act to permit first responders other than police officers to respond is incredibly important. I want to thank whoever chose Chief Nish. He's doing a fantastic job, particularly in Moulton. I know I talk about it all the time, but things are so much calmer there now. And we've opened the community police station, and there's police cars in the parking lot all the time because they come in through a separate door into the basement and they do their reports there. So there's police around all the time, and just things are just settling beautifully. So this is welcome. I supported 110%, and I thank both of you for doing it.
Thank you, Madam Clerk. The vote.
Thank you, Mr. Chair. I've got a motion before me moved by Mayor Crombie and seconded by Mayor Brown. I'll take the motion as read. Requires a recorded vote. Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie.
Of course, thank you.
Mayor Crombie in favor. Councillor Demurla.
Yes.
Councillor Demurla in favor. Councillor Dasco advised that he had to leave for an appointment.
Actually, I'm just signing off now, but I
okay,
will,
great.
I will say yes. Yep.
Okay, thank you. Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac? Councillor Kovac? Councillor Mahoney? Councillor Mahoney? Councillor McFadden?
In favor.
Councillor McFadden in favor. Councillor Medeiros?
In favor.
Councillor Medeiros in favor. Councillor Palashi?
In favor.
Councillor Palashi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor?
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
Favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor.
Well
And
done.
that carries. Thank
And
you.
that carries. Well done. Okay, on to the bylaws. 23.1 would be bylaw 65/2020, normally standard, but in this instance, the bylaw to govern the Regional Council Code of Conduct and to repeal bylaw 1/2017. Patrick O'Connor's asked to speak, just a little bit of fine tuning and tweaking that he wanted to make sure everyone was clear on. So Patrick?
Yes, thank you, Mr. Chair. I just wanted to draw to Council's attention that in response to direction, I was asked to work with the Integrity Commissioner to refine some of the wording in the Code of Conduct being enacted here in response to a motion that Councillor Sato had brought forward. So that language has been refined. It is different than what Council or councillors would last have seen of the Code of Conduct, but it does reflect that refinement that we were asked to do. It enjoys the support of the Integrity Commissioner, and I recommend it as well. I just wanted to flag that there was this difference in the wording that in what you're being asked to enact today.
Okay, if everyone's good with that, also with thanks to Councillor Sato, it has been moved by Councillor Sato, seconded by Councillor Mahoney, that the bylaws listed on the November 12, 2020 Regional Council agenda, being bylaws 65/2020 and 68/2020, be given the required number of readings, taken as read, signed by the regional chair and the regional clerk, and the corporate seal be affixed thereto. Madam Clerk, a recorded vote, or just to show only those opposed? All those in favor? Are there any opposed? That is carried. Next up, that Section 4-2-12 of the procedural bylaw 56/2019 be amended and waived at this time in order that the 2012 November 12th, 2012, Regional Council meeting continue past 3:30 as moved by Councillor McFadden, seconded by Councillor Medeiros. All those in favor, are there any opposed? That is carried. And that brings me down to in-camera matters. So if I could have the clerk and team make sure that only those that can remain in camera virtually do so, and you'll let me know when we are good to go. Team says we're good to go in camera. Madam Clerk, for the in-camera protocol, please.
Thank you, Mr. Chair. I've got a motion moved by Councillor Parrish, seconded by...
And just a moment for the clerk to give me the thumbs up that we're back in public session. We are back in public session. Madam Clerk, over to you, the remaining business.
Mr. Chair, I no longer ask to split. I ask us to vote.
Very good. Madam Clerk, when you have the moment, the motion coming out, any motions coming out of in-camera.
All right, so we just have a few that we're going to go through. The first is that I need a mover and a seconder, and this is that the closed session report to the ROPA 30 Appeals Oversight Committee meeting held on October 29th, 2020 be received, and for the oral report from the External Legal Counsel listed as 24-2 be received, and further that the letter from the External Legal Counsel listed as item 24.3 be received.
Those are as moved by Councillors Paleshi and Medeiros.
And any objections?
Are there any objections? That is carried. Madam Clerk.
All right, and then we've got Councillor Parrish's motion. And I won't read the whole thing if Council...
Short
Just
reading.
the short reading of the
Short reading?
salient four
Okay.
clauses, please. So a short reading, all those in favor? Any opposed? That is carried for a short reading. Just the salient four clauses that are before us.
Thank you. Okay. Therefore, be it resolved that staff prepare a detailed application for a minister's zoning order to zone the ROPA 30 lands except for the triangle lands for residential community use. Oh, sorry.
Just to make sure we have complete clarity. And to be clear, there was just the one clause, and the direction afterwards is internal to us. That was my mistake. So it is the one main clause that is before us, and there was direction on three other clauses that came from the in-camera. Madam Clerk.
Okay, thank you. The motion that I have before me, that staff prepare a detailed application for a minister's zoning order to zone the ROPA 30 lands except for the triangle lands for residential community use as envisioned by ROPA 30, which shall include this motion and the detailed basis for it to be signed by the Chair of the Region of Peel and delivered to the Minister of Municipal Affairs and Housing at the earliest possible date. And further, that the direction given in camera to the External Legal Counsel and a regional solicitor related to item 24.3 listed on the November 12, 2020 Regional Council meeting agenda be approved and voted upon in accordance with Section 239(6)B of the Municipal Act 2001 as amended.
As moved by Councillor Parrish and seconded by Mayor Crombie. Madam Clerk, call the vote.
Thank you. Mayor Brown, indicated that he had to leave. Councillor Carlson.
Yes.
Councillor Carlson is in favor. Mayor Crombie.
Yes?
Mayor Crombie in favor. Councillor Demurla. Councillor
Madam Clerk,
Demurla.
she had a BIA meeting she had to attend, but I think she emailed her vote to you.
Okay, we would have to receive it, but thank you. Councillor Dasco. Councillor Dasco had to leave, so he's absent. Councillor Dillon.
Yes.
Councillor Dillon is in favor. Councillor Downey also had to leave. Councillor Fonseca.
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini.
Yes, in favor.
Councillor Fortini in favor. Councillor Groves.
Yes, in favor.
Councillor Groves in favor. Councillor Innes indicated that she had to leave. Councillor Kovac.
Yes, in favor.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Paleshi.
Ice cream. Yes.
Councillor Paleshi in favor. Councillor Parrish.
Wine, yes.
Councillor Parrish in favor. Thank you. Councillor Raz.
In favor.
Councillor Raz in favor. Councillor Sado.
Yes.
Are you still there? Thank you. Councillor Sado in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair had to leave. Councillor Starr.
In favor.
Councillor Starr in favor. And Mayor Thompson indicated that he also had to leave. Councillor Vicente.
Yes.
Councillor Vicente in favor. And that would carry.
That carries. Madam Clerk, what else do you have before the chair? I have a motion before me, moved by Councillor Sado, seconded by Councillor Fonseca, that the bylaw 69-2020 to confirm the proceedings of Regional Council at its meeting held on November 12, 2020, and to authorize the execution of the documents in accordance with the Region of Peel bylaws relating thereto, be given the required number of readings, taken as read, signed by the Regional Chair and the Deputy Regional Clerk, and the corporate seal be affixed thereto. All those in favor? Are there any opposed? That is carried. This one is moved by Councillor Kovac, seconded by Councillor Fortini, that the November 12, 2020 Regional Council meeting be adjourned. All those in favor? That is carried. Thank you to all, especially thank you to staff. We stand adjourned.